Muy buenos días a todas
Good
y a
morning,
todos.
everybody.
Bienvenidas y
Welcome
bienvenidos.
back.
A
Welcome
quienes están
to all of
entrando
you.
les invitamos a
To
tomar sus
those of you who are
asientos.
just getting here,
Buenos días a
please
todas
take
las
your
personas que
seats.
están aquí en la sala.
Good
Buenos
morning
días
to all
también
of
a todas
you
las
who are
personas que nos
present
siguen
here.
por la transmisión.
Good morning to all of you who are joining us online.
Esperamos que el
Welcome
día de
back.
ayer
We hope that
hayan aprovechado al
yesterday
máximo la
you
jornada
were
y
able
aprendido
to
mucho.
make the most
Bienvenidas y
of our
bienvenidos este
talks
segundo día,
and
segundo y último
meetings
día
and
de la quinta
presentations.
conferencia
Welcome to the
latinoamericana de
second
la
and
Red
last
Global de
day
Hospitales
of the
Verdes y
fifth
Saludables.
Latin
Antes que
American
nada, queremos dar
Conference
de nuevo las
of the
gracias
Global
a nuestros
Network
aliados
of Green and
estratégicos que
Healthy Hospitals.
permitieron,
We'd like to
hicieron
thank
posible esta
all our
conferencia.
collaborators,
Por supuesto, a
allied
nuestro aliado estratégico
and
Méderi, Red
strategic
Hospitalaria,
allies
gracias por
such
ser la
as
sede de este gran
Méderi
evento. Y a
Hospital.
nuestros aliados
Thank you so much.
institucionales.
And
En
to
Colombia,
our
Clínica Méderi
institutional allies,
Fundación Valle de Lili
Fo-
y la Liga
Valle de
contra
Lili
el Cáncer
Foundation
Risaralda.
and League,
Por Costa Rica, el Hospital Clínica Bíblica. Y por
League Against Cancer
Argentina, la Clínica
Risaralda,
Cruz
and
Celeste.
also Cruz
El
Celeste
día
in
de hoy vamos a
Argentina.
tener dos paneles.
Today we're
El
going to
primero,
have two
cambio
panel
climático,
members
transporte y
and
energía.
presentations,
El
transportation
segundo,
and
liderazgo e
energy,
inclusión
leadership
en la
and
gestión
inclusion
ambiental.
in
Cada uno de
environmental
estos paneles va a
section.
tener dos bloques y
Each
después de
one
cada
of
bloque vamos a
these
tener un
will
espacio
be a
de
block
15
and we
minutos
will
para
be
preguntas y
able to have a
respuestas.
Q&A
Para
session.
abrir esta jornada vamos
To
a
be
tener
able to
tres
open
intervenciones para
this
calentar motores.
session,
Y
we will
primero quiero
warm up
invitar a mi compañera Claudia
engines.
Lorena
I
Paz,
will
que
invite
ustedes ya
to come
conocen
to the
perfectamente.
microphone and
Es
podium
facilitadora
my
técnica de
colleague
proyectos
Claudia
para
Paz.
el
She's a
equipo de América
facilitator
Latina en salud
for
sin daño.
Latin American
Y ella nos va a
projects on
socializar
behalf
la guía de eventos
of
sostenibles que desde Salud sin daño
Health
hemos
Without Harm,
desarrollado,
and
que
she's
se
going
encuentra
to
disponible de
speak
manera
about
exclusiva
different
para los miembros de la Red Global de
sustainable
Hospitales Verdes y
events.
Saludables. Y antes de darle la
And
palabra a
before
Claudia, quiero aprovechar
yielding
para
or giving the
recordarles a
microphone
todas y todos
to
nuestros ponentes que,
Claudia,
por
we'd
favor,
like to
el día de
remind
hoy hablemos de manera
our
pausada. Recordemos que este es un
conference
evento híbrido
and
que se está
its
transmitiendo en línea
presenters
y
to
que está
please
siendo
be
transmitido
mindful
también
that it's
en
being
inglés.
translated into
Entonces, para
English,
que
to
podamos
please slow
escuchar
down,
bien, quienes
to
están también escuchando en
modulate
inglés, por
your
favor, hablemos de
pace,
manera pausada.
and hopefully
Con
we
eso le
can
doy la
get
palabra a
that
Claudia.
translation
Bienvenida, Claudia.
well rendered and accurately rendered. Thank you. We welcome Claudia. Thank you very much, Andrea. Good morning, everybody. It's a pleasure to greet you again today. Yesterday, we had a very productive, super productive day, and today we're going to start with the Sustainable Events presentation. Let's go back one moment. I think we need. Can you please display the event presentation? We're going to start this session with the presentation of a resource that we developed at Health Without Harm for the development of sustainable and healthy events. This is a very exclusive resource available to all members of our global network, but any of you who wants to join and become a member can use it and access it at www.saludambiental.org. Okay, we now have the presentation on the screen. This is the cover page of our event development. A healthy and sustainable event is that event where we respect social, sustainable, when making and putting together an event. In this case, an event organized by Health Without Harm and Méderi Hospital. This was an event that took place in the city of Cali, as you can see on the screen. And those are the panel members. Again, this is a very exclusive resource and tool. Once you become a member, you will have access. And to those of you who are following and joining us online and on our YouTube channel, we will give you or send you a link so that you can explore it and become a member of the network. We have included 3 stages of a sustainable event. First, preparation, all the logistics, the planning stage, where we're going to do it, whom, with, what topics or subject matters, what's the schedule, what will be the objective. And here's where we talk about the selection of the location, the language, if we're going to have simultaneous translation, which is the case today and yesterday. When will it be? The type of audience we will try to reach. Who will be our suppliers? what criteria are we going to require from suppliers, what's the local and institutional support, what type of alliances are we going to have, and we now have or move to the development stage, confirmation of the academic agenda, attendance, the guide or the script, active pauses, what type of exercises or dynamic are we going to do on the field, what type of decoration, gifts, souvenirs, what will be the type of food that we're going to serve, beverages, refreshments, will we provide any physical activities that we can recommend, records, proofs, gifts, and souvenirs. And then the assessment or evaluation, which includes measurements and development related assessment of quality. We're now going to detail all the criteria that appear on this guide. It's a very ample, very extensive guide and very detailed. But in this case, the first one is the selection of the location. You can see that we're now in a hospital. We try to host our events in sites or campuses that belong to the network, and the location of the event does incorporate certain aspects, characteristics. For the place to have hiring policies with gender equality, for the location to also have some access and fulfills the needs for people with disabilities, different abilities, physical, sensorial, motor type of skill limitations, or for this location or site to have recreation type of spaces, for the space or location to have natural lighting. At this time, we are inside an auditorium. So does it have windows? Do we have a way to control the lighting? Is the flow of air and lighting natural light? So it's important to respect this type of criteria when selecting the location. When we're going to do an event, whether it's a seminary, conference, or a meeting, we hope and try to respect this criteria. Also, if we have a breastfeeding mother, for her to be able to breastfeed her baby, for the location to be a non-smoking location. So these are some of the social criteria. Also, there come the environmental matters, the processing and recollection of waste, energy efficiency, refrigeration, water, comprehensive water management, artificial and natural lighting spaces for us to be able to control the temperature where we are developing and having the event, for them not to deliver or give out bottled water. Does it have a bike parking space? Does it have access to vehicles? All these items and requirements we're trying to summarize and give you an overview. Also, it's important for us to be able to get to the location either by foot, walking, or if the location is near the hotel, or before we actually hail a cab, an Uber, or do carpooling. On this image, I want to show you and share you on this slide, the one on the top that was in 2015, Health Without Harm, with gardens, vertical gardens. And then the lower image was in Pasto, Colombia. Also, I need to highlight that we have large windows, and we decided, depending on the type of work we're doing, not to turn on artificial lighting. And we also have criteria for the type of impressions or printing that we need to do. We have also promoted some of our reports, hospital reports, planet, environmental planet type of reports. And also, these editions that have been printed have been respectful of environmental guidelines. The type of paper we select, the type of ink that we select, and we always prefer to select local suppliers. In this case, there are no printed matters in this event. So Whenever it is available, we prefer inks that are vegetable-based, water-based, for any hiring policies with equal gender equality policies, for the inks to be mineral-free, oil-free, for us to be able to print on both sides or of the paper, also to be able to do any binding type of activities using paper, also for translation services, as is happening today, for the batteries to be rechargeable. In this case, our supplier for simultaneous translation, they comply with Cali and they provide the service in Cali, Bogota, Medellin for them to have social environmental policies in place and for all the team members to have or use rechargeable batteries to have experience in environmental matters. As you have noticed that very specific terminology and concepts are used. Now, when it comes to food services, this is also that has a very specific and its own requirements. Look at the image on the slide. It's important for food and any type of service to be healthy. And when we have disposable items or products, as is the case for the coffee cups, for this coffee cup to last the whole day, and we try to use and serve beverages and refreshments so that they are disposable, that they can be reused. We promote fruit consumption or try not to use processed meats or high content. What you can see on the screen are photographs that were taken at various events that Health Without Harm has hosted. Also into consideration food allergy type of items or gluten-free type of considerations or lactose intolerant type of hosting and lodging. Those people who are lodged and staying at a hotel, as you can see, some of these hotels, for the most part, that we select, try to avoid any disposable or single-use plastics. We try to select hotels that are nearby, well placed, near the site of the event or the venue. At this time, the hotel where we're currently staying, they have published their policies. These are some images of hotels where we have stayed before, also with our assistants. As you can see, these are reusable containers. In this case, this photograph, the hotel where we stayed doesn't use the sugar envelopes or little cartridge. And when it comes to energy consumption, social policies, waste related transportation, open spaces for recreation, and the proximity. And also during the planning stage, for us it's very important to establish alliances. Most of our events, most conferences have some type of support or alliances. In this case, the fifth in Latin American Conference made a strategic alliance with Méderi University Hospital. They are our main and principal allies. So we have developed a guideline when it comes to corporate and institutional alliances. And as my colleagues have mentioned, the 5 institutions that have gotten involved and are participating, so they offer and provide support in different ways. And also on the left-hand side, you can see a photograph of this slide, which makes a statement. This is a hospital in Costa Rica. So different ways to get and provide support. Now, typically we do this with different members throughout the hosting of the event. Active pauses, active breaks. So we promote this type of spaces for the site to have refreshments, simple short breaks, guided tours, It all depends on the dynamic and the structure of each event, but generally speaking, we promote this type of activities. On the screen, you can see on the right side the active pause back in the 2018 conference in the city of Cali. So, salsa being the typical classic traditional dance, we did a little dance. Otherwise, we tried to access gardens or green areas, relaxation type of exercises. In today's case, during our refreshments, we will have a mini exhibit of our exercise and workshop we did yesterday. So we try to take a break, get some fresh air, and relax during the event. When it comes to decorations, records, we try to make sure it's necessary. We have passed out and handed out buttons, or our souvenirs always be respectful and comply with certain requirements, such as concerning chemical substances, PVC free, plastic packaging, for these to be reusable several times, also to comply with printing requirements. So these are some of our criteria requirements, and these can be seen, read, and explored or researched in our guide. And we have different annexes or attached documents that you can read. And the measuring of the carbon footprint at an event, it's very complex when it comes to hosting an event because people come from different countries, different cities around the country, and there is a lot of energy and electricity consumption, traveling, commuting. So we try to measure the carbon footprint thanks to our alliance with Jamer Wright, and we do the measuring of the footprint of people who have commuted and traveled to the event. And we then make decisions. The same way you do your inventories, we assess what was the footprint of this event, and also that we recommend that when you board a flight, we make some recommendations and to try to work with airlines. Finally, our events always have a follow-up, either through a survey. You will also get some type of survey or questionnaire follow-up survey as to be able to assess content, location, quality, and Méderi Hospital will also conduct a survey to assess the quality of the event. We always try to publish on our website all the memories. So on our website, you're going to find the memory, USB memory and files that contain our presentations and our events. And with this, I am now closing. I will yield the microphone to the next. I am somewhat deaf now. Thank you very much, Claudia. And let's take advantage and make the most that we are in a sustainable event. And when we get the survey and the questionnaires, let's make sure that we can the global network. We remind you that membership to the global network is completely free. And for you to start and join and become a member, you need to fill out a form which is available on our global network website. And to those of you who are joining us online, we will also show you a link on the chat room. And please, to those of you who are listening to us online, please remember that you can send us your questions and queries. I am now very pleased to present a person that we work closely when it comes to climate change and management, Diego Moreno Heredia, who is the local regional coordinator for the Ministry of Health and Social Protection in Colombia. Welcome.
Muy buenos días.
Good morning. Well, thank you. First of all, thank you very much for the invitation to be here. Thank you very much to Health Without Harm organization. Thank you to the University Hospital Méderi for hosting this event. Today, I greet you on behalf of the Ministry of Health and Social Protection in Colombia, and I'd like to share with you some of the progress and advances that we have made with regards to climate change impacts. The presentation that I am going to share with you will be based on these four main points. And these are subject matters, of course, that you have already reviewed, but I will give you a general context as to how we are perceiving and experiencing climate change in the country and specifically in the health sector. What are the current regulations? That is, some of you may already know it, but perhaps not everybody. The commitments when it comes to climate change, what are the advances or progress in adaptation and mitigation related to climate change, and what are the challenges when it comes to climate change from the healthcare point of view. So, to show you a general overview, I have taken this graphic or share from the World Health Organization, where we're speaking about mitigation and adaptation on separate channels. Nevertheless, when we look at how an establishment, a healthcare institute or center must be prepared for climate change, we need to talk about adaptation and mitigation. It's clear that you've been talking about mitigation, emission reductions, but we also need to talk about how to face those variables when it comes to climate change on a regional context. For me to establish the vulnerability level, I must consider and take into account, just click here. Yeah, thank you. I must consider only or take into account the ways of exposure. How am I exposed? Finally, the threats are found there. The flooding is real, the hurricane exists, mass remotion type of phenomena, but I can adapt, and in a certain way I can generate some mechanisms, mitigation mechanisms that can help me to generate and yield some benefits. In this way, there are some important factors such as demographic, biological, social, economical, cultural factors that truly affect or determine how much that exposure is going to affect me. On the other hand, that is going to determine the sensitivity, but it will also determine how much adaptation capability do I have and how resilient is the health center or the health facility based on its governance levels, how the workforce and how those health professionals are truly prepared, the information, information systems available, and we should always have information systems, at least in our region, in our local site. Does it comply with those requirements and activities? And how that hospital could be affected or impacted, and how its continuity could be impacted when it comes to events. In this way, I can increase or diminish the risks, depending on climate-related illnesses. Perhaps in some regions, some of those rates will go up. Perhaps in some other areas, their adaptation capability will be greater. So there are multiple illnesses that are going to increase and put pressure on the healthcare system. And at the same time, there will be a morbidity and a mortality rate. But how do we then deal with motivation? If I am working with a healthcare institute entity and it's being resilient, but am I also creating an environmentally sustainable and protective? Can I make any efforts to reduce? Are there any mitigation mechanisms? Méderi, in fact, our host, does have in place, and nationwide or other countries that reduce the exposure to high temperatures. And finally, this is a mitigation action and it becomes an adaptation action. In Colombia, I want to mention that based on the third communication related to climate change, along with the United Nations, Colombia ranks 33rd when it comes to climate change risks. This means that out of all the municipalities in the country, all of them have a certain level of risk. They may be low, but they all have a risk level. As you can see here on this image on the map of Colombia, it shows me the darkest colors are the greater or higher risks regions because of climate change. And also, when it comes to all climate change events, they have to do with hydrometeorology events. So this means adaptation. But when it comes to mitigation, Colombia has also been very committed. Perhaps in the healthcare system, there isn't a specific mitigation goal, but on a nation country level in Colombia, because of our commitment, because of its contributions to reduce 51% of emissions that were calculated back in 2014. This is a very ambitious goal, extremely ambitious, but this is where all the sectors have to contribute to that goal of emission reductions. Besides this, at the COP26, it was announced the commitment to decarbonize the climate strategy in the country. And Colombia has then added and joined from the Ministry of Health to some commitments, and that the United Kingdom has been leading in terms of climate change. The current PND, National Development Plan, one of them has as its aim a productive economy and the struggle against climate change. This means that among those main goals from 2022 through 2026, we have some concrete specific goals: energy efficiency, specific goals about leaving aside the use of fossil fuels. And of course, it's not so easy as it may sound on paper or read on paper, but at least we have a pathway towards mitigation. So, when it comes to mitigation and adaptation, we understood, related to current regulations, we understood how we could adapt ourselves to counteract cases for climate-related sensitive type of illnesses, and some sector-based plans were established back in 2015, but in 2018 we started to talk about comprehensive plans for climate change. This is the law 1753, and we have to carry out and manage a healthcare point of view plan. So in this way, the healthcare sector has participated in some of these goals that were established, and currently in the law that is in place in the country, this is what we are developing. When it comes to advances in adaptation and mitigation, the work has been much longer in adaptation than in mitigation. We have some documents that we can also share with you through the website files that will be available. We also have climate efficiency when it comes to service rendering and provision, emergencies and disasters, and the promotion and prevention. We also have studies that we have done when it comes to certain climate change, a specific guide for adaptation for certain territorial or locally based And we have some goals that are part of this plan based on the Paris Agreement, and these are also part of the climate action law. This has to do with promotion and prevention and also the service provision. And when it comes to mitigation, what do we have? Mitigation actually goes hand by hand with health without harm, with the calculation of the carbon footprint in the healthcare sector. Before, we had done a review where we published a mitigation guide, a very basic guide, but that's the first step from the Ministry of Health as to how we view and see activities in the healthcare sector for the reduction of emissions. All of them almost addressed and aimed at hospitals. We did this in collaboration with the infrastructure, with the subdirection of service provision, emergencies, and epidemiology. You will find also some examples, some successful cases where we have some, and it has been a great advance or progress. And the project that we are currently working on and developing when it comes to mitigation, and that's what we're doing with health without harm, the calculation of the carbon footprint. So this is the right moment to thank most of you or many of you who have participated virtually online and also on site, because this will add, when I talk about the current legislation and regulation, it's no longer an isolated effort that you're doing as an entity. You are actually providing the national government the data and the information so that we can be more clear and be able to determine the public policy level and how we're going to generate and implement some policies. What are our commitments by, if we're going to reach a certain percentage, and are we committed to reducing those emissions? But that's what we're going to determine. The percentage will be determined based on reality, based on the real facts that the estimation or calculation will yield. This is within a framework. You have many tools, policies. As you can see here, this was published. Regrettably, it wasn't promoted and distributed, but it was published in Semana, the weekly magazine, the Ministry of Health website, and it addresses several processes that we have been doing in green hospitals and safe hospitals, and now resilient hospitals. And it aims to the commitments when it comes to the 51% aim or goal for the country and for the comprehensive plan of climate change. I can't continue without mentioning that this is an action, a sustainable and environmental action, of course, but most of the actions, as you well know it, you know it better than I do, most of these actions that yield or generate atmospheric pollution or contamination, and those pollutants become greenhouse effect gases, also comes from other sectors. And those other sectors are determining what the health level is for the population. So it's clear that the great or biggest source of contamination or pollution environmentally in the air quality, and it's actually causing a lot of illnesses and adverse conditions in the country. We conducted a study, calculations of the co-benefits when it comes to or related to mitigation. This means if we were to comply with the 51% that is being laid out and proposed in the country by 2030, what would be the benefits for the health in terms of mortality and morbidity and of economic or financial costs in healthcare? We did this with the World Health Organization and the Stockholm Health Environmental Institute through a program which in fact it's not open yet, open access, but Carbon Age program is the name of this. What it does, it takes pollutants and contamination data and morbidity and mortality data of the country, as well as economic and financial costs as to how much the country is investing to deal with and address those illnesses that deal with air quality related sickness. And when we do this economic assessment on the platform, we also have a publication of this document. If this were to comply, this scenario was to be fulfilled, there are three scenarios. One of high emissions, 51%. One is 31% or close to. If we were not to comply with the emission reductions only by 31%, and another scenario known as business as usual, seguir doing it as we're doing, status quo. So comparing these, we could establish that it would evidently and noticeably reduce the criteria, and the greenhouse effect gases would be reduced 3% for methane, 22% for black carbon, 58% for CO2, and just like that, with each of these gases, that would yield or generate a benefit to the overall health. It would, the study estimated that more than 3,800 deaths would be prevented, and that the cost, when it comes to money, would be the savings. It would be a great level that would be representative in Colombia. It's a lot of money. So then, I only have 2 minutes left. I am about to close my presentation, and what I want to tell you here is that those mitigation actions finally come about and yield some collateral benefits for the healthcare sector that you may also see from a local point of view. But if we add up all these mitigation actions and we add all the projections of emission reductions and greenhouse effect gases, they will also contribute to the reduction of atmospheric contamination, and also when it comes to morbidity and mortality rates. So we will be able to share this information with you, as I said. And in closing, I will share with you what our challenges are. Those challenges to promote this not only in the healthcare sector, but it also should include everything that you are doing, all the activities that other sectors are doing, do have an impact on the healthcare system, and also on the health and well-being of people. It has to be acknowledged with a focus of climate justice and human rights, to establish collaboration or collaborative mechanisms when it comes to other sectors, to involve other healthcare sector actors, not only hospitals. There are many actors that we have yet to get involved in these mitigation actions and adaptation actions. And finally, to promote an interdisciplinary work or effort. In many of your hospitals, I was listening and hearing clearly what has been presented. I listened to the Peru's experience, Chile's experience, what Monica spoke about in Valle del Lili, what Suara spoke in or from Cartagena, what Col Subsidio was able to share. Those are situations, or rather, these are actions that are being done through mitigation and that should be communicated to or conveyed to other sectors. So with this, I finished by telling you that we hope that the leadership level that you have attained, that you will keep up, you will maintain it. And from the Ministry of Health, we hope to continue to follow up and to support you, and probably we will be communicating and in touch with some of you to carry out this public policy exercises. Thank you very much.
Muchísimas gracias, Diego.
Thank you very much, Diego. As you will know from our organization, Health Without Harm, we acknowledge the commitment that the Ministry and the government of Colombia has related to this agenda. And also, I'd like to acknowledge with people present here and those of you online, because Colombia is also at the vanguard when it comes in South America, and we'd like to acknowledge and thank you to all of you who are part of the carbon footprint project, and I know some of you and several of you are here. I now have the great pleasure to share and introduce a great ally who has Dr. Estela Hardening. She's the director of the South America Center, and from Peru, she's going to share with us the findings about this report, 2022 version from the Lancet Countdown in South America. Welcome. Hello. It's a pleasure to be here. Can you hear me well? We hear you. We hear you very well. I cannot see the slides, so that I hope that you are displaying or projecting them on the screen. Great. Thank you very much for the invitation. It's a shame that I was not able to be there in person, but let's get started. It's an honor for me to share with you the Lancet Countdown in South America 2022 report about climate change. This report was published in March, and it was the launch, a regional launch. But it's a pleasure for me to show you again and to share the information. And it's always worth it sharing it. I will not talk about what we already know about climate change. We know that climate change affects people's health. The most important about this report is that the reason for which this Lancet Countdown South America comes about and is born, we noticed that there was missing information, missing data related to climate change and our own capability to behave, to react when it comes to adaptation and mitigation as a country and as a region. So there was a gap, and there was a need, an urgent need, to compile, analyze, and produce information and research that addresses this problem. So it's important, and in a giant manner, that how we can no longer do it individually. We need a group of people involved. So, on a global market, this is the global initiative that this report publishes about climate change and health for the last 7 years. It decides to set up regional centers, and the Lancet Countdown South America is one of those centers. There will be a report next year where we'll be including countries from Central America. So we're actually becoming Lancet Countdown South America to Latin America, including Central America, which is a pleasure for us. We will continue with the same mandate, with the same guidance, climate change, over health, and the well-being of the person. Next slide. Just for you to see the dimension and magnitude, Lancet Countdown South America, it's independent and multidisciplinary collaboration. It includes 28 researchers from different disciplines throughout this year to be able to put together the next report. What we have done is to expand our coverage and to invite new researchers from Central and South America. For the drafting of this report, we only worked with researchers with 8 researchers: Peru, Chile, Argentina, Colombia, Costa Rica, Uruguay, and the US. This is being expanded for the next one. Next slide, please. So then our work in Lancet Countdown includes some global methodologies in 5 different groups. These 5 groups are impacts, exposure and vulnerability when it comes to climate change, adaptation and resilience plans for health, mitigations and co-benefits about health, economy and finances, because we don't do anything without, and the political and public commitment. We have assessed 25 researchers within these 5 domains or groups. Next slide, please. So then, Our report has 4 clear messages. And the first key message is that climate change is harming or affecting the health of South American people, and it has adverse effects that are accelerating, and they will affect disproportionately the most vulnerable populations in South America and around the world. And this dependence will continue unless we take important and immediate measures. Next slide. This will be the conceptual framework as to how Lancet Countdown sees the interaction between climate change and health. As you can see, it's connected or interconnected in multiple ways. On the purple section or boxes, we can see that the impact of climate change is subject. We will have a food plant. We sit in the region where we have mental health problems, which are so difficult and challenging when it comes to monitoring, but there's a gap and a deep void when it comes to information, when it comes to also the type of different exposures to heat, and in most vulnerable persons, we have direct and indirect and also different infectious diseases. This first work group, we have indicators in those 4 groups. So we started to examine the different dimensions of heat wave, overexposure and vulnerability, and finally mortality. Next slide, please. So we already know that the exposure to heat is very extreme and has very grave consequences when it comes to health. What we have been doing, and here in the region you can see on this graph, there is an increase in temperature as anomalies that can go from 1 to 2 degrees in several parts of Brazil, Chile, Argentina. And we have noticed exceptionally intense heat waves in Argentina, Brazil, Chile, Paraguay, and Peru. We also know that the older populations, older than 65, have been impacted and very vulnerable to the effects of these heat waves. We can see that the exposure to those heat waves for children has increased almost in 12.3 million per day person, and for adults 12.3, 2.35 for children and 12.3. What does this mean for mortality for older adults? We have seen an increase of 160% of premature mortality due to the heat in the 2017 period, which would be the baseline that we have put together. The most affected countries are Brazil, Argentina, Colombia, and Venezuela. In the same way, we also have an indicator how much is that mortality being reflected on the costs. We have tried to give a value to monetize these premature deaths. What we have concluded, these premature deaths equal to the incomes of 500,000 people by 2021. Climate change has a whole comprehensive impact. It's not only individual, it's on the population and eventually on the economy of the country. Next slide. The next indicator we have are forest fires. The exposure to forest fires has increased in 9 countries of the region, and it could represent a systemic type of risk, multiple for the health and well-being of people. It could cause direct damages, such as death. It could cause pulmonary acute type of diseases, increasing morbidity and mortality, and it could also yield the loss of goods and property. On the region, what we have noticed on this region is that there has been an increase when it comes to being exposed to forest fires. But this is different between countries. For countries like Uruguay, Paraguay, and Peru, we have noticed that there's an increase 3 to 4 days, and in countries like Argentina and Chile, we have seen between 14 and 20 days. we still have to calculate what the exposure is for people per capita and the exposure when it comes to forest fires. And finally, we need to calculate what the impact is over or on mortality and morbidity. These are indicators we still have yet to conclude and complete, and we still have some additional methodologies. The next indicator, please. It has to do with the climate suitability for the transmission of infectious diseases. What does this mean? Is the change or the increase of production, precipitation, temperature, and population density. So this indicator gives us an approximation, it's a proxy, to be able to understand how the expansion of this vector is actually behaving where there was none before and we were not prepared for it. We know what we have on this slide are two things. The most important, that all climate change for all countries for which we have data have increased by a 35.3%, and this region being endemic for dengue, it's actually causing for the vulnerability to increase in certain countries. This vulnerability is being experienced in the South Cone region, which is endemic, as we have seen before, or it has been experienced a dengue increase in most Córdoba, Santa Fe, Buenos Aires, in Argentina. So we need to be conscious and fully aware that this vector likes to move around, likes the migration of people. It likes the urban levels that we have in South America, where we don't have appropriate water systems, sanitation. And this is what we're going to be seeing in Peru this year, with a very solid, strong epidemic in Lima, and it continues in the northern part of the country. Next slide, please. When it comes for this indicator, we can only see the changes that this has experienced when it comes to the nutritional content for several crops. And as a consequence, when it comes to food safety, we still have yet to calculate or estimate what is the impact that this is having over nutrition. But what we do know without a doubt is that there is a reduction in the wheat, summer, winter, for the entire, and rice for the entire region. And also as an additional comment and to give you a context for this indicator, what has been reported in 2020, we had 168 million people in South America that were experiencing food safety issues. By 2021, just with the COVID pandemic, this number has increased to almost 40 million persons, especially for women when compared to men. So actually, we can no longer afford that the climate change is not going to have an impact on the food safety of a region. Our second key message is that our countries need to be prepared in order to be fully aware. Thank you for showing the next slide. Here we also have a group of indicators where we try to understand what are the adaptation and resilience plans. We're basically focusing on the health system, since we consider that the healthcare system, it's the only way to diminish or lower social inequality issues. And we have a plan for the adaptation. I listened to the previous presenter when it comes to certain policies. That's the roadway we need to be on to be able to have a resilient healthcare system. Here we have 7 indicators. I will only mention next slide. The next indicator goes back to 2021. If this has changed, we will probably include it in our next report. By 2021, Brazil was the only country that reported to have completed an assessment or evaluation on a national level when it comes to climate change, vulnerability, and adaptation plans for their country. So when they In fact, they report that they have completed this evaluation. They indicate that this assessment reports the new development of a health policy, but it does not include the resources and funding. I can only speak about my own country. This also happens in Peru, where the adaptation plan has been put together, but it has not been identified what are the financial plans, what are the human resources and financial resources to be able to carry it out. Next slide, we talk about risk assessments and climate change on a city level. So what we see in this region is that we are creating or drafting national plans, but we also have to take into account there are some certain climate change. What we can see quickly on this slide, Brazil and Argentina have reported cities in Brazil and Argentina, extreme precipitations and floodings become a very concerning area, and they are actually thinking about adaptation to counteract. Peru is thinking about shortage of water or drought, Chile and Colombia forest fires, and Colombia and Brazil climate migration. Let's go to the third message. The third key message that we should continue and accelerate efforts to get to zero carbon emissions. This is something that we need to be in alignment and related to this. Here, next slide, we can see what are the impacts and the effects that mitigation has on co-benefits for health. And we also have three large areas: clean energy, premature mortality due to contamination, land-based transportation, and diets. It's important, and I think it was interesting for me to include this slide. We, in our region, we have access to clean technologies, and we have the exposure to everything that we work when it comes to environmental pollutants, and the exposure is responsible of 7% of these levels on a global scale, especially if food is being cooked with wood, firewood, or coal. For example, a household that uses firewood is experimenting inter-domestic 100 milligrams per. In our region, we have access to clean energy. Nevertheless, our fuels, clean fuels, we're taking into consideration gas. It's clean, but it continues to be a fossil fuel. In this way, we need to start moving towards cleaner type of energies. Next slide, please. This indicator is a very interesting one. This, where we can calculate due to the atmosphere contamination, we have calculated premature within the region. 27% of these were attributed to transportation, and 14% can be attributed to waste-related issues. In the same way, Chile and Peru have the same mortality per million, and Peru has the worst atmosphere contamination in the region. Next slide, please. Finally, this is very interesting and very important for countries with the agricultural expansion, and also when it comes to carbon or dumping carbon into the atmosphere, but also high consumption of diets related to red meats is having a great impact on mortality. What we can see is that if we could reduce this type of agricultural levels, a 28% of these emissions could be decreased. In the same way, we could reduce almost a 23% or 150,000 premature deaths related to the consumption of red meats. Most of the mortality are being experience in Argentina and Brazil, which are the countries that most consume red meat. The fourth key message: South American countries need serious financial commitments to be able to address the challenges by climate change. Within the economy and financial sections, we want to calculate what is the economic impact through climate change and the net value for subsidies. Here I am only sharing two indicators. Next slide. This slide is showing how much money we lose as a country, as a region, due to the reduction of the work capability related to heat. So the heat not only causes premature deaths, morbidity, mortality, but it also, we lose the capacity or capability of a great percentage by the population, those who work in agriculture. Those are the most affected people. In fact, we have been able to calculate and estimate that there has been an income loss related to 0.68 of the PIB, or the gross domestic product. Next slide. This impact, or this indicator, what it tries or aims to find the net value of subsidies or grants when it comes to fossil fuels and the carbon cost or prices. The data should be published, but it's being worked on. We only have it from some countries. What this slide shows us that in our region, or these countries, continue to subsidy fossil fuels equivalent to almost 27,000 millions of US dollars. If this were to be, if we do or make a comparison to what these countries give as a budget to the, or contribute to the healthcare system, subsidies from Venezuela, Ecuador, Bolivia, and Argentina equal to 85.6, 29%, and 23%, and 15% of their health expenditures. So we truly need to do a structural change within our governance to be able to really, truly change the way in which we are so dependent to these fossil fuels. Finally, we have the policy and public commitment. We have a range of indicators. I'd like to go to the next slide. And I want to share this with you because one of the persons who is organizing this conference is the one responsible for drafting this. The media coverage when it comes to this has been increasing from the very start, especially when they converge, the two subject matters come together. Nevertheless, what we see in countries where the most published articles, Mercury in Chile and The Nation in Argentina. Next slide, please. And finally, what we have also noticed, an increase when it comes to issues related to climate change. Most of the articles that were published are coming from Brazil by Brazilian authors. Nevertheless, we're still lagging behind when it comes to the impact on healthcare, infectious diseases, which makes sense, when it comes to the percentage of respiratory illnesses, but we're not truly seeing what are the impacts when it comes to adaptation measures or mitigation measures. And that's where we need to focus on. If I am not mistaken, the previous presenter also spoke about a study of mitigation and adaptation, but this has to be constant because we don't have much access to it. Well, here I will finish by saying the four key messages that we have discussed. We know that most vulnerable are people in South America, so we should not wait to act, and we require and demand our decision makers and our policy makers. Thank you very much.
Muchísimas gracias, Estela. No sé si lo escuchas, pero
Thank you very much, Stella. There is a warm applause for all of you, and we ask you to stay and remain with us so that you may address some questions by our audience. the Lancet Countdown and the institution or the different entities that make up, they represent the scientific authority when it comes to climate change and the impact on healthcare. So let's take advantage of Dr. Stella Hartinger being present and also for this exercise to scale data which come from the South American region, which are very relevant. And thank you, Stella, for acknowledging the participation of health without harm. Well, now I'd like to open up the space for questions that you may have. And those of you who are here and those of you who have joined us online, I think we may have sufficient time for 2 questions. Could you please tell us what entity or institution you come from and what your question is about? Good morning, everybody. My name is Montero Ramirez. I come from Tunja University Hospital. I think it's something that we are addressing when it comes to the importance of the environmental actions that we can do per or from the institution. A question for the ministry. Should we also celebrate the type of tools that you are developing? It's a very innovative type of tool. For 3 years or so, we've been working on something similar. And also, you have referred to mitigation. I simply want to request accuracy or precision about that public strategy because this is being built. When it comes to the adaptation, we need to lay out some specific criteria. In the yesterday's exercise, there's a level of appreciation to diminish the source. But what do we do when it comes to mitigation, adaptation outside of hospital or healthcare institutes? And our colleague from Chile spoke about compost and fertilizer transformation at the Psychiatric Institute. This shows that there are external scenarios at institutes. We've been working with the carbon compensation. I'd like to know adaptation when it comes to the public policy, how the ministry can help us to establish a platform to be able to measure the capture of oxygen through those important indicators. Thank you very much. Hello. Thank you very much for your question. In fact, yes, we are on that pathway. When it comes to adaptation, as you were saying, we have made some progress. We're now visualizing not only in the hospital healthcare system, but you are very correct. If we want to work with the healthcare sector, it's not just hospitals. Hospitals provide a service, but we also need to speak about all the entities, institutes registered or the Ministry of Health itself when it comes to mitigation and adaptation. And I want to highlight that what we're doing when it comes to adaptation is so valuable because we're doing it from the local level to be able to understand it much better. We're not sitting just what we think or deem. We're learning from you as a Ministry of Health, from all these exercises that you have mentioned. We, for example, the hospital of San Juan in Tunja, with those good experiences to give it feedback, and we're going to do is consolidate. And also, we believe this is the right pathway, supported by infrastructures, service provision, because it's not just about environmental health service, it also relates and involves different entities. And when it comes to adaptation specifically, we have a vision of how we should attempt to do it. It's very expansive. I can share with you the executive summary of how we see the adaptation in the healthcare system, but also there are early benefits. It's very well associated with emergencies or urgencies, how a hospital can become resilient, not a safe hospital at an ER level, but for the hospital to adapt and to prevent actions based on the information and the actions in their local region. I hope I have addressed your question, and I think there are many things that are yet unknown, and perhaps through the files online that will be uploaded and available, we can get that information. Thank you very much, Diego. Now we have a question coming from our chat online. Is Dr. Esther still here? Stella, how do you build the climate change vulnerability indicator, and what are the variables that you would consider? That's a very complex question, and you must understand that this involves the work done by 28 people. I cannot precisely reply to you what the methodology is, but I can share some of the content of the annexes that we use to put together the report. But what I can share with you is that for this year, we're trying to generate an indicator that takes into consideration what the world challenge, what constitutes a climate resilient healthcare system. They have 6 large areas the previous presenter commented upon, and they have great indicators to be based on. What we're going to do now to try to put together to build an index that includes and encompasses these groups in adequate infrastructure, not only for a single hospital, for the entire system. And that's when we have inequities in health, urban and rural. We're going to try to include the early health system indicators, which can be done independently. We will try to include an indicator that talks about financing, included into the criteria that the World Health Organization recommends for a hospital, for a health system can be resilient. So we're going to improve upon those indicators. We're going to try for these indicators to tell us or point the way where we need to go. And as I said in the mission, I can share some of this methodology and information that I'd like to mention also, that we try to improve this on an annual basis. One of the things that I can mention about how we build and construct our indicators, databases, the availability of data that we have in our region. The only way to be able to generate is to use open source data. Information that comes from the country, information per country reported to the OPS or to OMS within the annual survey questionnaires. So we would love to be able to get closer to each of these ministries of health. This is something that we've been discussing, how we can work closer and better, but it also means that each country reports in a different way. So at some point, to lead an observatory forum through PASCO, Gascono, or other partners that we have very present in our region, and to yield and generate this information when it comes to compiling this type of information, and to improve our methodology and to have a better more specific monitoring. I have not fully specifically answered your question, but I can give you an overview approach. Thank you, Stella. Thank you, Dielo. Effectively, all the resources that you want to share with us, we can upload to our webpage and include in our memories that will be available to all members. Do we have, yes, we do have time for another question from our audience.
Hola,
From the San Rafael Hospital, this is a question is addressed to Dr. Stella, and this has to do with food safety. As health institutes and entities, a great part of the service we provide, of course, food-related services, and what we provide and taking into account crops and different type of plantations that are being used. So the question is, are there any criteria that can guarantee food safety for communities when it comes to healthcare institutes or entities can use or based to deal with and address contracting, hiring, procuring in a safe and effective way? Thank you.
Gracias por tu pregunta. Me han tocado preguntas muy
Thank
complicadas.
you for your question. I have received very
Lo que
complex
mencionas es
questions.
correcto. O sea, lo
What
que
you
nosotros
mentioned is
vamos a
correct.
comenzar
What
a
we're
ver
going
con
to
el tema
start
de los
to
cultivos
look and
o la
see
pérdida de
as far as
potencial de los
crops and
cultivos está
plantations or the
relacionado al
loss
incremento de
of
temperatura que se
agricultural
espera para
is
el verano.
related to
Pero
the
lo que también
increase in
vamos a comenzar
temperature.
a ver
But
especialmente
also
con
we're
las
going to
zonas
start seeing
litorales,
in rural
andadinas, es la
areas and
pérdida
Andean type of
de agua,
the loss of
que hace
water
que
or shortage
inclusive
of water. In
sea
fact,
más difícil y sea
it
más
becomes
rápido
more
esta
difficult and
pérdida
these
o la
losses
reducción del
happen
potencial de crecimiento de los
quicker
cultivos.
when it comes to the
Entonces, de
growth
alguna
and
manera vamos a
harvesting of
comenzar a
these
tomar
crops.
medidas de adaptación que
So
son
we will have
específicas
to
para las regiones,
implement
para las ciudades
adaptation
que están
measures for
mencionadas,
the
que
region.
mencioné,
This is one
cada
of
una de
the
las ciudades que
indicators that I
viendo
mentioned. How
cómo es
cities,
que o cuáles son las medidas de
what are
adaptación que ellos
the
tienen que
adaptation measures
tomar
that they need
para
to
poder
implement to be able to
la salud de
safeguard
su población.
the health
Todo
well-being
esto
of
que
their
mencioné al principio,
population.
al final,
One
lo
of the
necesario
things that
es,
you
al
mentioned
día
at
de
the
hoy,
end of
de
your comment,
priorizar lo que
perhaps we need
estamos,
to prioritize
la producción
the production
local,
of
para
local
poder
production
inclusive poder apoyar a
to be
nuestros
able to
agricultores, poder
support
apoyar
our farmers
a nuestras propias
and
ciudades, a
our
nuestros propios
own cities,
productores más
our own
pequeños,
producers or small
para que ellos
producers,
realmente
so that
puedan
they can
también tener
actually
un
be
bienestar,
or
un
have
livelihood
a
de qué agarrar.
healthy livelihood and
La
what
pregunta es
to
muy
rely on.
difícil
The
porque
question is
nosotros
very
ya como
difficult.
región
As a
sufrimos de
region, we
inseguridad
already
alimentaria, que no
experience
toda
food safety
nuestra
related
realidad
issues,
está ligada
and
al
it's
cambio
not
climático. Pero lo
completely
que sí es
related
que
to
cambio
climate
climático
change.
la
But
va a
what we see is
exponenciar,
that
la
climate
va a
change will
agravar. Entonces, lo
aggravate
que ya
and
tenemos que empezar a
worsen
pensar es
this
en medidas de
situation.
adaptación
So we need to
locales
think of adaptation measures on a local level
dentro del mismo hospital.
within
Me
the
parece que es
same
excelente
hospital or
inclusive
entity.
poder
I think it's
tener
excellent to be considered or to
convenios con
take into
productores
account
locales,
to come into agreements with
pero
local
esto tiene
producers,
que llegar a ser un poco más
but
allá.
this has
Tiene
to
que
go
ser no solamente de las
beyond. It has
autoridades a
to
los
come
niveles
from the
bien
authorities, the local
comprometidas
authorities. They have
a
to show commitment
fomentar
to
la
promote
producción local, a
local
asegurar la
production,
calidad de agua,
to
cantidad de agua,
assure
a comenzar a tener
water
otro tipo
levels,
de estrategias
safety
para
water
que nos
levels,
podamos adaptar
so
no
that we can
solamente
adapt
como, o sea, para adaptarnos
to adapt
como ciudad, como
as a
individuo, como
city, as
nación.
an individual, as a nation, as a
Entonces, esta
region.
pregunta,
So it's not
la
a,
que me has hecho no es una
the question
pregunta
you have
fácil de
asked
responder. Yo
is
solamente
not
te
an
puedo
easy
responder
question
ahorita en
to
tendencias
reply. I can
climáticas
only
grandes,
reply to
pero
it
tenemos que
when
comenzar también a
in
hacer
the
las
climate
investigaciones más
change
locales
context, but we need to do research on a
y
local level
adaptar nuestros planes de
and
adaptación
to
a
adapt
espacios más
or to
locales
implement those
para
adaptation
poder
measures in
responder
local
a la
spaces
amenaza
to
de que
be
nos
able
enfrentamos.
to address to the climate change
Muchísimas
threat.
gracias, Estela. Les pido una
Thank you
última
very
ronda de
much.
aplausos para
One
nuestros
more round
ponentes
of
iniciales.
applause to our previous two presenters, including Dr. Stella
Me parece
Hartinger.
que cumplieron cabalmente con el
I think
propósito
they
de abrir
fulfilled
la sesión
the
de hoy, dar
purpose by
contexto y
opening this
especialmente
today's
retomar
session
este sentido de
and
urgencia con el que
to
se aborda la
stress and
actualidad.
underline
El tema de nuestro
the
primer
sense of
panel del día
urgency,
de hoy, cambio climático,
climate change,
transporte y energía.
transportation, and energy,
Y
which is
para
the subject
abrir la
matter.
sesión,
And
le
to
voy a dar
open
la
up the
bienvenida a la
next
ingeniera
session,
Patricia
I
Segura,
will ask
directora
Engineer
técnica
Patricia
de
Segura,
Huella Verde Ecuador,
the
con su
director
presentación
from
titulada Absorción y reducción de
Green
tu huella mediante el proyecto Sello Reduzco,
section from
brazo del Hospital
Ecuador.
Alianza del Ecuador. Adelante, ingeniera. Muchas gracias.
Engineer, please proceed. Thank you very much. Good morning, everybody. Thank you very much for the invitation. For me, it's a privilege to be here representing Ecuador. In fact, in Ecuador, we're starting with this phase and stage and the agreements that we have with non-governmental sections, entities. So I know that some colleagues from different institutions are here from Ecuador. So I'm very happy to be here and to have this experience. Please let me share some slides with you. In this case, we're going to show the proposal by Alliance Hospital that has been working. This is an entity relatively new when it comes to, or after the pandemic. All the healthcare subject matter has spun around 360 degrees, and even more now with this subject matter when it comes to the environment, to be more responsible when it comes to the sustainable aspect. The purpose in this case for sustainable mobility is for workers to have access to the workplace in a sustainable way, as could be public transportation, bicycle, or a shared commute, to educate the visitor and contractors when it comes to sustainable matters. What is the main objective? To diminish the carbon footprint with contractors and visitors. Specific objectives: to share vehicles between collaborators, to promote the use of public transportation and alternative means of transportation, such as the bicycle and by foot walking, to reduce the use of private vehicles. The first sustainable activity that we want to share with you, it's a Share Alliance project. For the Alliance Hospital, it's important to give name to all the proposals it is making, because there's a better connection or relationship. It's important for personnel to have a commitment. In fact, yesterday one of my colleagues shared the commitment that the staff members have when it comes to the connection they have to this. So this is very essential, because if we don't have that focus, we cannot work alone. So this proposal comes within the framework from the Ministry of Public Health in Ecuador, addressed to health entities and health institutes. To share a vehicle when going to work has many benefits: when to socialize with colleagues and co-workers. This capital city in Ecuador has a lot of traffic congestion jams. It has had or seen a very large increase of vehicles. So in one way, we can diminish the carbon footprint that we generate at the institute. It reduces stress levels when commuting, and how better to share with colleagues who have the same route or commute pathway. So in Ecuador, the proposal has been for the routes to be marked, to be highlighted, and the person requests from staff members who wants to join the Alliance project. So we have had a very well receptive, and it has been welcomed at our institution. The Sharing Alliance project, as I told you, the promotion of sharing a vehicle, a private vehicle, between people who work in the same area, so contamination or pollution is reduced, and personnel members who participate will receive a bonus for fuel expenditures once they complete 10 trips. Sustainable activities within and that we have been working on is Bike Alliance. This is a way to use a bicycle. It will be much more productive and healthier. In our capital city, we have pathways for bicycles, bike paths, and this has been a long-standing type of work for municipalities, especially in the Quito municipality. But people have received well, and this particular Alliance project opens up spaces and parking spaces at the hospital so people can use and ride a bicycle. As I was saying, This strategy promotes the use and riding of bicycles as a means of transportation to get to your workplace, or through activities using a non-motor vehicle. The hospital has exclusive or specific parking spaces for these. The proposed activity number three is also the use of public transportation, savings on fuel, savings on time or your commute time. It's much lower. Obviously, there are commutes as public transportation, Metrovia, um, massive transit type of buses, and they can use those different options. And we're about to open a subway, an underground subway in Quito. We hope that it will become a reality, and this will improve mobility within the capital city. As activity number four, to walk to work proposal. This applies to people who live nearby or in proximity of the workplace, and also to incentivize or motivate people to have a more active life. So this is within the proximity to the hospital or entity. So we have personnel members who have relocated to these areas, and it has been effective for them to feel motivated to improve their quality of life and for them to move about by walking to work. This was another alliance proposal. We acquired a lot which is located in Choco to be able to promote reforestation and the planting of new species. For us, it's very important to create an alliance with collaborators on this type of project, and for them to be able to share with family members, their children. And this is incredible to see how a person's mindset changes. It's a spectacular act to witness, to feel contagious. People become more resilient, motivated, and joyful. And I invite you to open up and have this type of spaces. We also reinforce recycling stations when it comes to plastic, paper. If it's true, we have reduced the consumption of plastic because personnel have one single bottle or container so that they can consume it on a daily basis. But there is always, of course, consumption of bottles. So we have a station, a recycling station, where people, our maintenance crew and staff members, try to improve these activities, and it also strengthens and reinforces these strategies. As a sustainable activity, we also have the Activate Yourself Alliance. It's an incentive for workers and employees to have an active life and to take 30 minutes of time to do or carry out some type of physical activity. So that they can be connected to this type of activity. We also reinforce the healthy mind, healthy heart, healthy body, and production level of work. The entire personnel and staff members do come to these activities. Everybody links and relates to each other. Well, all this goes within the framework in the I Reduce Stamp Alliance project. It could be on an individual basis, it could be group or collectively, or it could be by area, by department. What we try to do is to motivate active participation, visitors, and also contractors. So with this, we try to create awareness about the importance and the necessity for the reduction of the carbon footprint that we generate and the favorable effects on a personal and collective or group base. What are the obtained results? The use of vehicles per workers in 2021, this is only between 2 years' time. When compared to the use of vehicles by staff workers in 2022, a 19% of the use of bicycles to 4% compared to 4% in 2021. We also have a diminishing or lowering of public transportation. Why? Because they joined the proposal called Alliance Do Share. So now 4 people are carpooling or sharing the same vehicle, whatever the vehicle has as its capacity to transport people. We have also seen between visitors, contractors, a more frequent use of electric or e-vehicles. And well, this has also been a short-term progress and advance, but it has been very significant because we're seeing immediate results. What has been the reduction on the footprint? A 12% of reduction, which means 861,561 kilograms in CO2 reduction. This is a very significant and important reduction for us, and this means the effort of each worker, each staff member, and the disposition of each person who works at the hospital, and it's the willingness and the enthusiasm to participate and to collaborate. What are the reached or achieved goals? The lowering or reduction of the carbon footprint. We can see also when it comes to diesel consumption in gas, it's 21.30%. I am comparing between 2021 and 2022. A 70.93 in public transportation. As I told you, people have participated in this alliance projects. And a 24.46% in the lowering or diminishing of taxi or cab usage. These are the reached and achieved goals. A 14.81% on the average use of bicycle riding. We have a 300% of usage for e-vehicles or electric vehicles, and carpool sharing. Up to 35 vehicles have joined the proposal and have participated. This is compared to other hospitals. This has a lower or lesser capacity hospital, but based on 35 vehicles for the capacity and the complexity of our hospital is actually a high number. And this promotes and gives incentives, motivates, and creates empathy between co-workers. Shared Alliance has also been able to share and issued or delivered gas consumption bonuses up to $2,000. When it comes to the bicycle riding, 35 bicycles have joined and participated in this program. And the use of people have started to walk. At least 12 people are now currently working from home to the work site by walking 10 kilometers on a daily basis. And this has improved a healthy lifestyle. This would be the total reduction of the carbon footprint. As we can see, we have a 12.3% of climate change and mobility, 8.5% on energy reduction, and 4.4 on sustainable procurement and purchases. Well, the most efficient tool is actually you when it comes to combating and fighting climate change. All of us who are present, and those of you listening online and watching online, these are strategies that we want to share so that all of us together, professionals in the healthcare system, can also suggest, recommend, implement at their workplaces. So this is our proposal for today. I thank you very much for your attention. Thank you very much. Thank you very much, Patricia. How beautiful to see that it is possible. I think there are several entities who have done this type of adaptation for carbon footprint. One of the most difficult categories to measure are the carpooling and commuting of personnel. So this makes it clear, this case, this is very valuable information, and yes, it can be done. Thank you very much for your testimony. Before we move on to the next presenter, we'd like to acknowledge those who are joining us online. We have participants from Colombia, Brazil, Chile, Nicaragua, Costa Rica, Mexico, and Argentina. And I also want to share you, yesterday's broadcast at its peak point has had 200 participants and subscribers online, and our YouTube channel video has more than 1,700 reproductions and views. So thank you very, very much to all our followers and guests. I now have the great pleasure to introduce to you Dr. Maria Paula González and Andrés Silva from the Cardio Children or Infant Foundation, and they will share some experiences about sustainable mobility. Good morning. Hello. How are you doing today? How did you do with your transportation today? Did you take carpool to get here? Thank you very much to all of you, especially to the Global Network for this invitation to be able to share this successful case with my fellow and colleague Maria Paula from the Cardio or Infant Foundation. And Patricia already has given us a good comparison as to what they have experienced in Ecuador. There's something that we feel very proud in Bogota. Actually, we're not very proud of when it comes to the worst mobility rate in South America. So we'd like to share some data. I think all of you, most of you who came from abroad or from other cities decided to stay nearby or lodge somewhere nearby. So let me share some information with you. Maybe we could go for a bike ride while we get the presentation on display. Today, I had the worst experience of all because one starts to estimate timings. Huh? And since I didn't use the scooter and I was not familiar with the neighborhood, I took a taxi and I bumped into a major unexpected traffic jam. But I no longer estimate or calculate my timing. And what Andres was saying, mobility, it has to be sustainable and it changes paradigms and your mental mindset and what you envision. Andres, please continue. Thank you for sharing your experience, Maria Paula. Mobility is something that affects all of us. from different points of view and dimensions. I'd like to share some of these figures. I was telling you that we're not very proud about Bogota and the new data or newly released data. I carpooled with a colleague who lives in Pereira, and we wanted to get to Méderi, but the timing, if there is a traffic jam, I will take much longer, 15, 20 minutes. So on a per commute basis, in Bogota, a typical commute is 1 hour and 15 minutes. And if that's an average, there are people like Maria Paola who only take 15 minutes to get to work. So for that mean average, there are people who actually spend 3 hours on a commute, 6 hours per day, 500 hours per year. So this affects, obviously, our quality of life, not only the environmental aspect, but also our mental health and productivity. Also, there is an issue when it comes to equity. For example, equity means a person, I will use dollars for our audience, online audience. Let's say a person who earns $5,000 at any Latin American city normally commutes or moves in a less costly using his or her own car, and related to their income, it's only 3% that is invested in transportation, whereas a person who barely makes the minimum salary is actually investing 15 to 23% of their salary. So the gap is greater and greater each time. So after the pandemic in most of our cities, I think in Colombia we have experienced, and of course for a long time, we've known also what happens in Guayaquil, Ecuador, how the sensation of insecurity or lack of safety makes us take or make some decisions. If I am afraid to take public transportation, then I decide to purchase or buy a motorcycle or a car. And also how women become more vulnerable. 93% in Bogota, when it comes to public setting harassments, happen to women. 93%. This does not happen to men. It happens to women. So this is more serious, more grave. And when it comes to 73% of window breaks or thefts, auto thefts, or when they try to steal a mirror, 73% happens to women who are driving alone. This is also very alarming data, and equally important, and when it comes to you being an expert, the impact that is generated by pollution, air quality because of mobile sources. 80% of air quality issues is caused by mobile sources. And this includes everything. We all have a possibility to contribute, but we also have the possibility to how we get to work. Carpooling is a good initiative. Bike riding is a good initiative. And that's the one success case we want to share with you through the Infant Cardio Foundation. And this is a subject matter that has all the support from the foundation, especially human talent, which has been a key actor. This is more behavioral than technological. Our colleague Patricia showed us where they do it differently, but the actual core of the change has to do with people's conduct and behavior. How can we change a conduct or behaviors? If I am afraid to ride a scooter, or because of safety issues, because of climate issues, so then do I dare to make the decision, and do I have a good experience? So at the end, what happens is a technological ecosystem is developed where the core and the center of that situation is the person. So basically, this is an app, as you can see on the screen, for people from the Cardio Foundation, and they have different options depending on the distance or the commute where they live, depending on their activities. They can use carpooling, which is car sharing, and they can ride together. They also can share a taxi. And we have seen also moto pulling, meaning a motorcycle ride, and also all types of active mobility. Should I ride on my bike? We have seen people that basically commute on a bicycle 15, 20 kilometers, and they look impeccable, not sweaty, not disgruntled or disheveled. So, the willpower that people have and how we can leverage the willpower so that it's massive and it can generate a good behavior. So, no more talk. Actually, Maria Paula will tell you about this particular case at the foundation, which has been an example. And then there are several organizations and entities, Santa Fe Foundation in Banaco. I know it's also present. So all of you are very much invited to duplicate this experience. Thank you, Maria Paula. Thank you for opening up this space to me to talk not only about the environment, which is the focal point that brings us together, but also to talk about culture, which I am passionate about. In fact, for us, the Cardio Foundation, we had an initiative to look for a mobility alternative. I will be honest, related to the environmental. In human resources and human talent, we were talking about these alternatives. We were talking about people, what it's happening to the well-being of people. Each day we notice that mobility has become a something adverse, and that affects people. So we think about pathways, routes, and we addressed and called the Secretary of Mobility, are you crazy? You know how long this will take, the type of blockage or access. Climate right is here, and this is a perfect opportunity to provide our collaborators a possibility for mobility in a different way, which has a plus feature, the reduction of the environmental impact, but also we talk about 5 social objectives that we will share later on with you and how it has been developed and the indicators and what has happened 1 year after starting. So we start with Try My Ride app and how our collaborators unload the application and they are able to connect with other users to share the experience. So we are looking to share experiences based on a cultural model, such as the power of unity, power of solidarity, service with a loving intention. So with this specifically, we noticed that we were also leveraging our cultural transformation on those 3 pillars: free willpower to transform ourselves, to mobilize or commute, provide a service in a loving manner, to be willing to share my means of transportation. So those of you who share transportation, even if one thinks, but based on our statistics, the one who has a car easily downloads the app. I can share my pathway, we all ride, but they are not so willing. Whoever has a car or owns a car wants to be alone, drive alone, commute alone. So there's a challenge as to how we can convince the car owner to be part and to yield and be willing and be able to accept others, carpool with others, to link and relate to others, and also to have a better impact from the human talent point of view. Let's start with this initiative. The first 3 months, when it comes to the visual continuity, we did some sensibility type of research. We promoted the app. We also used e-bicycles with our collaborators as a way to incentivize or motivate. And this does not conflict or create any conflict. Our larger population mobilizes on bicycles, and they like riding bicycles to come from work and back home. And So this is another subject matter that it's very important that someone is coming with me. If I break down, if I get a flat tire, there is a fellow rider who can support me on the way. So we started to work on these processes. We let's show you how to download the application. We also have incentives for our collaborators. We don't have the incentives that Ecuador has, sorry, but we are on the way, we're working on it. And also, it has been difficult and challenging because of cultural. We would like this to come from the heart and not to be chasing the carrot or the stick. So this is a strategy that is very effective. So what we do is we give them bonuses, supermarket shopping, 30,000 type of bonuses to the best ranked users on a monthly basis. We approach them, we take a photograph, we upload the photographs on our Facebook or website because this is an acknowledgement. I am part of the change, of the transformation, sustainable mobility, and people like to see, to be able to share and to show that they are being a protagonist at the institution. So we do this award giving on a monthly basis, and if someone gets motivated, and we try to set up different challenges and how this becomes part of the motivation for competitiveness in a healthy way through this methodology. Currently, we have 134 vehicles or cars that we have been able to register in 1 year. These used to be people, oh, but what's in it for me? What am I going to gain with this? People who lived on the outskirts of the city, could they help me with a toll fee? So we didn't really consider that type of situation. So once you're in your car, we wanted people to feel motivated. If whoever wants to ride and ride share and carpool, but as an institution, we do not force it or obligate. We wanted to do a willing voluntary practice, and also for the human being to recognize. We have 47 motorcycles that are currently share the carpool riding, 119 passengers that travel free of charge, and we have 83 people now currently walking from home to their workplace. So safety plays a very important role when it comes to nighttime or night shift personnel. If I start working at the institution or entity, Bogota is not a very safe city. Should I walk to work with these 3 blocks with a coworker? So they use the application to connect and link up with other colleague. When one works at such large-scale entities, or when it comes to large shifts, personnel shifts, to create this type of experience and shared experience. So this app allows people to come together, or people who did not know each other, and there is a common factor or common denominator, and that brings them together, and networks are created. I think my time period is running out. Now I am going to talk about what's difficult and what we bring to the board of directors' attention. The impact that we have had in these 5 objectives when it comes to social responsibility. We have 87,365 millions of pesos that were saved, pocket money that were saved. Our people, our staff members, have saved this much money because of transportation cost cutting by using the app. 25,400 trips on bicycles and on foot. incredible what people have saved and our staff members have saved by walking or riding a bicycle. And this includes also shower services that are provided when it comes to mobility tools. 86% when we talk about people who are actively involved, and 80% of these are women. And of course, this needed to be reflected on when it comes to inclusiveness. 80% are women. 186,037 kilometers that were saved in commuting, non-traveled kilometers, and 23,994 avoided or saved emissions, contained emissions. So I will tell you, truthfully, we are doing this for people and also for the environment. We were not so fully conscious about this before until we received the first report, and then we said, oh, we are generating such a strong and heavy carbon footprint. So look at the impact that you have on this world, on the planet, not only on your entity, but also through your actions, your behavior. You are leaving a footprint on this world, and hopefully you're leaving a better world to your children. And I think that's, to those of us who are parents, that's our major concern to future generations. To show this and to share this, I think it was a home run. So, and when it comes to the pride that people feel and people that, thank you very much for listening to me. Thank you for inviting us. And thank you for accompanying us on this journey. Andrés. Well, thank you very much. Another clear case that it is done and possible. This is a cultural change, let us remind ourselves, and sustainable mobility is also a social justice subject matter. Now I have the pleasure to invite Juan Esteban Palacios, who will talk about mitigation, climate change related to collaborators. Juan Esteban, welcome. Well, good morning. I'd like to share and thank Méderi, to Health Without Harm, to the global network of green and healthy hospitals, and obviously for this invitation for me. It's a great experience to be here and a great opportunity to be here, and the honor of being here with you and to be experiencing and learning about such important subject matters. So I'd like to start speaking about Copsana. We're a cooperative company that has existed for 31 years, providing health services to the community. Today, we have 250,000 users to whom we give coverage in the entire city of Medellin. We're also 800 direct full-time collaborators or employees, and we have 12 centers or health centers. One of them is a clinical lab and a service administrative service center. So when it comes to corporate or company sustainable mobility and strategic alliances that we have created and developed with the purpose of contributing to the sustainable development. Towards the end, I will take this opportunity to mention an initiative that we implemented just a few months ago called Zero Paper Policy, which has brought us very good results. So first of all, I'd like to share with you, this is the North Center campus, very similar. It has an infrastructure of 2,200 square meters, 40 service assistance areas. It has a low complexity level, and it also serves and caters to over 3,300 patients per day. I am sharing and telling you about this particular center, health center, which is located in one of the most popular barrio or neighborhood, Castillo, in the commune number 5, outside the city. So this is where the environmental area and other processes where we try to implement our initiatives so that those employees and inhabitants in this area can be the first benefactors. Getting back to the first strategy, this goes to a regulation requirement which is issued by the local city environmental authority. More than 200 employees that are invited to implement mobility with the objective of or purpose to reducing at least a 20% of CO2 in a 2-year period because of their mobility among staff members. For the compliance of this requirement, the environmental authority provided us with an application, and through some survey questionnaires, we do a diagnosis, and it consists in 2 survey questionnaires. One of them for the facilities, on-site facilities, which deal with, and another survey questionnaire for employees for those measurements of emissions between the commute from home to work and work back home. With a representative sample of 755 employees, it yielded these results that you can see on the screen that we started working with by measuring CO2 levels and also that were emitted on a normal day. And this is on a general and on a per capita level. On this slide, we can see a satellite image of the city of Medellin, where we are geo-referencing the locations where each of these employees lives. So you can see the location highlighted in the north sector of the city. On the left-hand side of the slide, you can see the different means of transportation based or color-coded and that each employee used, taking into account, and also one of the major problems related to mobility in our city is that many people who live in the north section of the city during peak traffic hours commute towards the center or south center, and at the same time people who live in the south sector move and commute to the center. So this yields and produces some major traffic jams that are constantly experienced. So with the advantage of having different centers or campuses throughout the city, we were able to allow a greater number of employees to commute and to get to their home or place of to their households. So this becomes a benefit for the employee. It helps to mitigate the problem, and also it is less traumatic for the employee to be on time to start working, and it lowers the actual commute distance. Here we can see the distribution percentage-wise as to how employees move about and a range of kilometers. With this, we can make decisions, and it helps us the implementation of and also the success of the strategy. Here we have some general broad results. Until this moment, 26 commutes have been successfully completed. Total 76 employees have also collaborated. 8% use the active mobility strategy. 50% also uses public transportation. Out of that 50%, 12% uses the subway, which is massive transit, which is very friendly to the environment. 12% of employees share their vehicle, and a 31% uses individual vehicles, whether it's a motorcycle or a vehicle. We want to add to this percentage in the future applications such as Try My Ride to increase this percentage. So this would be the total 100% of employees who have their work-related activities on-site. Also, some of these employees have a telecommuting or remote distance contractual link. We also did an analysis of the costs of transportation to try to show and reflect some figures when it comes to mobility and the means of transportation, with the objective of create awareness and to fully and carefully take into account when it comes to using motorcycles or vehicles. In particular, in the city of Medellin, we are flooded and have been invaded by motorcycles throughout the city, and this has increased the rate of accidents that are seen every day in the city. And this accident rate, mobility also becomes another public health issue. So we're trying for people to not use or acquire or purchase those vehicles, motorcycles, and to try to participate in active mobility means. When it comes to results and benefits, 76 employees have been engaged in this. 42 of them have lowered from 4 to 2 commute routes, coming from home to work, using a means of transportation. Before, they would ride the bus or the subway. Now, they are only riding the bus or only the subway. So it has lessened or diminished the timing between 1.5 to 2 hours per day. It also lessens and lowers the cost of mobility up to 50%. It improves their quality of life, and it allows employees to spend more time with their family, such as doing exercise or study, go to school. Can you please help me with the video that I want to share? Thank you.
Hola, mi nombre es Luisa Luján, higienista oral de Copsana IPS de la sede norte. Llevo trabajando 4 años en Copsana IPS. Como higienista oral, tuve el beneficio de ser trasladada desde la sede Calasanz, que fue inicialmente donde empecé mi labor como auxiliar de odontología. Luego me trasladaron a sede norte como higienista oral. Es muy gratificante, ya que no tengo que madrugar tanto porque demoro 10 minutos caminando de mi casa hacia el trabajo, no tengo que gastar dinero en transporte, además me ha dado más tiempo libre para hacer ejercicio y otras actividades personales. En sede norte me siento súper bien, ya que cuento con un buen ambiente laboral y unos excelentes compañeros. De la sede norte como tal, agradezco por el crecimiento laboral que me ha brindado.
With this brief short video, aside from the testimonial This woman has great charisma. I think we all know someone in our companies or entities, and I wanted to share her attitude as far as the implementation of the strategy. She has been an influencer within our company, an entity, because this became very important when the information is conveyed and transmitted within the same system. Sometimes employees don't see it as a rule, regulation, or instruction from upper management. So Luisa became this person who helped us to convince others who were resistant to change, and with this we were able to continue having more success. I would say 15% of employees that can be transferred or use mobility means. So this also contributes to the objectives and benefits when it comes to the environment. Let's see, do we go back? I was also talking to you about strategic alliances. Here we can see two other objectives: U energy, accessible, non-polluting energy, and also other alliances. We created alliances with a company that through an investors group or investment group, we were able to install a system of 84 solar panels in our North Campus, and this has improved and reduced energy consumption cost. We are now paying almost half the price that we were previously paying. So this allows us to keep a fixed rate. Part of the energy that panels generate, we are not actually consuming, so we provide this to the domestic level network, and through the public utilities company we are getting a discount. So this is another savings. With the alliance on the right hand side, that is the city waste treatment service. They use or electric trucks when it comes to the collection of waste and waste treatment. So we have an agreement for us to deliver and turn over to them the waste and residuals, and they collect this waste and treat it properly. They also have some criteria when it comes to hiring and procuring, and they include people who have been victims of violence or people who have gone through drug rehabilitation programs, and also local recyclers, and they have given the opportunity with all the fully documented and rifled conditions to be hired. So this is a very important development on an industrial basis to leverage dangerous waste to convert them into organic or reusable products. Here on this chart and graphic, we have an online platform to do the follow-up for the performance of solar panels. The first year we can see the kilowatt cost and consumption energy rates, and we had some savings of close to 12 million pesos and also 12 tons of CO2 that were saved. In this second year and through the month of May, we also achieved 5.5 million pesos in savings, about $1,500, and we have avoided emitting 6,000 tons of CO2. And to finish, I'd like to share with you the zero paper policy that we started using since November of last year. Thanks to the technological development and the automation of process, we have been able to reduce up to 90% paper consumption, and we stopped using 135 high and low traffic printers. This has improved our infrastructure, and we have done it in a very responsible. And with the withdrawal and non-use of these printers, we have saved 32,205 kilowatts per hour with an approximate cost of 9 million plus about 2,025 US dollars, and we stopped paying or didn't have to pay about $11,600 when leasing or renting this equipment or devices. With this data, when it comes to different printing savings, we calculate that we will stop consuming 8,649 reams of paper and 422 tons of ink on a yearly basis, a very significant savings for the company. Before thinking, I'd like to mention to all of you that our company also went through two software developments that are very important when it comes to users' access and developments. One of these is being used by pregnant women, and we have calculated more than 125,000 type of errands and paperwork processing that we have saved for these women when it comes to transportation, and also these women did not have to be on site. This is what I wanted to share. Thank you very much. Thank you very much, Juan Esteban. Another very clear case that it's possible to do it, and also the situation when it comes to an influencer to promote cultural change with these people. To continue and close our first block, I have the great pleasure to introduce Sandra Acevedo, who comes the strategic ally partner that we have in Brazil when it comes to climate mitigation in healthcare. Alexandra, please proceed.
Hola a todos, muy buenos días.
Good morning, everybody, and I am here. I know that there are some hospitals from Brazil, so thank you very much. Congratulations, and we are happy to be here with our colleagues from Health Without Harm, and to be also to represent the global network of green and healthy hospitals from Brazil, and to be able to share our work and some experiences by other organizations. Yesterday we had the opportunity to get to know a little bit of the experiences in the healthcare system, United Health Group. Next, we're going to get to know some experiences by hospitals and clinics of Bogotá, a healthy hospital project. I thank you for the opportunity. Let's see. Let me see if I can find this slide. So, you already know who I am. So, as Andrea said, I represent PHS. I am responsible for the sustainable procurement area as a consultant. In a similar way, Health Without Harm in Latin America and the Healthy Projects, PHS, I think it'll be easier, PHS, also carries on and conducts a assistance consultancy and support group to organizations in Brazil to propose, implement, and carry on practices about sustainability in their operations, in their supply chains, and also to mitigate and adapt public health and environmental. So PHS is a strategic partner for Health Without Harm in Brazil and coordinates activities for the global network. Today we have over 300 institutional members, 321 to be precise. We have 21 healthcare systems that are being represented, more than 300 hospitals, and at least 900 health institutions, and we have more than 1,400 individual members, professionals in healthcare, or others who are interested in participating in our network. This is a little bit about the distribution. We work with different health providers throughout the country. I'd like to share a little about how we work in a very minimized work because we have other activities. I will not go deeply or in detail, but this is to give you an overview of how we are doing our work to contribute to reduce the climate impact. Andrea mentioned yesterday that it's important to measure, to be able to understand, and then to be able to act. So these are the main tools that PHS promotes. The challenges, as you will know, first of all, the global agenda of green and healthy hospitals has 10 objectives. We at PHS devote ourselves to mostly 4 agendas: waste, climate health, energy, and sustainable procurement challenges. These are tools that allow organizations to measure and to collect data when it comes to waste management, energy, emissions, and also to understand how those sustainable purchasing or procurement practices and to advance initiatives to reduce impacts. These are very practical tools with the 3 major challenges: quantitative, the qualitative for purchasing or procurement, and to understand how sustainable purchasing and to have a self-assessment. Under these challenges, we have management tools. We also promote technical resources, study cases that we share. We recognize good practices. We're also advancing with indicators and benchmarking so that we can help organizations the same way we're doing it at this event with communications, so that organizations can support and accompany each other and look how other organizations are doing and going about their practices, and advocacy, which I will go into later. But these are the numbers of all the entities and institutions that are participating between 2022. So when it comes to change, 206 when it comes to the waste management, 44 institutions in the energy challenge, and also 19 for the procurement challenge. We have been working in a very comprehensive manner. When we speak about mitigation, as we have discussed yesterday, and today it's very clear, we cannot work alone, isolated. When we work with energy, it's very interesting actually. If you have thought about this, everything happens because of a decision made in purchasing or procurement, how to improve my facilities, new structure or building, new product, a new relationship with a contractor. Everything goes through the procurement area or purchasing area. So initially it gets the purchasing area involved, even more so with technical areas. So, the challenge for the tools for this challenge, we have been working for entities and organizations to have solutions so that they can think and move forward with more comprehensive solutions. The same way as Health Without Harm in Latin America, we also promote the Race to Zero campaign. In Brazil, 7 hospitals and 2 healthcare systems participate, and they are committed to this Race to Zero to reduce their emission reductions by 2050.
Bueno, estos dos sistemas de salud
These
representan
two
también
healthcare
120
systems
unidades de salud.
also represent
Estamos
two
trabajando
different
también para aumentar este número.
120 units or centers, health centers.
Esto es la evolución
This
de
is
los
the
participantes
evolution
de los
of those
desafíos, y acá
participants
quiero
and the
destacar más
challenges
que,
that we have at PHS on a yearly basis.
¿Cuántas organizaciones están
How many
involucradas
organizations are
para
actually
así,
involved
entender,
to
medir
be
los
able to
números y así
understand,
poder
to
entender
measure the
lo que
numbers and to
pasa
be able
con
to
sus
understand
organizaciones?
what is happening
A
to
respecto
their
del
organizations
desafío clima, aquí
with
son
regard to climate
111
change?
organizaciones que sí,
111 organizations or entities
preparan sus
that
inventarios de
do
emisiones.
prepare their
Entonces, el
inventories
número de
for
últimos ciclos es
emission
un impacto
reductions.
muy
The last
grande,
numbers, it's actually a very
para
high
Brasil, para el
impact
sistema
for
de
Brazil,
salud Brasil.
for the health system in Brazil.
El inventario público no hay muchas
And
organizaciones, pero
in the public
con el
sector,
trabajo que
there
nosotros hemos hecho,
aren't that
cada vez
many,
más un número creciente
but
de
the
organizaciones
number
han
is actually
participado del
increasing
desafío del clima
over the years,
y de los otros desafíos también.
and also as to the other challenges.
Déjame ver, aquí
Let me
hablar
see.
un poquito también cómo,
Here we talk a little
de
bit
una manera muy
about,
resumida,
in a very
debemos pasar
summarized
todos estos,
way,
estos puntos, pero PHS también
PHS
desde siempre,
also,
pero más reciente,
but
sin los últimos
always,
años,
but more recently in the
también
last few
actuado
years,
más
has
fuertemente
acted
juntamente
jointly
con otras
with other
organizaciones de
organizations,
salud, de la
health,
sociedad civil,
social
o de gobierno, para
society
que
and the
también,
government
avanzar con la
to
discusión
move forward
de una manera más amplia
and to approach it in a
además
more
del trabajo que hacemos con
extensive way
nuestros miembros.
about the work we do with our members.
Ustedes saben,
As you
el
well
gobierno
know,
brasileño,
the
hubo un
Brazilian
cambio en el
government,
gobierno
there
de
was a
Brasil
change in our Brazilian
entonces
government.
esto también ha
So this
proporcionado una
has also
exposición, una participación más
provided
fuerte de
a
nosotros
stronger
en la discusión del
participation
clima,
when it
y así
comes
que
to
nos,
the climate change
estamos
discussion,
también,
and we're also more actively participating in this discussion, and also the subject matter of plastics, which is very important. Yesterday we saw some cases about plastics, so we have also worked and we have acted very strongly about discussions, and we have provided some incentives, but this is the type of work that we have advanced on very strongly. And now, to share with you some cases in Brazil, I will take the very last year, over 100 cases, good practices. We annually promote and we incentivize or motivate good practices, more than 100 of them. It's very difficult to select which we're going to share over here, but just to give you and tell you, there are many more than what I can present to you. I am going to start with a case study that is very interesting. It has to do with innovation in the logistics of detergents. This was implemented by HSL, which is a Syrio-Lebanese hospital, one of the most important in Brazil. And this was an initiative initiated by the hospitality sector. So the process of dilution of detergents with employees, it was not proper, it was not being very productive, there was a lot of waste of the product. So in a meeting, they decided to consult with the supplier to think up and think of better solutions or alternative solutions to improve the results of this process. So they used a diluter device to dilute 5-liter gallons, and in some spaces or environments within the organization, they consulted with the supplier if they could change the packaging of the product. So they switched to capsules, 40 milliliter capsules, from 5-liter gallons to 40 milliliters capsules. So the actual employees who worked in the maintenance and cleaning department, the amount of this product per capsule is very specific and for a certain amount of water, and it was easier for them to use.
Esta fue la motivación principal, pero
This was the main
lo
motivation.
impacto es muy
But
interesante porque
what
hubo
it's
una
most
reducción
interesting is
de
there was a
embalaje.
reduction in
Entonces,
packaging.
como reducción de más de 93% de
Over
plástico, que pasó de un galón de
93%
5 litros
of
para
plastic,
cápsulas
reduction
de
in plastic,
40,
from going to
mililitros.
5-liter
La
gallons to
reducción de
capsules.
transporte porque,
The reduction in
antes
transportation,
con
because
las,
before,
las embalajes eran
with the
más grandes,
packaging, they
entonces se
were
necesitaba
larger
más
containers,
viajes del
so you
proveedor
would
hasta
need
el hospital.
more trips
Entonces, esto
from
se
the
redució
supplier
para
to the
una vez por
hospital.
mes, porque
So
las
this was
embalajes
reduced or
son
cut down
menores.
to
Y
once per
también
month.
la reducción de las
And also the
emisiones,
reduction of
por cuenta de
emissions
ese proceso.
because of this process.
Esto, la parte de
So
operación de la organización.
operational
Y
wise
así
from the
que vemos como
organization.
un proyecto,
So here we
que
can
es
see that
completo en la
this
parte,
is a full
social
cycle
también,
type
porque hubo
of project,
una mejora
and it
de
involved the
la
social
calidad de
component
trabajo de los
because it
empleados,
required
la parte
the work of
ambiental muy
other
clara,
employees
y la parte
and
económica
the
también, que
economical
hubo una
aspect
reducción
because there
también
was a
de,
reduction
un ojo de, también económico.
of
Y aquí
in
lo
the
que
economy
es un
cost.
caso muy interesante porque se
And I
parte
think
de
it's a
la- de
very
la
interesting
técnica
case because
para hablar con el proveedor. Y
we
ayer
were
también
able to
mencionamos
talk
que muchos
directly to
proveedores no
the
quieren
supplier.
trabajar,
Yesterday it
no
was
quieren,
mentioned
no
that
tienen
we
interés,
didn't
pero
want
muchos
to
otros tienen
speak
interés.
with some
Entonces, un
suppliers,
caso
or some of them
bastante
don't want to.
interesante también.
So this is a very interesting case.
Un otro caso
One other
es
case
de
that I
el
want to share
Hospital
with you,
Santa,
it's the
Marcelina
comes
Saúd.
from
Es
the
un,
Santa Marcelina
hay
Saúd
ellos
Hospital.
también tienen algunas organizaciones,
It also
pero,
contains or has some
ellos, el año
organizations.
pasado
Last year they
iniciaron un
started
estudio para cambiar
a study
de movilidad también
to
para
change
electrificación de la
mobility,
flota.
and with the
Empezaron, ellos
electrification
contratan
of the
hoy, contratan un
fleet,
servicio de
they were hiring and
electrificación de la flota.
contracting
Entonces,
a fleet of vehicles.
pensando en las cuestiones
Thinking
ambientales y
of the
también la
environmental
oportunidad de ahorro
matters
de recursos,
and
entonces
also
empezaron
the
un
opportunity for
proyecto
savings,
piloto para evaluar
they
la
implemented a
viabilidad de
pilot project to
sustituir,
improve viability and to
vehículos
replace
equipados
vehicles
con motores, entonces, de
with
combustión interna
car
por vehículos
internal
eléctricos.
combustion vehicles for
Y
electric
bien, que
vehicles.
conducir, esto acá son las comparaciones
And these are the
de,
comparisons that we can
y
see
fue
on
claro,
this
para ellos
slide.
hicieron piloto
They
con
conducted the
algunas,
pilot
empresas, y se
study
quedó claro
with
que
some
era,
companies,
ambientalmente,
and
cuando consideraron el impacto
environmentally
ambiental
it was
económico,
very
sería
favorable,
más interesante cambiar para,
and they
la-
realized that it
la-
would be more
la
interesting
flota
to
eléctrica.
replace
Y
to
también
an
en términos
electric
de-
fleet,
de reducción
and
de
also
emisiones.
when it comes to reduction of emissions.
Aquí también tuvieron que preparar las instalaciones.
Here
en el
also
hospital,
they
pero-
had to
pero está
prepare
bien.
the
Y todos los
facilities
servicios tercerizados son
and all the
contratados
third-party
con
services
vehículos eléctricos.
with electric vehicles.
Acá.
Let's move to the next
Este
one.
es un otro caso
This is
de
another
la
case
Santa
that
Casa
comes
da Bahia.
from the
Es,
Santa Casa da Bahia, SCBA.
Ellos también
They
con la
also
preocupación en cómo
very concerned
avanzar con
about how to move
expansión
forward
de
with the
sus espacios,
exposure,
con, edificación y
structure,
ampliar los
building, and
servicios.
to expand their
Ellos
services.
pensaron en cómo
They
podemos
thought about
expandir
how
y
can we
mantener el
expand
consumo
and
de
maintain the
energía.
same
Entonces,
energy
basado en el
consumption
consumo
based
2020 que
on
ellos
the
tenían,
energy
y,
consumption from
ellos,
2020.
planificaron
They
la
planned
expansión,
the
de
expansion
manera a no aumentar el consumo.
by not
Entonces,
increasing
¿cómo
consumption.
hacer
How
esto?
can
¿Cómo
we
es
do it?
posible
How
hacer
can
eso?
we achieve it?
Pensando
They
en
started
maneras
thinking
de
about
eficiencia
ways,
energética,
about
¿no?
energy
Entonces,
efficiency.
¿qué hicieron?
So what did they do?
Ellos
They
pensaron en ese programa de gestión
started
energética que
to
fue creado
think
en
and
7
design
etapas.
this
Fueron
energy
divididas
program,
en
which
algunas
was
opciones de
developed in
eficiencia
7
energética,
stages,
como sectorización,
as in
sistema de
sectoring,
calefacción
heating,
solar, aire
solar
acondicionado y
heating system, air
refrigeración,
conditioning,
generación de energía térmica,
refrigerants,
iluminación y acciones
lighting,
para el consumo
and
de
actions
energías
for energy
renovables,
consumption,
como
renewable
plantas
energy
fotovoltaicas
consumption,
que empezar a instalar.
and how to install
Entonces, con estas
these
medidas,
devices
con
and
estas,
artifacts.
iniciativas,
So with these initiatives,
ellos,
they
tuvieron un ojo también económico
kept an
de
eye
recursos
also on
y,
the economical aspect
una reducción del
and the
consumo de
reduction of
energía,
consumption of
para
energy
atender el objetivo de
to
expansión
be able to
y,
comply with the
una
objective
consecuencia
of
de
the
reducción de
expansion
las emisiones
and also the
de
reduction
73
of
más de 73
over
toneladas de
73
CO2 por
tons of CO2 per year.
acá.
Over here.
Perdón.
Excuse me.
Este es un proyecto
This
que
is a
fue
project
desarrollado,
that was developed
bajo el desafío de energía.
under the
El
Energy
proyecto CLIC,
Challenge.
tal vez
This
ustedes
is the
saben,
CLIC project, Perhaps
escuchado
you
sobre el
have
Clean Light
overheard
Coalition,
about the
Coalición de
Click
Iluminación
Line
Limpia,
Coalitions.
yo creo así
Click,
se traduce.
I think it's translated this way.
Es una organización
It's an
internacional.
international organization.
Nos buscaron en Brasil para
So
conducir
they
este proyecto
searched
con una
for this
organización
organization
de salud
along
y
with
como parte de una acción para la sustitución
to be able
de
to
las
participate
lámparas
for
fluorescentes
the
que
fluorescent
contienen
light
mercurio en las instituciones de
lamps
salud.
that contain
Fue
mercury
organizado con
in
una organización de
healthcare
salud.
entities.
Tuvo lugar entonces
So
el Hospital
this
de
took
Clínicas de la
place
Facultad
at
de
the
Medicina de Botucatu,
hospital
que voy a presentar a continuación.
of the
Y
hospital
es una institución
in
pública, un hospital,
Botucatu.
universitario,
This is a university
de gran
hospital
importancia en su
of great
región.
importance in
Entonces,
its
el
region,
trabajo, fue
Botucatu,
conocido. Aquí algunas de las
HCFMB.
fotos después del trabajo que fue
And
conducido.
I am sharing with
Y
you some of
así
the images
que
of the
se
work
pudo
that was
entonces,
done. And
como
in
los
this way,
resultados, energía ahorrada,
the
proyecto
saved
fue
energy,
pilotado, fue,
the project became a
porque hay
pilot
todo
project.
un proceso de medición
There
previo
was
de
a
la energía,
whole
del consumo,
measuring
después de
process
del cambio
of
de las
previous
lámparas.
energy
Entonces, trabajo
consumption.
muy
So
completo
the
fue
very
hecho en dos
complete
sesiones,
type of work that was
dos
done in
departamentos
two
del
different
hospital.
sessions, in
Entonces,
two departments or
los
areas of the
dos-
hospital.
esos dos departamentos
So these two
se
departments,
observó una
we were able to
ahorro de
observe
energía,
savings in energy
más de
of over
45,000 kilovatios año,
45,000 kilowatts per
departamento más de
year.
51,000
The other department,
kilovatios año.
51,000
El
kilowatts per
percentual
year.
de energía
The
ahorrada en
percentage
comparación
of
con
saved
fluorescentes
energy
fue
compared to
49%,
fluorescent light,
entonces, sí que es una
49%
iniciativa
savings.
muy importante.
So it was a very important
Las
initiative.
emisiones ahorradas en
The
un
saved
año
emissions
normal y
in
un
a
año seco
normal
también
year
fueron
per ton.
mencionadas. Así que hubo una,
So there was
una
a
reducción,
a
un
reduction,
potencial reducción de
significant
emisiones.
reduction
Y
in
también
emissions,
el mercurio
and
evitado, que es
also
un tema
the
también que
mercury
nosotros
that
acá
was not
trabajamos e incentivamos,
used or consumed
en el sector salud.
in 20 years in
Entonces,
healthcare.
ese es el proyecto CLIC.
So that's the Click project.
Y por fin,
And finally,
yo creo que ese es un trabajo que nosotros hemos
this
también,
is a work
conducido
that we
en
actually
PHS,
conducted at PHS
bajo el desafío
under
de energía y
the
residuos, hay sinergia,
Energy
sinergia con
and
los
Waste
dos
Challenge.
desafíos. Eso es un simulador
This is
de
a
biodigestión
simulator
también,
of
como una
biodigestion,
manera
how
de
we can
contribuir que
contribute
las organizaciones
for
puedan,
organizations
medir,
to be able to measure
aquí sus impactos.
their impacts.
Entonces, este simulador
So
él
the
fue,
simulator was
conducido, su construcción conducida
built,
por PHS
designed
en
by
colaboración
PHS in
con
collaboration
el
with
Instituto de,
the Institute
Energía y Medio
of
Ambiente de la Universidad de
Energy
São Paulo.
of the University of Sao Paulo.
Y la idea,
And the
el
idea
objetivo
or
de
objective of
también se
this,
integra al
this
desafío
was
de
also
energía,
incorporated
y la
to the
idea
energy
entonces, el
challenge.
objetivo es cuantificar,
And the objective was to quantify
la emisión de biometano,
the
las emisiones de biometano
biomethane
de los residuos
emissions
orgánicos.
for
Entonces, a medida
organic
que las es una manera de incentivar
products.
las
This is one way to
organizaciones también
give an
a
incentive
manejar
to
mejor
organizations
sus
to
residuos
better
orgánicos. Y a
manage
partir de
their
esta información,
organic
entonces,
waste.
pensar,
And so this is a way to
pensar,
think
iniciativas
about
para
initiatives
mejorar el
to
manejo
improve
de los residuos y también
the management
de,
of
de
waste.
cómo utilizar esta nueva
And
esta fuente
how,
de energía
how
como fuente
to
de
use
energía
this
en
energy
sus
source
instalaciones.
in their facilities.
Entonces, es esto entonces simula el potencial
So
de-
this simulates the potential
Y es esto.
of
Gracias,
these alternatives.
tú eres
And that's it.
solución para dudas.
Thank you very much. I am available for any queries or questions.
Muchísimas gracias, Alessandra. De pronto no nos enteramos
Thank
de
you,
todo lo que pasa
Alexandra.
en Brasil por la
Perhaps
barrera del
we
idioma,
did
pero
not become aware or found out about everything that happens, but you, members from Brazil, are key members. We live in the same region, same continent. Thank you for sharing a little sample of everything we do. I think we are over our time limit. We only have time for 2 questions. I will take one from the chat group and online and one from on-site. I'd like to ask people who ask questions, as well as our panel members, to be very specific and direct. For Juan Esteban, what percentage of investment was taken into account for the actions that you shared?
Bueno, muchas gracias por la pregunta.
Thank you very much for the question. The percentage of investment was more about work effort, investment, and willpower from all areas. All of us have become involved and engaged because it's not easy for people to change the place or the ways that they are in the habit of using or doing. Another one for the panel, the solar panels, we simply had to do some remodeling baseline adequations because the group of investors at the company where we signed the agreement, they are the ones to whom we're paying the kilowatt per hour cost. And for the software development, these are our own developments at our company in our systems area. We have not paid any membership or intake, or recently they were participating in our Digital LATAM Awards, and they were ranked very well because of positive results. Thank you very much.
Muchísimas gracias. Sí se puede aún con recursos limitados.
It is possible even with limited resources. The question over here, could you tell us who the question is addressed to? My name is Catalina Velázquez from the San Vicente Hospital from Medellin. The question is for Patricia, the engineer. Question. Thank you, first of all, for sharing your strategies and the cases that you have shared with us. You were telling us a little bit about the shared alliance, the shared carpool commute. From the human talent point of view, did you use a specific tool or what strategy to be able to have that database about the mobility among collaborators, or how is it that you actually measure that through a tool? Thank you very much for your question. In fact, the human talent area plays a very important role when it comes to information from each employee, because at the start of each profile of each employee, they have a pathway or commute pathway or route to be able to determine and single out the commute route. So they collaborate with that information. We actually mark and register the commute pathway or route, and that's how we schedule the commute route. And there are different means of information within the hospital from each director, each area, service area. So we bring together this information. So the commute pathways are published, and through a chat group, they sign up, institutional chat group, and it's a lot easier to be able to schedule and figure out what the commute routes and the programming of the routes. Thank you very much for the question. Thank you for the answers. Thank you for the content. I apologize for not having much more space or time for questions. And remember that you can use the chat and you can send your questions online. And for those of you who are present, before we break and go to a beverage break, you already know where the refreshment area, where there is a 905 room or conference room where the answers and the exercises of the workshop are stuck or on the walls. And those of you who are online, we will be showing you some videos during this break, intermediate pause, and we will get back to 11:05. Thank you very much.
Como la mayoría de mis colegas, inicié mi carrera dando mi palabra de honor a través del juramento hipocrático. Como pediatra, estaba orgullosa de ser parte de la tradición de médicos de la antigüedad, quienes se comprometían, con el mismo espíritu con el que lo hacemos hoy, a tratar a las personas enfermas y a protegerlas de la injusticia, y sobre todo, a no causar daño. Desde los tiempos de Hipócrates, la medicina evolucionó de una forma inimaginable. Tratamos los síntomas de nuestros pacientes de manera asombrosa, pero por fuera de nuestras instalaciones, algunas enfermedades están aumentando en proporciones epidémicas. Por supuesto que nos preguntamos, ¿qué es lo que enferma a las personas y por qué se repite una y otra vez? En nuestro viaje para diagnosticar y tratar el cuerpo humano, hemos avanzado y retrocedido muchas veces. Pero hace 20 años, junto con un grupo de colegas, comprendimos que necesitábamos una visión más amplia para entender el problema. Notamos que los termómetros, cada uno con una cantidad de mercurio capaz de contaminar un lago entero, se acumulaban en nuestra basura. En nuestras propias instalaciones, observamos que los incineradores de residuos hospitalarios arrojaban gases tóxicos a la atmósfera. Las dioxinas y el mercurio provenientes de la incineración de residuos caían sobre la tierra, contaminaban el agua y los alimentos, envenenando nuestros cuerpos y los cerebros en desarrollo de niñas y niños. Estábamos contribuyendo a enfermar a nuestros pacientes, infringiendo el juramento que habíamos hecho acerca de no causar daño. Entonces, formamos una coalición de médicas, médicos, enfermeras, enfermeros y activistas para revertir la situación e impulsamos un cuidado de la salud que respetara nuestro juramento y saneara nuestra casa. En la actualidad, por ejemplo, los termómetros de mercurio cayeron en desuso a nivel mundial. Pero mientras usted me está escuchando, el clima está cambiando y las personas para quienes trabajamos enfrentan quizás el mayor daño de todos. Ahora necesitamos que el sector salud se convierta en líder en un sentido aún más amplio. Consumimos grandes cantidades de energía en cada continente, lo que contribuye al cambio climático y a la contaminación del aire, que mata a 7 millones de personas por año. Solo en Estados Unidos, el sector salud es responsable del 8% de las emisiones de gases de efecto invernadero. Pero aquí está nuestro poder de influencia. Nuestra actividad representa el 18% de la economía de Estados Unidos y el 10% de la economía mundial. Los cambios que realicemos pueden hacer que las industrias dejen de causar daño y establecer nuevas normas que impactarán positivamente en la salud de nuestros pacientes. Imaginemos, por ejemplo, si el sector salud combatiera la resistencia a los antibióticos comprando solo carne libre de antibióticos. O cómo las soluciones innovadoras para eliminar los residuos, como la biodigestión, podrían ayudar a proveer de energía a los hospitales. El sector salud podría ayudar a que la energía renovable sea viable. Al abandonar los combustibles fósiles, reduciríamos las emisiones de dióxido de carbono que dañan a nuestros pacientes y a nuestro planeta. Nos encontramos en un momento decisivo en la historia de la medicina y podemos convertirlo en un punto de inflexión. El doctor Martin Luther King dijo: el arco moral del universo se inclina hacia la justicia. Únase a nosotros ahora que el sector salud se inclina hacia un futuro más justo y sostenible, basado en nuestro juramento original: no causar daño.
Para hablar de la historia de Méderi, es necesario remontarse a 1962. Año en el que el Instituto Colombiano de Seguros Sociales del gobierno se encontraba administrando la clínica San Pedro Claver. Con el paso de los años, se evidenció un notable abandono con una infraestructura deteriorada y equipos en mala condición, afectando la calidad del servicio a los pacientes. Medio siglo después, 3 prestigiosas instituciones, Compensar, la Universidad del Rosario y la Orden Hospitalaria San Juan de Dios, unieron sus esfuerzos y el 1 de mayo de 2008 nació Méderi. Hoy, Méderi vive un constante proceso de transformación enfocado en una cultura de servicio centrada en el paciente. Méderi es una red hospitalaria que cuenta con 2 sedes ubicadas en la ciudad de Bogotá, Colombia: Hospital Universitario Mayor y Hospital Universitario Barrios Unidos, que forma e investiga. Hace más de 14 años, trabaja por brindar una atención integral ofreciendo servicios a la necesidad de sus usuarios a través de la innovación, conocimiento y humanización en el sector salud. Con la elocuencia característica desde el nacimiento de este sueño llamado Méderi, hemos evolucionado en cada proceso con la misma pasión con la que realizamos nuestra labor, logrando dejar huella en el bienestar y felicidad de nuestros usuarios. Los cambios han fortalecido y embellecido nuestros espacios, adecuándonos a estándares internacionales de atención hospitalaria y de confort. Estamos en una reinvención constante. Contamos con una capacidad instalada que representa el 6,5% de las camas hospitalarias en Bogotá, Colombia. Hemos sido reconocidos por ser una de las mejores edificaciones hospitalarias en Latinoamérica. Contamos con espacios amplios, dotados con la mejor tecnología, con buenas prácticas médicas y más y mejores servicios amigables con el medio ambiente y el cambio climático. Reducimos la huella de carbono con la adaptación del sistema de paneles solares para el calentamiento de agua en ambas sedes. La transformación e innovación en la prestación de los servicios de salud de Méderi nos ha permitido incorporar en cada idea elementos que conllevan al respeto por el entorno y el cuidado del medio ambiente. Trabajamos con un modelo de humanización enfocado en el respeto, privacidad y dignidad que permite tanto al paciente como a su familia una atención humanizada que respeta sus derechos y deberes. Hemos creado un círculo virtuoso para hacer de esta una gran experiencia, dejar un legado de investigación y ciencia con la concepción de institutos que nos permiten seguir brindando una atención interdisciplinaria y de excelencia. Día a día alimentamos este sueño con la certeza de que solo haciendo las cosas con amor, respeto y honestidad aportamos a la salud y bienestar de nuestra sociedad. Somos Méderi.
El residuo era, se llenó la bolsa, cerramos la caja y que se la lleve. ¿Qué hacían? ¿A dónde iba? ¿Qué proceso? ¿Qué decía la legislación? No teníamos idea.
Un camión que se utilizaba para reparto de carne se utilizaba para retirar residuos biocontaminados del hospital. Vino medio tarde ese muchacho un día y en esto del apuro que tenía, de poder irse rápido, yo le pregunto, ¿por qué por qué estás tan apurado? Y me dice, porque yo tengo que salir a repartir carne antes de las 8 de la mañana. Digo, ¿qué, con este camión? Sí, me dice. O sea, voy al crematorio, bajo los residuos y me voy a retirar la carne. Así fue.
Los residuos no se estaban manipulando como correspondía y había desconocimiento con respecto a ese tema.
Que no había así una conciencia de que nosotros trabajábamos con ciertas sustancias que eran perjudiciales para la salud de la gente que trabajaba acá y la gente que venía a atenderse.
Yo soy Carlos Marinosi, soy enfermero de profesión, pertenezco al Comité de Gestión Interna de Residuos del hospital desde su conformación en el año 2000. Yo era enfermero asistencial de la guardia de adultos, 0 conocimientos de residuos. Me dice mi jefe en ese momento, dice, tenés que ir a participar del Comité de Gestión de Residuos del hospital. Bueno, voy, sin tener idea de lo que era, hasta que todos los que estábamos, las 10, 12 personas que estábamos ahí, no teníamos conocimiento de lo que era una gestión de residuos propiamente dicha. En la primera etapa hicimos todo un relevamiento institucional de lo que contábamos, de lo que teníamos, de lo que generábamos. Se hizo un anteproyecto de normas donde hicimos talleres para saber cómo íbamos a trabajar.
Y al principio siempre viste que todo te parece una utopía. ¿De qué estamos hablando? Sí, pero viste lo que cuesta, que la gente que hace lo que quiere. Bueno, es un trabajo lento.
Por eso el grupo se transformó en un equipo. Y eso es vital, es decir, saber cuál es el objetivo e ir todos hacia ese objetivo.
Ese estudio nos dio que regenerábamos en ese momento 44.000 kilos al año de residuos biocontaminados o patológicos. Después de un año de poner en práctica las normas, ese estudio lo volvimos a realizar y fue una disminución a 26.000 kilos por año. Eso quiere decir que esas normas de clasificación general de residuos hospitalarios dio sus efectos.
Y a partir de ahí es como que, bueno, empezamos a tomar, íbamos aprendiendo a tomar conciencia de todo lo que hacíamos y en esto de la conciencia de estar cuidándonos entre todos.
En el año 2009 llegamos a ser Centro de Referencia de Gestión de Residuos. Ese proyecto, el de la Secretaría de Ambiente de la Nación, tiene una matriz ponderadora que evalúa de 0 a 6. Nosotros llegamos al 5,75, siendo el primer hospital dentro de todos los hospitales del grupo que trabajamos para ser Centro de Referencia y Gestión de Residuos, el primero en Argentina. ¿Qué es ser Centro de Referencia y Gestión de Residuos? Es que el hospital sea modelo a replicar en cualquier otra institución pública o privada de su gestión de residuos. En el año 2013 fue el primer hospital en Rosario y uno de los 8 en Argentina de ser miembros fundadores de la Red Global de Hospitales Verdes y Saludables.
Por ser miembros de una comunidad de salud, por ser miembros de un hospital, entendemos muy bien que lo que es promoción y prevención de salud es lo esencial.
La gestión de residuos en una institución de salud la hacemos todos y cada uno de los miembros, en cada servicio. Cuando se generó el comité teníamos 3 objetivos. Uno que era disminuir costos, porque cada kilo de residuo biocontaminado que hay que tratar se paga, afianzar las normas de bioseguridad y disminuir la contaminación en el ambiente hospitalario. Actualmente el comité de residuos trabaja en distintas corrientes de residuos. Tenemos los sólidos urbanos, que son los que son compatibles con los domiciliarios. Tenemos los residuos biocontaminados o patológicos, que son los desechos de las atenciones médicas, que van en bolsa roja. Tenemos los químicos peligrosos, que son todos los elementos químicos que llevan una disposición especial. Tenemos los residuos reciclables y tenemos los residuos informáticos. Hoy podemos decir que se cumplieron con los 3 objetivos, porque se creó un grupo horizontal y participativo de trabajo de nivel de gestión y operativo.
Todos podemos charlar, todos podemos opinar, o sea que no es algo vertical, es totalmente horizontal y todos pueden opinar.
Fundamentalmente es tener en claro cuál es el objetivo y hasta dónde vamos a llegar.
Trabajar en equipo no es fácil. Hay momentos en que supongo que también a lo mejor uno cae y decae porque ve que las cosas no salen como uno quiere y porque vos sentís que estás luchando, que estás peleando así onda Quijote con molinos de viento, pero creo que nunca hay que perder las esperanzas y que siempre hay que estar.
Hoy por hoy todos los hospitales provinciales y municipales han tenido contacto con este comité y que nos ha permitido a nosotros y ha permitido a otros servicios y a tomar conocimiento y agendar lo que es la problemática.
Desde el punto de vista de un profesional de la salud como es el médico, tenía que tener ese conocimiento. Y bueno, me pareció que participando del comité podía replicar todo lo que se hablara en ese comité y lo que se hiciera en el hospital en mi servicio.
Se llegó a concientizar que la problemática de los residuos atañe a todas las funciones dentro del hospital, no es de un eje específico. Y este espacio de reflexión participativa trabajan niveles de gestión y niveles operativos. El comité de residuos ya está instalado y está reconocido dentro de la institución. Habrá gente nueva y esperemos que haya gente nueva y que se siga interesando por el trabajo y creemos que vamos a lograr mucho más.
Para eso necesitas continuidad y comunicación, no hay otra forma.
Y el secreto es preocuparnos por el otro, en esto de estar viendo que lo que hacemos o lo que hicimos no lo podemos dejar parado, porque si no estaríamos retrocediendo. Entonces, en esto de estar pensando en el otro, en el cuidar el otro, que nos cuidamos nosotros mismos, eso hace que sigamos.
Yo creo que hay una sola forma de empezar, que es de cero, digamos, viendo qué es lo que tenemos y a dónde vamos, qué es lo que tenemos y qué es lo que podemos obtener. Y después pedir información y consultar y pelearla y equivocarse, porque a veces también uno se equivoca. Y eso, y mucha fuerza, más que nada.
Sostenerlo en el tiempo me parece que es el desafío actual.
Estar cuidando el ambiente, de esto de estar cuidándonos a nosotros mismos, de esto de cuidar la población que atendemos, tiene que ver con eso, de cuidar la salud del otro. Entonces, todo lo que nosotros podemos minimizar, que esté en contacto con el paciente, con la población, es importante. Y con el trabajador, obviamente. El trabajador también tiene que estar protegido de todo tipo de cuestiones que tengan que ver con su salud.
Las enfermedades están muy relacionadas con todo lo que es el medio ambiente. Desde la polución, zonas de la ciudad en donde no hay una buena disposición de los residuos. A medida que han pasado los años, uno nota que la gente se enferma más.
Que el hospital de Roque Sáenz Peña, de la ciudad de Rosario, es centro de referencia en algo, que estamos haciendo bien las cosas, que empezamos de la nada y que hoy llegamos hasta acá y somos reconocidos por un buen trabajo, yo en lo personal muy orgulloso. Y orgulloso de representar a todo el personal del hospital que hace la gestión y a la institución en sí. Esto es una tarea extra a nuestra función específica dentro del hospital, sin ningún tipo de remuneración, donde cada uno lo hace porque le gusta, porque está interesado, porque tiene el interés en dejar y en trabajar en un ambiente menos contaminado, en el ambiente hospitalario que sea menos contaminado y que sea más saludable, tanto para los pacientes como para nosotros mismos, que tenemos que trabajar para un mejor planeta. El consejo que le puedo dar es un speech que tenemos en el comité, que dice, paso a paso, día a día, el trabajo entre todos hace que los cambios puedan llegar a ser posibles.
Trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Podemos resonar, unir voces, hacer masa, levantar la mano ante las autoridades.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
El climático es una crisis de salud pública mundial. Los impactos de la sequía o las olas de calor ya los estamos viendo en la población y los centros de salud también son vulnerables a estos.
Como profesionales de salud, ¿qué vamos a hacer al respecto?
Pienso que como profesional de la salud es necesario que hagamos estrategias para incidir efectivamente en el cambio climático.
Necesitamos que se involucren más, que se comprometan más profesionales de la salud.
Los profesionales de la salud comprometidos con la salud ambiental.
Sí podemos llegar a un sector salud de 0 emisiones para 2050, pero esto va a requerir acción inmediata, decisiva y deliberada en todo el sector salud.
Y la recomendación que nosotros tenemos es tener una visión multiactor que te genere acciones a diferentes niveles y que promueva un involucramiento ciudadano.
Poder escuchar a otras personas para poder ir adquiriendo conocimientos o para intercambiar puntos de vista e ir construyendo conjuntamente soluciones a estas problemáticas.
En el contexto del cambio climático, considero que el sector salud debe liderar la difusión hacia la población de los efectos en la salud de la contaminación ambiental.
En mis consultas intento alertar sobre el impacto del clima en la salud y la necesidad de que todos aportemos nuestro granito de arena para evitar que esta crisis se profundice.
Cuidemos la vida y la salud de todos. Unámonos.
El trabajo en equipo es una habilidad muy importante. Los roles que eran de contribución individual cada vez son menores.
Porque no hay nada realmente significativo que uno pueda lograr individualmente. Puede haber algunos individuos que empujen más, que hagan punta, pero los avances significativos son siempre colectivos.
Como la mayoría de mis colegas, inicié mi carrera dando mi palabra de honor a través del juramento hipocrático. Como pediatra, estaba orgullosa de ser parte de la tradición de médicos de la antigüedad, quienes se comprometían, con el mismo espíritu con el que lo hacemos hoy, a tratar a las personas enfermas y a protegerlas de la injusticia, y sobre todo, a no causar daño. Desde los tiempos de Hipócrates, la medicina evolucionó de una forma inimaginable. Tratamos los síntomas de nuestros pacientes de manera asombrosa, pero por fuera de nuestras instalaciones, algunas enfermedades están aumentando en proporciones epidémicas. Por supuesto que nos preguntamos, ¿qué es lo que enferma a las personas y por qué se repite una y otra vez? En nuestro viaje para diagnosticar y tratar el cuerpo humano, hemos avanzado y retrocedido muchas veces. Pero hace 20 años, junto con un grupo de colegas, comprendimos que necesitábamos una visión más amplia para entender el problema. Notamos que los termómetros, cada uno con una cantidad de mercurio capaz de contaminar un lago entero, se acumulaban en nuestra basura. En nuestras propias instalaciones, observamos que los incineradores de residuos hospitalarios arrojaban gases tóxicos a la atmósfera. Las dioxinas y el mercurio provenientes de la incineración de residuos caían sobre la tierra, contaminaban el agua y los alimentos, envenenando nuestros cuerpos y los cerebros en desarrollo de niñas y niños. Estábamos contribuyendo a enfermar a nuestros pacientes, infringiendo el juramento que habíamos hecho acerca de no causar daño. Entonces, formamos una coalición de médicas, médicos, enfermeras, enfermeros y activistas para revertir la situación e impulsamos un cuidado de la salud que respetara nuestro juramento y saneara nuestra casa. En la actualidad, por ejemplo, los termómetros de mercurio cayeron en desuso a nivel mundial. Pero mientras usted me está escuchando, el clima está cambiando y las personas para quienes trabajamos enfrentan quizás el mayor daño de todos. Ahora necesitamos que el sector salud se convierta en líder en un sentido aún más amplio. Consumimos grandes cantidades de energía en cada continente, lo que contribuye al cambio climático y a la contaminación del aire, que mata a 7 millones de personas por año. Solo en Estados Unidos, el sector salud es responsable del 8% de las emisiones de gases de efecto invernadero. Pero aquí está nuestro poder de influencia. Nuestra actividad representa el 18% de la economía de Estados Unidos y el 10% de la economía mundial. Los cambios que realicemos pueden hacer que las industrias dejen de causar daño y establecer nuevas normas que impactarán positivamente en la salud de nuestros pacientes. Imaginemos, por ejemplo, si el sector salud combatiera la resistencia a los antibióticos comprando solo carne libre de antibióticos. O cómo las soluciones innovadoras para eliminar los residuos.
Ya tenemos a nuestros siguientes ponentes esperando en línea.
A proveer de energía a los hospitales. El sector salud podría ayudar a que la energía renovable sea viable. Al abandonar los combustibles fósiles, reduciríamos las emisiones de dióxido de carbono que dañan a nuestros pacientes y a nuestro planeta. Nos encontramos en un momento decisivo en la historia de la medicina y podemos convertirlo en un punto de inflexión. El doctor Martin Luther King dijo, el arco moral del universo se inclina hacia la justicia. Únase a nosotros, ahora que el sector salud se inclina hacia un futuro más justo y sostenible, basado en nuestro...
Bueno, pues bienvenidas, bienvenidos de regreso.
Welcome back. Welcome back from the break and refreshment break. Thank you to all of you who are joining us online. And we will go straight into our second session of our panel members. We have the great pleasure of sharing Karina Pavao-Patricio. She's a medical doctor and coordinator of the Sustainable Hospital Center at the Clinical Hospital of the School of Medicine in Botucatu, who will talk to us about actions to reduce carbon footprint, which Alexandra introduced earlier. Karina, thank you very much for being with us. Please proceed.
Buenos días.
Good morning, good afternoon. My name is Karina. I am here to speak with you from Brazil. I will ask you your permission to speak in English because My Spanish is not very good.
So could you start with the please? Okay, thank you.
Muy bien, gracias.
So it's a great pleasure to be
Es un
part
gran
of this
placer
important
ser parte
conference
de este
and
evento tan
share our
importante
experience
y
in
basado en nuestra
Brazil.
experiencia en
So
Brasil.
thank you for this opportunity.
Es una gran oportunidad de estar aquí y poder compartir con ustedes.
I am the director
Yo soy
of
la directora
Sustainable Hospital
del
in
Centro
Clinical
de
Hospital
Hospitales
of Buscato
Sostenibles
Medical School in
en
Brazil.
la Facultad de Medicina del Hospital Clínico de
And I will
Botucatu,
be
en
speaking
Brasil.
about actions to
Y voy
reduce
a hablar
carbon
acerca de las
footprint,
acciones para
the path
reducir la huella
of
de
the large
carbono,
public
el
hospital to
camino de
reduce
un hospital
greenhouse gas
público para
emissions.
reducir su huella de carbono.
Next, please.
Pasemos a la próxima diapositiva, por favor.
So here is
Así
our
que
hospital
este
in
es nuestro
Botucatu in São Paulo State, a full public hospital that also works as a teaching hospital, and we have 650 beds, which serves around 2 million people from more than 17 cities and even from other states in Brazil. Next, please. And let's learn about our team. Me and the technical assistant, Renata de Camargo, like in the photo. And we were a center in the hospital that works with sustainable health care and associated with health hospital projects in Brazil and with Health Without Harm since 2013. And our mission is to implement and manage sustainable actions within our hospital, mitigate negative climate change impacts, and promote environmental health. Next, please. Another one, please. Yes, this. So, as many studies have shown, climate change is humanity's main public health problems beyond COVID-19. As the Lancet Countdown in 2021 has already brought us a red alert showing impacts on human health. But it is also a great opportunity for us to adopt better strategies to promote the health of the planet in a sustainable way. Next slide, please. And the World Health Organization's COP26 special report on climate change and health showed highlights 10 priorities to protect the health of the people and the planet that sustain us. This World Health Organization report was released at the same time as an open letter signed by more than two-thirds of the global health workforce and told us wherever we deliver care in our hospitals, clinics, and community around the world, we are already responding to the health harms caused by climate change. Next, please. So, our work has been based on all PHS materials in Brazil. And more recently, we have been guided by these 7 elements of climate-friendly hospitals: energy efficiency, green building design, alternative energy generation, transportation, food, waste, and water. And adopting this transformative motto: healthy hospitals, healthy planet, healthy people. Next, please. And our goal is to show you our experience here, which consisted in verifying and evolution data of greenhouse gas emissions during this 5-year period. With the aim of reduction our hospital's GHG emissions. These aims are based on ESG targets and on the sustainability triple bottom line based on such factors as the image, social, environment, and economic factors. Next. So thinking about acting in this way, this show our reduction in GHG emissions years when our Sustainable Hospital Center joined the 2020 Challenge, Health for the Climate, and in 5 years we managed to reduce our emissions by 33.4%, as you can see in this graphic. However, it was extremely difficult because in 2018 there was a 22% increase in global emissions over the last year, and we start a great team effort. Next. So when we investigating the cause, we found an increase of 43% in scope 1 of GHG inventory. And looking at each indicator, rate it with anaesthetic gases with a 55% increase in consumption in 2018, as you can see in this graph, compare year to year. In response to this situation, our center contacted the anesthesia department to investigate the reason for the increase of consumption. But the team there was already investigating many heavy leaks in all operating rooms. Our hospital is very old, a large public hospital with a physical structure over 50 years old, with often inadequate systems. Okay, next, please. Faced with the complexity of the problems and without financial resources to invest, a greenhouse gases commission was created. There is our like in photo. Monthly meetings were held, outlining strategies and action plan with maintenance center, checking all gas availability, changing what was possible, and training to conduct preventive maintenance. Initially, the work was conducted in the operating room and then extended to 2020 to all other wards and included others used in hospital. Next, please. Yes, with this work, it was possible to achieve a drop of 64% compared to 2018. And at the end of the challenge, 5 years later, the drop was 53%. Remember that nitrous oxide is about 300 times more potent than carbon dioxide in our atmosphere. We saved around $30,000 with the reduction of this gas. And the next challenge is to stop using nitrous oxide in our hospital. Next, please. So in nitrous oxide, other gases have their monthly consumption checked by our commission, as you can see in this table. Other important results were the evaluation of the oxygen network of the hospital, the training of the employees on the correct handling of equipment, and also the removal of this gas where it was not needed. This action began in 2019 and was especially important as leaks in oxygen were corrected before the start of the pandemic, and this hospital became a national reference for the care of patients with COVID-19 in Brazil. And we saved around $134,000 in total with this action. Next, please. With this work, we won the Friend of the Environment Award, promoted by Health Hospital Projects in Brazil, PHS. Next, please. And it was also recognized the Global Green Health Hospitals in the silver category of climate leadership. And next. And because of our work, our hospital has been selected to be part of the project Mercury Free Lighting in Hospitals, promoted by CLIC and coordinated by PHS in Brazil. Alessandra from PHS showed very well before. And we were the only hospital in Brazil, together with the Philippines and Nigeria, receiving around 3,000 LED lamps. Next. Yes, so we got excited and entered the Race to Zero challenge with 7 hospitals and 2 health systems in Brazil, as Alessandra showed before. And next, please. So our killers are adhering to the health care, climate change, and using the GAG protocol was a challenge at first, as it included a lot of data areas of the hospital that needed to be collected and worked on, and different sectors did not give importance or understand the importance of this work, making it difficult to access data in the necessary time. So we have to increase more the environment health education for health professionals to be more aware of climate change impacts on health and how to mitigate and adapt better. And then the implementation of the implementation of the Greenhouse Gas Multidisciplinary Commission and teamwork were essential to achieve our goal. Managers must be aware of the importance of better monitoring GAGs, mitigating the impact of hospital on climate change, and incorporating ESG principles into their planning and corporate governance. Next, please. So, and we are very happy to tell you that we got a very large of around $2 million from the National Electric Energy Agency of Brazil for the energy efficient program. And our objectives reduce the hospital's operational costs and mitigating the environment impacts. And we work in 4 energy efficient actions. First, climatization, with modernization of two chillers, in cooling with extended old refrigerators, lighting, we receiving more than 2,000 LED lamps, and the generation of renewable sources with solar energy production by building the largest rooftop photovoltaic plant in Brazilian hospitals, and with 2,200 photovoltaic panels. Next, please. And with this project, we will be saving around 2,800 megawatt hour of energy per year, and our hospital will be saving about $200,000 per year on the energy bill, and we will have a fantastic environment impact with the reduction of 1,000 tons of carbon dioxide gas per year. And the last one, so that we have hospitals that care beyond human health, that promote the health of the planet. So thank you very much for the opportunity to share our experience here with you, and I'm grateful for the inspiration of these amazing networks. Thank you all.
Muchísimas.
Thank you very much, Karina. Thank you for being here with all of us from Brazil. Please know that all of us, you have received a very strong round of applause for your presentation. And we appreciate all the activities that you are now carrying out and performing at your center. And we congratulate you for all the successes that you have achieved. Thank you. Thank you very much. We now continue our program with Jorge Palomares from the Municipal Hospital Temoaya in Mexico. His presentation is called The World Moves with Energy. Please proceed, Jorge. Welcome. Good morning, everybody. My name is Jorge Palomares Jaén. I am an administrative assistant in quality and the link for state red hospitals and green hospitals in Temoaya. My subject matter and presentation is the world moves with energy or through energy, which is the objective. We have complied with some goals, objectives related to energy. Next slide, please. One brief description of our institution. The General Temoaya Hospital is opened on May 31st of 2005, initiating or starting its operation on June of 2005. Later on in 2010 is accredited and receives the name Municipal Hospital Temoaya. It's a second-level hospital with 18 beds located in the municipality of Temoaya, State of Mexico. The hospital has received through the state government, a certificates of environmental achievement in 21 and 22, and also it's been rewarded with the prize or award of health without harm in 2021 and 2022. The world moves with energy, and it becomes a comfortable environment, because energy is the capacity that a system has to carry out a particular specific work. Our organism extracts from food to work, and motor vehicles resort to gas, diesel to move about, whether it's sun, carbon, or oil, petroleum. Our main results, have been savings in the light or energy consumption bill. We have decreased the effects of climate change and the rational and efficient use of energy. Next. Our main learning points or lessons are: we have learned to use energy in a rational way. With these small grains of sand that all participants and workers contribute at a municipal level at the hospital, it has been a fundamental aspect for this objective and project to continue evolving. We have learned to use energy in a rational way. We leverage natural light through windows. We have also conducted the switch of lighting and replaced it with LED. This has given us great savings when it comes to the economy. It allows us also for taking care of our eyesight or vision, which is a benefit for most of us workers who spend a lot of time here at the workplace. We have also created or developed a campaign related to some stickers which says, when you leave the room, turn the lights off. The less energy, more environment, better environment. If you're not physically on site, so then we are using the stickers or labels to encourage light savings. We also encourage disconnecting electronic devices and to optimize the use of air conditioning. Our next steps are to continue with the healthy habit, to place or install motion sensors in different areas, sanitation rooms, bathrooms, cleaning maintenance rooms. In our case, in this hospital, on our hallways, we actually turn off the lights for energy saving purposes so that we can leverage natural daylight, which is an important advance, the use of solar panels. Next, please. Well, with this, we have completed our work, what we have done, and I want to mention that we continue working with some objectives, such as leadership, that all personnel members clearly understand that we all are leaders and that we can contribute with a grain of sand to move forward to develop as a healthy and sustainable hospital as part of the network. And we continue being leaders in the waste management and waste treatment. And we have cardboard, PEB, glass. So we try to extract and use benefits from it. And our next objective will be water. Water is one of the very important objectives because obviously we are dealing with loss or shortage. I have some important points related to water. If you will allow me, I will share some. One I have in mind to conduct and carry out: to always close a faucet whenever it's not being used. Also to place some sand bottles next to the toilet so that not much water is wasted. Here in Temoaya it rains a lot, so it would be great to take advantage of rainfall. Also to repair leaks and maintenance related issues, and also to create groups or brigades campaigns to update and improve sanitation facilities and to make sure that we don't have any infiltrations. Also to make sure that we do and review our inventory on installed built facilities. And I conclude my presentation here, and on behalf of the Ministry of Health of the State of Mexico, the Municipal Hospital in Temoaya, our Board of Directors, colleagues, officers, employees who work in this Ministry of Health in the State of Mexico, we thank you all for the invitation and for taking into account our participation at this Latin American conference. May you all have an excellent day. Thank you very much. Thank you very much for your participation, Mr. Palomares. And also to acknowledge that we have hospitals and health centers in a global network with different degrees or levels of evolution. So all of them are very important. So it's also significant to recognize the work that the municipal hospital in Timoaja, even though they belong to their own Ministry of Health, they have created their own network of green and healthy hospitals. So they are helping each other. So thank you so much for sharing your advances. And to finish with this section of our presentation, I am very pleased to welcome, I think it's the third hospital that has come to the podium in this event, Andrés Alvarado, a quality assurance general manager in Costa Rica. He will talk about the key, the reduction of anaesthetic gases, and this is the next great barrier. Inhaled anesthetic gases. Good morning, it's a pleasure to be here. First of all, to thank the Global Network, to Méderi, for allowing us, inviting us to this very important space and opportunity, and to be able to share with you some experiences. As Andrea has said, all of us have different perspectives, and all of us can grow based on these experiences. Well, this is a private clinic. We were founded in 1829. We have 56 beds and 8 surgical or operating rooms, and we also have 228 solar panels to generate renewable energy. We have 2 campuses in San Jose and also in Santa Ana, and next year we will have a new campus or branch center. Here we have on the upper the main structure of the building, where we can see some activities that over 10 years we have been developing. The 228 solar panels are on the right, and on the left the water heating. We also have a mix or combination of rainfall usage, drinking water, and also it has been a very important and significant experience, and we have much to do. Today and yesterday I have been able to listen to very interesting things that I can take back with me to my country. What appears here down on the lower section of this slide do you have a pointer or a ray beam? No problem. Here I'd like to talk about the carbon footprint. It's been 10 years since we've been measuring the carbon footprint. We started in 2009. So we have some experience on what has happened. Well, we call it experimental footprint. 2008, 2009, 2010, 2011. In 2012, we had an auditor. What appears in blue color, dark blue, base years. They determine where we expanded the scope. So here we can see the 2012 was the first one. In 2016, we included all the main building and structures. 2019 with the when Santa Ana Center was included, and in 2021 with the chain of value or value chain was included. Here we can see the growth, behavior, and indicators when it comes to carbon footprint matters. One important thing is the external verification, because this is data that is audited. So the quality of the inventory is very important. Do I have 1,000 tons or 1,500? But I have to have certainty that it's real, verifiable. So we've been through a learning process through the ISO 14064, where it allows us to have 5 in direct emissions, 10% indirect emissions. This is very important because we have found that depending on certain emissions, either 5%, but at the end it's not real facts on the footprint. So the quality of the data is something we have worked on very much. Starting this year, we implemented emissions of solid waste. And we have a plan for 2025 that we have discussed a lot, right? Inhalers, and also everything that has to do with special waste treatment, such as chemicals, which are dealt with different, methane emissions, and so on, when it comes to the final disposal. We also have internal audit processes, a 25-person teams trained for this process. The training on personnel or for personnel is fundamental. It cannot be missing or avoided. So this is the inventory version 2019 with the Value Chain International external audit, B5, which is the national norm for carbon neutrality. On a carbon level, and I also like to thank the network, the global network, because we were invited to the Race to Zero campaign, because this makes us think what we're going to do up to 2050. We have 27 years to go. I was telling, we may not be around by 2050. We have to leave a print, a seed, as to where we want to go, or what we want to do. So the first thing is to understand and accept that we cannot do everything. What are the pathways? What are the approaches? I am going to show you the footprint from 2022. It's almost ready for the data verification process, and it's actually very accurate. Due to some internal processes, we have a 5% value. So we have a final disposal of solid waste. It was more than 37% when we started. So what this shows us, when we add chain value, or it's important to think of suppliers above, down below. These are challenges we will face. Second of all, electricity. Even though Costa Rica has an energy grid matrix, very solvent, very healthy, the energy matrix in our country. So due to billing processes, we can determine with certainty that we have a 19% of footprint generated by electricity. Then we have the LPG. It's very clear to us the areas where we need to work. Laundry, drying, ironing or pressing, dryers, we already changed or replaced. We have 3 gas dryers, we have 1 electric. The electric dryer will lower the footprint. Nutrition, kitchen area, which represents about 10%. Water heating, so that pathway is very clear. And then here we have the solar panels that contribute a little bit for the reduction of the footprint. And here the one subject matter which I am here for. Anesthesia gases, 8%, 116 tons, which hurts. It's painful. They should not be here. The nitrous oxide should not be used at hospitals anymore. I will share with you as to what we have learned with the anesthesiologist team. Then we have 5%. This is the worst enemy. This one here, because it has a potential for heating which is very high, 1700. This adds up a lot. And with the nitrate oxide, this fellow remains 114 years in the atmosphere. Let's think about what we're leaving in the atmosphere with this type of gases when we work with them. We also have the refrigerants, which represent a 5%. Here we have some actions that we're evaluating. And finally, well, we're not going to work on this. We're not going to use up our energy. And finally, this is like one of the best anesthesia gases friendly, it's only at 2%. In terms of global gases, gases represent 15% in our carbon footprint. It's manageable, right? But it requires, what was it that you said earlier? Influencers. So that stuck with me. So we were looking for influencers with anesthesiologists. This is a key word for me, very important to keep in mind. So with this important data, how can we translate it into a simple language? And that footprint, which is 216 tons, is as if we were talking 132 gas vehicles in 1 year. When I presented this to doctors, they said, wow, we never imagined this. So there are simple ways to understand what we are speaking of. This calculation has been done with emission factors in Costa Rica for an average 10,000 kilometer per year vehicle, so that we can understand where the footprint is, the carbon footprint is. So if we relate this as to what you said about transportation, we can also create links or relations. What have we done? So now I will start talking about anesthesia gases. As influencers, we're saying you need to work with people. But at the end of the day, it's about people. It's about collaborators and doctors. So the first thing we did, like a nexus with anesthesiologists and also with interested stakeholders, the ones who sell the anesthesiology equipment, machines, who manufactures, who makes the product, because they also have economic interests, and this plays out in the marketplace. So we have economic interest for us to continue buying more anesthesia gas, and we know we can reduce it. So I don't want to set aside this aspect or portion of the formula. So we did a small review on other hospitals. Albert Einstein is the preeminent hospital in Latin America for several years, and other hospitals in Australia and New Zealand. And we also have some kinescosia hospitals, and so this will be helpful to all of us. At some point, this has to reach and come. No more gases, no more nitrous oxide. But doctors are going to tell us, oh, it's just that I actually enjoy more using the isofluran and the sevofluran. So we can, between sedating or giving anesthesia to the patient to upkeeping, so there are several scenarios that come into play. So that's the important part. Well, at the end, it's important, as you were saying, I cannot forget about the process. What are we talking about here? It's about a liquid. Is it about a halogen? They evaporate. The bottle is heated. It's placed in the anesthesia machine. The patient inhales. There's a circuit, a process. So that's a very technical matter. But the thing is, we need to understand, what are we speaking about? Is it 40 millimeter bottle, vial, cylinders of nitrous oxide that is in gaseous state condition, and its potential? And another super important aspect, here it says that there is a 1790 potential, and nitrous oxide 210 and 216. But if you start doing the research and look at the literature, you can find many different potentials. We have seen values of 2,130. So when we calculate or estimate the footprint, this creates a problem, because at the end it tells me either I am above the line or below my carbon footprint. So then it's about the quality of the data. This is super important. So that's why I am also sharing these references. I don't know if you know them. This is the Meteorological Institute in Costa Rica, which is the entity that publishes all the data and relevant data. Sometimes we don't have emission factors on a national level, so we have to rely or resort to international factors. But I have found differences between this German one and this national one. So I'd like to leave that with you. When it comes to estimating the footprint, we need to make sure that factors have been reviewed by IFCC when it comes to searching for a carbon footprint. And what are specifically the race to zero? I think Andrea mentioned it. This raises the bar to the highest. And I am grateful to the network and to Andrea. Do you want to be part of it? Do you want to join us? Hey, let's do it. Let's go for it. The important thing is to say yes, and then along the way, let's get it done. Otherwise, we never do it. The important thing is to get it done, to do it. So when we joined Race to Zero anesthesia cases, we decided that it would be our first aspect or field to do trials where taking into account other areas. This is a very interesting case because it's related to culture, influencers, and doctors. So we have a landscape, a very interesting landscape. I can reduce 200 tons over 7 to 10 years. Very attractive. Very difficult, though, because many anesthesiologists tell us, oh, I have always worked with nitrous oxide gases, or because of clinical preferences, I have used this or that. So it's important to know this. What are the specific actions? Because this is being developed. It's not ready. We're just getting started. First of all, to reduce the use and consumption of fluorine, the potential of heating, the lowest potential in heating, to empower the intravenous anesthesia. This is being used in England quite a lot, New Zealand, but not all surgical procedures can be done with this. We have to have clarity that not everything can be done with certain techniques. And the most important is to reduce the feeding flows on patients, maintaining the quality. We are an accredited hospital. We cannot let the guard down. But we can also definitely influence the flows, or half a liter per minute. We can perfectly reduce the generation of anesthesia gases and carbon footprint. And then we now go into the process. We have the machine for anesthesia. These are Drager machines. And what we have is different gases, oxygen, air, nitrous oxide. What anesthesiologists explain, that's their subject matter. That's the transporting gas. We can use air or nitrous oxide, N2O. Can we just use air? It's very simple, right? But it's a cultural habit that we need to change. And hallucinogens. Our proposal is for us to use a fresh gas flow. We have been doing sampling. Unfortunately, we could not unload or download data from the machines. Sometimes we have found that some doctors use 4 liters per minute, and this generates a lot of carbon footprint or a high level. So it's important to keep it in mind. And here comes the CO2 fluorine. As when it comes to the commercial flow, 1 under liter, the compound A, it's a toxic compound, but there are scientific articles that tells us this is not so. So we need to research, to get advised, and also to use influencers. This affects the quality of clinical care. This could be one of the aspects that we need to break through, because the manufacturer wants you to buy more gases, and that's what we should not do. Let's go back to the supply chain. Purchasing and procurement is transversal, related to all the reduction of footprint. of the footprint. And then the TIVA infusion pumps, where an intravenous can do the process. It has been a very interesting experience because since we are in the midst of the process, so we created a methodological guide that I will share with you. First of all, as is always the case, to improve the process and also to generate a baseline. So we have a 4-year-long baseline of audited footprint, which allows us to do how we're doing and where we're heading to by 2030 and also by 2050. So our mission is to be able to do it by 2030 based on the requirements by Race to Zero. The second part is to define the interested parties, to include suppliers, doctors who are key in this process, to identify stakeholders and for them to participate. Make sure that you get people involved so it can be successful. To listen to their opinion, we have spent months listening to anesthesiologists saying one thing, saying another. They also express complaints. I don't have this, I am missing this, and so on. So that's the way it is when it comes to all processes. There are synergies and opportunities to improve. 4, to define the relevance of stakeholders. And this includes the whole spectrum with the key stakeholders that will contribute to the reduction project. 5, to define which surgeries can be applicable. Not everything is applicable to the use of TIVA or nitrous oxide. 6, costs. We did a small calculation when it comes to cost. We were able to find we can obtain some important savings. Clinical aspects when it comes to low flows, that's very important. Don't let them fool you or deceive you. We have articles and I can share them with you with much pleasure. This is something that has been the lesser use of nitrous oxide, and then administrative management and processes related to Race to Zero. And we are now in a sensitivity type of process with anesthesiology gases specialists with about 40 anesthesiologists so that we can promote the message. And finally, to implement. When it's going to be implemented, there has to be an indicator, there has to be a follow-up, there has to be a chart, show the anesthesiologist this is a continuous improvement cycle. So this has been more or less the experience in this lapse or time period of 10 months with the stakeholders. And finally, what actually happens when we started to measure anesthesia gases in 2018, we had this data available. 54.2 of kilograms of CO2 equivalent per surgery. In 2019, it went up to 57, and then it went down to 47. In 2022, it goes down to 40. What's the explanation for it? What do you think is the reason? It's a subject matter. It's part of the analysis we need to do. We analyzed that the complexity of surgeries that we're having is higher. The timing, it's extended for those surgeries. That's why we're thinking that per indicator, per CO2 permitted in surgery, but we have to find the data to get to that. So where do I get or obtain the data? Am I going to apply it on all anesthesiology machines? This, what shows in orange, is what we have already experienced, and above that is what we aim, Race to Zero. That's our goal. So we are setting ourselves a goal, 5% in this year. We are just getting started, socializing, and next year, 7%, all the way up to 2030. Let's see if we can make it. And if nothing happens, we're entitled to make a mistake, but that's where we're going, to get to a 2.1 kilograms per surgery, at least with this indicator. That's the other chart, $15,000 per year. It's attractive. It's a significant savings, and we need to take it into account. Let's see. How can I go back? It's with this. Excuse me, I got it. And the last part, this has to do with objective number 3, sustainable development. Even if we're small in scale, we can contribute in this commitment. But I wanted to show to you is the forecast projection. All hospitals grow. We're going to have more facilities, more surgeries, more patients. We all want to do more business, whether it's public or private. It doesn't matter. So what we did was a simulation from here through 2030, understanding what the growth will be, the number of surgeries, so that when we grow in the number of surgeries, there will be a higher footprint, and how we can reduce little by little the footprint per surgery. So this forecast or projection gives me an incentive, and hopefully we can see more realistic results. And those increased results deal with the new center, clinical center, and our built-in capability. And I know that I have probably gone over my time period. What are the main learning points? We have a high quality equipment and devices, availability, the use of BIS, which anesthesiologists use to determine how dormant or passive is the patient. Not all of them use it. All of them have to use it. It's part of the process. It goes hand in hand with the anesthesiology gases. Safety and TIVA, the use of TIVA, the reduction of the pumps, training of personnel. The TIVA pump has different characteristics compared to other pumps. Take into account that this is important. The influencer or spokesman, spokeswoman, access to information. Next steps to become sensitive about what we are doing. The present or current indicator, future, CO2, zero CO2, and nitrous oxide zero, to remove it or reduce it, and to use lower flows. With lower flows, we will reach our goal. Thank you very much. Thank you very much, Andres. You were saying we're very small, but something we will get done. As you said earlier, none of the presentations, none of the experiences that have been shared here, none of them are small. And judging by all the nodding of heads here, for many, this resonates. It's a very important challenge to approach, to address, and the best way to learn is to watch other people to avoid making mistakes. Thank you very much for sharing, not only for the hospital, but also for the achievements, especially the next steps where we hope what comes next. And thank you for promoting the Race to Zero. It makes my job easier. We now have a brief space for questions and answers. Here we have a raised hand for the first question. Let's see, let's find out who it is for.
Good day. I wanted to thank the engineer we want to talk about the environmental impact and the collaboration in the environment. For my specialty, I want to keep you as a referent. Thank you, doctor. I assume to the congratulations. We have another question for Andrew. They're asking us for propofol as one of the possible forms of anesthesia, non-annihilated anesthesia. And how is the experience in the clinical experience of inhalated and the ones that are focused here? Yes, thank you very much. Please come here. Okay, sorry. Okay, yes, in effect, the propofol is is one that is used, and there's a lot of resistance. We're trying to create a process of sensibilization, and not just propofol. I don't even know the names of so many, but the propofol is one of them. But not all the processes can be done with TIVA. And where they cannot be done, we should try to use low levels. Okay, thank you very much. Before I pass the word, let me see if someone else wants to make a question. Oh, she's connected with us? Okay.
Bueno, buenos días. Mi nombre es Lina Guerao, de Secretaría de Salud de Santiago de Cali. Como Secretaría de Salud
of Health, it's very important as a Ministry of Health in Colombia to be able to apply and to promote more so than implementing. It's like promoting from the government's standpoint of view so that the hospitals can implement all these initiatives and for us to be an active axle and reference to get these results. So I am not sure if in your country there are some guidelines that we can retake or apply over here. I will try to translate.
Iniciativas desde o governo, então, como que se poderia, sugestões de como se poderia implementar em outras situações, em outras secretarias. Se as diretrizes no Brasil poderiam ser implementadas, compartilhadas com eles.
Então, o começo eu não entendi, Alessandra.
Como Secretaria de Saúde, a importância de implementação das iniciativas a partir do governo, se há diretrizes do Brasil que possam ser compartilhadas com eles, pensando que a sua organização também é uma organização pública.
Sim. No Brasil, em especial no estado de São Paulo, acho que o programa de hospitais saudáveis que tem virado isso, né, tentado trazer esse fórum de discussão.
So then, Healthy Hospitals Project has tried to look at this discussion forum.
Muito apoio, ser sincero dizer isso, né? O grupo vem mas não temos políticas públicas ainda estabelecidas no Brasil para fortalecer essa nossa rede. Então, são muitos lugares que participam, mas não temos políticas públicas bem estabelecidas ainda.
So then this work for the Healthy Hospitals Project has been established by the group, but there are no public policies that can be used as a reference or a referential marker.
E acho que o importante é esse movimento todo que nós estamos fazendo aqui desde ontem, né, de compartilhar as experiências e de fato, trazer isso para a agenda, né, dos nossos gestores, para que isso, de fato, seja implantado.
So, what we're doing, including yesterday's presentation, to discuss, and it's important that we use and view this as the beginning of this exercise or this action. Thank you very much. Important to identify the gap, what you are doing, public policies in our countries, our institutions, an invitation to do something related to this matter. Over here we had the next question. Yes, please. Can you tell us who the question is addressed to? Veronica Torres from the Austral Hospital in Argentina. The question is for Andres. I understood that you had done some type of rotating. Is there a mito facilitator, internal mito facilitator? What type of equipment did you, or input from the anesthesiologist and your stakeholders in your clinic? I see that you were more fortunate than we were. Well, truthfully, I haven't been that fortunate. I am being sincere. It's not easy. One has to be frank. It's not easy. But what we did was to contact a doctor in Costa Rica who works also in the public sector and who is a wonderful and expert, wonderful man. I've been searching for him for about 2 months or so. And he allowed me to have a webinar or web seminar with different consultants and anesthesiologists. What we're looking into is to see, we're going to start with the ones that do the most surgeries. So yes, we have to search and find an influencer. It may not be effective, but it's necessary. And the other important thing is the support from high management or upper management. We can do it clinically, but if upper management is not interested, thank God we have their support. Now we're working with sustainability, and we want to go into NSG, but this is helpful. This is very helpful, so we welcome all of this. I'd like to take this opportunity because one doctor anesthesiologist asked me to mention the calibration of the steamers or vaporizers. The same way we talk about the quality of carbon footprint data, we need to talk about the calibration of the vaporizers. When it comes to the AVI technology, one of our suppliers, to reduce the leaks that could occur when it comes to the vaporization of the halogen. So again, the process is super important. We have one more question over there. Can you tell us where you're coming from? Good morning. From Panama? Not all patients use propofol. One of the incipients of that medication is the egg phase, allergic, yolk. So when it comes to surgical procedures in my area, hematology, it's very difficult for them to use a propofol because this could cause on neonatal patients, it could cause intubation of the newly born. So we have to assess this to reduce the carbon footprint, but also based on what other drug or medication can we use. Is it a comment or a question? I'm not sure. We also have one other question. Andres, thank you for your comment. Yes, it's multiple. The anesthetics. Anything else? Yeah, it's valid. And the anesthesiologist, doctor who is here, could also add, when we spoke with them, in others we use medications. In the surgical procedure, you can use different types of gases. It's a very complex subject. No escucho. I'm not sure if the doctor wants to listen. The analgesic plan. So, It's not so much we use loporfin, which is excellent. For cardiac surgery, it depends of the anesthesiologist. In last century, imagine the personnel. Last century, Alotano, anesthesiologists would fall asleep because there wasn't an environment. It was today, that's basically obsolete, but based on what you have exposed and presented today, they don't give the importance because from the labs, and some of them are honest. Fine, I am not going to buy, but I want to sell you my analgesic. When it comes to propofol, one has to see the source that comes from England. But the other brands were the generic brands. It's not just one file, it's actually two. So we're speaking, what complications are we speaking about? So sometimes anesthesiologists don't want to use it when the purchase itself is not assessed. One other question, let's try to be as brief as possible. Thank you, Maria Marta. First of all, thank you, Andres. I think it has to do with anesthesiology. With us, we have sevoflurane and low flow. We are under 1 or less than 1. And with Tiva, we're doing intravenous. We have 5 anesthesiologists, of which 3 sent me when they told us that it was prohibited, the fluorine. What it concerns us in Argentina, the rumor is going around and some articles are being shown when it comes to intensive therapies. That is, they're looking or seeking sedation with intensive therapies with sevoflurane and another aloflurane, sevoflurane, and some manuals and protocols when it comes to sedation in intensive therapies, for which hospital pharmaceuticals are resisting from their standpoint, and I wanted to know if this is happening in another country. Actually, I don't have the answer. The answer is simple. I work also in intensive therapy. I have not allowed, because there has to be a permanent anesthesiologist on hand. In relationship to the components, there are proponents, special proponents. One should not allow that. There is not going to be an adequate care. The only opportunity is when intensive therapy should be used if the patient is asthmatic, insufrano. But that's 1 in 1,000. I would not allow or give my okay for that process to happen. Thank you. This discussion obviously gives material and content to continue. Andres and doctor from Peru, we are about to break for lunch. I just want to remind you that lunch is open. We have different options when it comes to lunch here on the Méderi Hospital, and we will see you back for today's last session at 2 p.m. right on time. Please be on time. Enjoy your lunch. Thank you.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we're able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I'm deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we are gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor, con 40.000 metros cuadrados, y el Hospital Universitario Barrios Unidos, con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, Red Hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín, en San Vicente Fundación, en su sede de Río Negro, que es el primer hospital latino por fuera de Estados Unidos. Es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo incorporar perspectiva de género en las compras sostenibles, que ha tenido un muy buen resultado con nuestros miembros.
Para nosotros en Salud Sin Daño es muy importante poder generar estos espacios en donde las y los profesionales de salud que trabajan en las instituciones que forman parte de la red global se conocen, intercambian el trabajo y la experiencia del día a día, aprenden no solamente de las capacitaciones que brindamos, sino también del trabajo y de los resultados que están logrando en sus propias instituciones. Así que siempre es una prioridad para nosotros poder generar estos encuentros presenciales en donde aparece esta riqueza en el aprendizaje a través de las experiencias comunes.
Hoy las charlas de género, de energía, mostraron resultados que podemos llevar a nuestras comunidades y beneficiar así a las personas que trabajan en los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno y de alguna manera esta herramienta tan efectiva que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, enmarcándolo en compra, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. Tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que, fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más poder llevarnos, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compras sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin, in Colombia, for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability in energy, in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you can tell how excited everybody is to be making these changes in their home institutions. You can tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada, and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial. Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la Red Global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil with long-lasting effects on aquatic systems, and they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium-based disinfectants, and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning, and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly, and apply the product for the recommended duration. Do not mix or combine products, and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya el liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin, de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de salud sin daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
Hablamos de las soluciones del cambio climático, no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
El cambio climático es un problema de salud pública. Sus consecuencias están a la vista. Como médico y como joven, siento la enorme responsabilidad de hacerme cargo, de alzar la voz, de crear vínculos y relaciones estratégicas con mis pares, de abordar este problema global de forma interdisciplinaria, porque no hay más tiempo, porque la respuesta tiene que ser ahora.
It is critically important for the health sector to lead by example, to increase our credibility, to say we need to have policies of non-proliferation of fossil fuels because of climate change and health.
Make sure that you use your influence as a health professional to lead by example, reduce our carbon footprint.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I am deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we're gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor, con 40.000 metros cuadrados, y el Hospital Universitario Barrios Unidos, con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, red hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín, en San Vicente Fundación, en su sede de Río Negro, que es el primer hospital latino por fuera de Estados Unidos. Es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo incorporar perspectiva de género en las compras sostenibles, que ha tenido un muy buen resultado con nuestros miembros.
Para nosotros en Salud Sin Daño es muy importante poder generar estos espacios en donde las y los profesionales de salud que trabajan en las instituciones que forman parte de la red global se conocen, intercambian el trabajo y la experiencia del día a día, aprenden no solamente de las capacitaciones que brindamos, sino también del trabajo y de los resultados que están logrando en sus propias instituciones. Así que siempre es una prioridad para nosotros poder generar estos encuentros presenciales en donde aparece esta riqueza en el aprendizaje a través de las experiencias comunes.
Hoy las charlas de género, de energía, mostraron resultados que podemos llevar a nuestras comunidades y beneficiar así a las personas que trabajan en los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno y de alguna manera esta herramienta tan efectiva que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, enmarcándolo en compras, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. En particular nosotros tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que, fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más valioso, poder llevarnos criterios, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compras sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin, in Colombia, for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability and energy in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you could tell how excited everybody is to be making these changes in their home institutions. You could tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial. Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la Red Global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil with long-lasting effects on aquatic systems, and they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium-based disinfectants and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly and apply the product for the recommended duration. Do not mix or combine products and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya un liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de Salud Sin Daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
Cuando hablamos de las soluciones del cambio climático, no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
El cambio climático es un problema de salud pública. Sus consecuencias están a la vista. Como médico y como joven, siento la enorme responsabilidad de hacerme cargo, de alzar la voz, de crear vínculos y relaciones estratégicas con mis pares, de abordar este problema global de forma interdisciplinaria. Porque no hay más tiempo, porque la respuesta tiene que ser ahora.
It is critically important for the health sector to lead by example, to increase our credibility, to say we need to have policies of non-proliferation of fossil fuels because of climate change and health.
Make sure that you use your influence as a health professional to lead by example, reduce our carbon footprint.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare, of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I am deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we are gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor, con 40.000 metros cuadrados, y el Hospital Universitario Barrios Unidos, con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, red hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín, en San Vicente Fundación, en su sede de Río Negro, que es el primer hospital latino por fuera de Estados Unidos. Es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo incorporar perspectiva de género en las compras sostenibles, que ha tenido un muy buen resultado con nuestros miembros.
Para nosotros en Salud Sin Daño es muy importante poder generar estos espacios en donde las y los profesionales de salud que trabajan en las instituciones que forman parte de la red global se conocen, intercambian el trabajo y la experiencia del día a día, aprenden no solamente de las capacitaciones que brindamos, sino también del trabajo y de los resultados que están logrando en sus propias instituciones. Así que siempre es una prioridad para nosotros poder generar estos encuentros presenciales en donde aparece esta riqueza en el aprendizaje a través de las experiencias comunes.
Hoy las charlas de género, de energía, mostraron resultados que podemos llevar a nuestras comunidades y beneficiar así a las personas que trabajan en los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno y de alguna manera esta herramienta tan efectiva que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, enmarcándolo en compras, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. En particular nosotros tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que, fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más valioso, poder llevarnos criterios, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compras sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin, in Colombia, for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability in energy, in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you could tell how excited everybody is to be making these changes in their home institutions. You could tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada, and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento se está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial. Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la Red Global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil, with long-lasting effects on aquatic systems, and they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium-based disinfectants, and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning, and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly and apply the product for the recommended duration. Do not mix or combine products and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya un liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de Salud Sin Daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
Hablamos de las soluciones del cambio climático, no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
El cambio climático es un problema de salud pública. Sus consecuencias están a la vista. Como médico y como joven, siento la enorme responsabilidad de hacerme cargo, de alzar la voz, de crear vínculos y relaciones estratégicas con mis pares, de abordar este problema global de forma interdisciplinaria, porque no hay más tiempo, porque la respuesta tiene que ser ahora.
It is critically important for the health sector to lead by example, to increase our credibility, to say we need to have policies of non-proliferation of fossil fuels because of climate change and health.
Make sure that you use your influence as a health professional to lead by example, reduce our carbon footprint.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be
cómo poder llegar a articular los dos sistemas de salud, tanto el sistema de salud indígena como el sistema de salud.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I am deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we are gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus dos sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor con 40.000 metros cuadrados y el Hospital Universitario Barrios Unidos con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, red hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín, en San Vicente Fundación, en su sede de Río Negro, que es el primer hospital latino por fuera de Estados Unidos. Es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo incorporar perspectiva de género en las compras sostenibles, que ha tenido un muy buen resultado con nuestros miembros.
Para nosotros en Salud Sin Daño es muy importante poder generar estos espacios en donde las y los profesionales de salud que trabajan en las instituciones que forman parte de la red global se conocen, intercambian el trabajo y la experiencia del día a día, aprenden no solamente de las capacitaciones que brindamos, sino también del trabajo y de los resultados que están logrando en sus propias instituciones. Así que siempre es una prioridad para nosotros poder generar estos encuentros presenciales en donde aparece esta riqueza en el aprendizaje a través de las experiencias comunes.
Hoy las charlas de género, de energía, mostraron resultados que podemos llevar a nuestras comunidades y beneficiar así a las personas que trabajan en los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno y de alguna manera esta herramienta tan efectiva que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, marcándolo en compra, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. En particular nosotros tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más valioso, poder llevarnos criterios, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compra sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin, in Colombia, for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability in energy, in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you can tell how excited everybody is to be making these changes in their home institutions. You can tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento se está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial. Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la red global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil, with long-lasting effects on aquatic systems. And they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium-based disinfectants and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly, and apply the product for the recommended duration. Do not mix or combine products, and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya el liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de Salud Sin Daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
Cuando hablamos de las soluciones del cambio climático, no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
El cambio climático es un problema de salud pública. Sus consecuencias están a la vista. Como médico y como joven, siento la enorme responsabilidad de hacerme cargo, de alzar la voz, de crear vínculos y relaciones estratégicas con mis pares, de abordar este problema global de forma interdisciplinaria, porque no hay más tiempo. porque la respuesta tiene que ser ahora.
It is critically important for the health sector to lead by example, to increase our credibility, to say we need to have policies of non-proliferation of fossil fuels because of climate change and health.
Make sure that you use your influence as a health professional to lead by example, reduce our carbon footprint.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare, of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I'm deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we are gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor, con 40.000 metros cuadrados, y el Hospital Universitario Barrios Unidos, con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, red hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín, en San Vicente Fundación, en su sede de Río Negro, que es el primer hospital LEED Platinum por fuera de Estados Unidos. Es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo
los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno, y de alguna manera esta herramienta tan efectiva, que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, enmarcándolo en compras, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. En particular nosotros tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más valioso, poder llevarnos criterios, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compras sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin in Colombia for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability in energy, in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you can tell how excited everybody is to be making these changes in their home institutions. You can tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada, and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial. Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la Red Global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil, with long-lasting effects on aquatic systems, and they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium disinfectants and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly, and apply the product for the recommended duration. Do not mix or combine products, and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya el liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de salud sin daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
De las soluciones del cambio climático no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
Antes de que arranquemos la transmisión en vivo, me pidieron recordarles de nuestros anfitriones de Méderi que tienen un fotógrafo profesional que por allá atrás anda y que en la zona del registro, donde ustedes hicieron su registro ayer y esta mañana, está tomando fotos, ya sean individuales o grupales. Si alguien se quiere sacar su foto, que aprovechen que tenemos el apoyo del compañero y luego se las haremos llegar, yo creo que por una carpeta de Drive, veremos cómo se las hacemos llegar, pero para que aprovechen quienes no se hayan tomado la foto, que pasen ahí a la zona de registro. Al final vamos a estar todo el equipo de Salud Sin Daño por allá, porque nos queremos también tomar fotos con ustedes, así que si les parece, dejamos esas fotos para el final y ahí con el apoyo de fotógrafo profesional, que siempre salen más bonitas. Bueno, ¿estamos listos para empezar? Bueno, pues buenas tardes a todas y a todos.
Good afternoon, everybody. Welcome back from your lunch break. To those of you who are joining us online, we're going to start our afternoon session of the 5th Latin American Conference of the Global Network of Green and Healthy Hospitals. I'd like to remind you about our allied institutions who made this possible. We would like to start to recognize our strategic allied Méderi Hospital University and our special allies Clinic Hill, Valladolid Foundation, and also from Costa Rica, Clinical Biblical Hospital, and from Argentina, Luz Celeste Clinic. Thank you very much to all of you. We're going to start with our second panel for this afternoon, excuse me. So this will be about leadership, and also we're going to, just the same way we did it in the morning, intercultural and health in the health sector. And the second one will be a round table with parties and actors from the different aspects when faced with the challenges in the Latin American sector. I'd like to yield the microphone to our colleague Claudia Lorena Paz, who is our facilitator for Latin America in Health Without Harm. Thank you, Andre. Quickly, we wanted to give you a brief introduction why we decided to include these panel members in our today's agenda. As you will know, leadership is one of our 10 objectives. Specifically, these bullets tell us and indicate what leadership is about in our agenda: to prioritize environmental health and their determinants, whether be them social or public health, to achieve a good and wide, ample participation from the community, not only governance, internally and also external, patients as well as nearby community, including academia as well. To get the community involved, it means to promote healthy environmental practices and to extend and go beyond the institution. This as governance. And this helps us to do what? To reduce exposure to chemical substances concerning for human health, the environment, to manage waste in a safe way. And because of this, the community with its knowledge allows us to improve our environmental performance. As hospitals and entities, healthcare entities, we sometimes forget to acknowledge the multicultural aspect brings about. Own knowledge, our knowing, cultural components, everything that is included in the multicultural component. So why is it important to include all of these criteria within the environmental management and process? It allows us to keep in mind the past and the present and how we can improve, to prevent any damage or to be able to lead in our community, to include diversity in our environmental management, to work safely to reduce and to work with safe food and nutrition, safety, food safety, to improve our waste management, to improve our sustainable aspects. Three basic principles: to go back to basics, to go back to the origin of source, to be respectful of Earth. To go back to basics, we sometimes have complicated our existence to use plastic all the time. To go back to basics, and this means to go back into the past, as I said before, to remember where our surgical operating rooms did not use as much plastic as they did before, when our gowns were reusable, when the fields were reusable, when uniforms were reusable, except for the entire gown that medical personnel wears. So here we're looking at an image here. This is a way back type of image from a surgical operating room. And there are some images that are shown and exhibited how surgical operating or ERs were like or looked like. Here's an image. This is not really the past. It's about the present time in Paz and in Pasto, a hospital in Pasto, which takes advantage of energy, solar energy. This means going back to the basics. When our bags, recipients, containers, or ultravenous bags were not plastic. Or a photograph of the present time, how we incorporate as a medicinal orchard that we can use to introduce and use healthy foods and healthy vegetables in our hospital. With this, I yield to the next panel member because they are going to discuss and talk about two successful experiences. Thank you.
Bien, pues habiendo así enmarcado qué real.
Very well. What do we actually mean when we say leadership in the environment? It's a pleasure to introduce John Mellizo. He comes from the La Estancia Clinic in Colombia, who will share with us healthcare in this sector. Welcome, John.
Hello, good afternoon for everybody. It's an honor to be here. Thank you very much for the invitation. Thank you very much for the red green clinics. I extend hello for the Cles Celeste Argentina Hospital. The name of the institution. The name of the institution. We will introduce our vision of attention in health and intercultural and sustainable. Our institution is located in Pompayán, in the Cauca. We have more than 20 years working as an institution. We have 25 beds. We have an area of 30,000 square meters. 64 administrative, 500 for specialties. We have 36 practicants and 36 students. 218 tertiarians. Here, basically, to make a beginning, our horizon in these 20 years, what we have done, our mission has been to give a management of health with focusing on intercultural management. In this sense, our vision is directed so that in 2026 we will have the accreditation and our compromise under this case under focusing on the idea of intercultural sustainable intercultural vision. I will explain now what we are looking what we're looking in this model. We will be showing this model with of intercultural sustenance. Basically, what we have as an institution to be able to respect and value the cultural diversity and understand exactly what traditions and cultures that exist. Continuation, we will show you a video so you can see a little about our history.
Entendimos que no estamos solos, que la tierra es de todos y no tiene límites, que independientes somos fuertes pero unidos, somos invencibles y que si unimos nuestros conocimientos podremos cuidar mejor de nuestra gente. Por eso abrimos nuestro corazón, emprendimos hacia tierras sagradas para conocer lo mejor de ellos y compartir lo mejor de nosotros por el bien de todos. Es así como visitamos diferentes pueblos indígenas.
Clínica La Estancia, donde la ciencia y la tradición convergen.
Bien, en este caso.
Okay, in this case, that was a resume of what we do in our team. This is, I'm trying to show you how our participants team started working. This is the way we work with communities and how we work during the pandemic. This is from the highest form of management. We work with more than 10 different elements. We went to these territories to talk to different ethnicities and understand their interculturality. Is this the way that we understood their needs and the way we can understand and the meaning of Pachamama? It's precisely in this way that we understand this premise and this idea, and to give them a better healthcare and in the relationship with the environment. Okay, we will show now in the way that is related.
Que representa tener el conocimiento suficiente que garantice una atención adecuada a nuestros pueblos indígenas. Por eso nos adaptamos, mejoramos y ahora estamos en la capacidad de brindar una atención por medio de diálogo de saberes, porque nos une la tradición y la vida.
In this dialogue of knowledges, of tradition and respect for life, is that this project was born between the year 2020 and 2019. We had the first pavilion of intercultural pavilion of Colombia. And this is how we found the first results in the management of cultural project. This is of course only 4, there's many more, but from these 4 is the one that we made the construction of the Maloca, precisely a sector that allowed that these communities found us in a more natural way. This allowed us to give them more satisfaction in their territories and to feel more accustomed to us in their houses, in their territory. We also built some tulpas inside the malocas. You know, we had to understand what fire represents to them. You know, it's a symbol of their spiritual conception. So this is very important for us and for them. They are ancestral doctors, and we had to adapt to this vision and adapt this pavilion for their needs. We started to also accommodate the spiral, also other options like orchards of medicinal plants, like in shamanic communities. This is they share with us all this knowledge of medicinal plants, and this is the way we used it in a beneficial way for for the intercultural system that we were building. Also, we use this for an artistic vision and a vision of music. And we open yes, to invite people to become part of it. We have 45 beds for indigenous. We also have very special things that we need to mention. We have special rooms for midwives that we have adapted for the way they do it, the way they give labor. We use the maternas, the midwives, so the father can take part of the birth. We have also incorporated the chumbe, something that is very particular to this culture. And this has bring a lot of satisfaction to these cultures. Here we can also see some images that are representatives of our model of interculturality, and in this case, to comment you, that is precisely in this aspect that we have been able to identify the system of placenta, the importance of the placenta for these communities. As that, what we did is to incorporate the idea of a program of medicine based on this idea of the placenta. What we do is precisely to give to the patient the placenta. So what we did was to give them, to donate them a tree. We give them the placenta, and we also give them native tree. And we do this because this is a way in which we can reforest. This is a work that we have done with communities in a process of interculturality and responsibility, social responsibility. Since the project of 2021, we have managed to donate and create orchards in order to diminish the waste. This is also comes with something additional. In our same area of institutionality, we created a form of orbiculture. Inside the communities, what we do in these orchards is to look the captation and work with all the waste, and we process this waste and we donate them to our patients in this model of attention. Here you can see some images of reference that we count in this moment. I don't know if you can see them. Here is the dynamics of visualization. The NASA we are familiarized with their languages, so they feel at home, and the treatment that we give them is differential. Here we can see the general pavilion. What is the result of our general pavilion?
Pabellón intercultural en Colombia, que busca la conexión de la medicina ancestral y la tradicional, para brindar a nuestros pueblos indígenas una atención humanizada, pensada desde sus creencias y conocimientos. Pabellón intercultural Huipala, unidos como si fueran uno solo, encaminando lo justo.
Okay, now, basically in that order. Okay, wait a second. Our principal learning lessons were the strengthening our service of health for the communities, and it has also been very important for us to strengthen the consciences of community and environment in the communities. Also, we have changed the way we give them and provide them with the health services. The strengthening of a preferential attention through strategies of the model of the hotel estancia, attention to intercultural and model of humane deliver, the promotion of communitary and the empowering of people in the health care. Also, we offer medicine, extramural medicine, visiting. We also foment, we encourage the dialogue of intercultural and learning between professionals, of translators, internal, and the different people from different cultures. And this is the way. And finally, in our projection, our project is very important. It's the cycle of food, like taking of organic residue. We want to strengthen the waste, the organic waste. We also want to use orchards in indigenous territories with their consent, and also to give more power to so people can learn and study this, and they have also the way in the transportation and the management of foods, and finally the consumption, the healthy consumption inside the Maloca, the institutional Maloca. So I thank you very much, this space, and remind you that this has been a process of construction, of social construction. Thank you very much.
Muchísimas gracias, John.
Thank you for such a region in Latin America where we have such diversity, cultural diversity. I would imagine that this is the case in Mexico. We have 68 indigenous townships, and it would be probably the same case for most countries. Thank you for bringing about this subject and sharing this with us. Now I have the pleasure to invite Aura Moreno, a environmental leader. Please come forward from Pitalito. She will share with us the School of Sustainable Midwifery and Medicinal Chagra with indigenous communities. Thank you very much. Good afternoon, everybody. A big thanks to Health Without Harm. A big thanks to Méderi, and to thank you for the opportunity to show you our strategy and to have the honor of sharing, of learning from you, and to introduce and present to you what we're doing. Well, along with my fellow and colleague Auro, who is the industrial engineer, we come from the social company de Pitalito San Antonio. This is located in the state or department of Huila, Colombia. Pitalito is the second largest city in the state of Huila. It's approximately 550 kilometers towards the southbound region of our country. We're about 12 hours land based. There are some flights from Bogota to Pitalito every day, thank God. It's a 1 hour flight. Pitalito is from the border with Ecuador, approximately 350 some plus kilometers. That is, from Pitalito to the border with Ecuador, we have about a 9 hour long distance by land. I am sharing this with you so that you can position yourselves in this geographical map in Latin America as to where we are located. Pitalito is a 200,000 inhabitants city, a 20 to 24 degree warm, moderate climate. At nights, we have comfortable weather with very colorful flowers, huge, exuberant trees. You now have to think that we are surrounded by nature. The population among those 200,000 inhabitants that we have in Pitalito, we also have with an indigenous population of approximately 373 indigenous families, of which these are conformed of 5 groups, very important indigenous communities. Our hospital, therefore, in this image you're now looking at on the slide, it's been around for 50 years approximately. It's a hospital that characterizes because it's only one single level. The administrative section has 2 floors. This facilitates the access to our users, our patients. And we are working on our hospital on the way to getting internationally certified and accredited. We're working every day to comply with the optimal standards, international quality standards. And within this compliance process for standards, we were managed to join the global network of green and healthy hospitals. We are very grateful, and the footprint that we have managed to leave in our population. And at the hospital, we have proposed and created our management plan, and we have called it Development and Hospital Transformation with Human Management. Everything we have discussed in this 2-day conference, if it wasn't for us, people, human beings, none of this would actually be here or be real. So that's why human development is very critical. So within this plan, we have 6 very fundamental axles: risk management, resources, social corporate responsibility, and leading the chapter development of environmental management. Very well. In our hospital, with this social responsibility angle and perspective, the first cause for morbidity for us is the delivery attention or midwifery decision. So Boca, Caucana, Caqueta, and Putumayo are the 3 regions, and also there are 9 municipalities that get coverage. So we have more or less 500,000 potential users. As I said before, within these potential users that come to our hospital every day, they come from indigenous populations. Out of those 373 families, indigenous families, and since this is the main cause of attention and morbidity, we are serving needs 400 deliveries, birth deliveries per month, which means 4,800 births per year. You can imagine the different problems and issues that come about with our patients. So then we started to get the maternal, indigenous maternal population into our hospital. And when we catered and served the birth they would tell us that at the very moment of the Enlightenment, they started to request that we should provide them with medicinal and infusion type of waters, and we had no idea what they meant, what type of medicinal waters, as to what they wanted. And there, precisely at that moment, the seed came about that as a hospital, not only should we have and know the scientific knowledge, but we also needed to deepen our knowledge and the cultural know-how regarding our patients who come to see us, and indigenous groups especially. So that's where that seed sprouted and came about, for working towards the culture, the knowledge, and that's when we started to handle and manage this chagra concept, which is basically the availability of a space, terrain, or territory. But the chagra goes beyond. It's not just the actual territory, but to plan, to organize it, to fertilize it, to mix it up, how the seeds are left or planted. And the only way for us to be able to have and acquire this knowledge is through communication with our own mothers and with the indigenous population that comes to our hospital. So at some point, at any given time, we could have told the purchasing or procurement person, go to the supermarket, buy some tea or infusion type of tea bags, and that's what they are asking for. No, it's not so much that. Our maternal request has a deeper meaning, the connectivity issue and our aspect with life, spirituality, the religious angle, life driven, the respect towards the culture, the respect for the origin of life. That's what we started to learn by talking to them. And that's when we invited these populations so that they could come into our hospital. And with them, we created a hospital orchard. They taught us how to plant, how to sow, how to get the soil organized. And the second part of this talk, our environmental engineer will share that information with you. So we can tell you now that we are fully aware in our hospital, and we know that us doctors, we can treat patients, but nature actually heals us, and that it could be any country, it could be in any system, but the most important aspect about the system is the human being who works for or towards biodiversity, for the ecology angle, and the respect towards Earth. The rest comes later. Thank you very much. Well, that's our general manager. Thank you. Thank God that's our hospital director. Truthfully, one feels grateful when we were listening to our different colleagues who face different challenges in the environmental aspect. Thank God we have the most ecological minded general or hospital director. It has been a learning process. It's about learning a little bit of everything. And it has been a beautiful experience for her to be with us in all conferences, learning from all of us. And also to understand that it's not just us environmental people, but also doctors and different professionals. Thank you very much to the Global Network. Thank you for Claudia for your follow-up support and guidance. So with this appetizer that our colleague initiated her talk, there are so many more indigenous populations besides Cauca, but we need to recognize the need to understand the cultural component and to contribute and to avoid the loss of knowledge and the getting to know indigenous population.
De estas comunidades de
And some of these communities and what happens in rural areas, people no longer want to work with the soil, with the land. People want to relocate to cities and do other things. So this is a very specific and particular aspect, and we want to motivate people within the community so that they can continue with these strategies. This meeting took place, as you can see on this slide. This was a midwifery school when it comes to social responsibility, and we have implemented the actual protocol when it comes to the indigenous sustainable midwifery, which includes being respectful, to give them the placenta as something sacred, not as we think that it's a pathological type of waste. For them, it's very important to do the rituals based on their beliefs, and also, on the other hand, to allow their in Pitalito. For them, it's very important. The black chicken broth or soup with John. We were talking about cultures have different indigenous communities. They have different thinking, different mindsets. So for us, this has been a learning process. Within this midwifery school, it's important to highlight there is the assistance aspect. We have a chief or leader of the program, and additionally with a doctor who is part of the delivery room, who actually gets involved and participates when we visit communities. Here, there's a little bit of, within the timeline, the strategy that we have at our institution in 2019, precisely at our entity. We have laid out an infrastructure plan. So we created a hospital orchard. The orchard at that time didn't have the plants or species that the indigenous population needed. So we selected and looked for the actual site. It was authorized by our upper management team, and in 2019 we started with 5 rows inside the orchard. Thanks to, we also requested help and assistance from SENA, an public academic institution. So we made the request for them to teach us how to plant, how to deal with agricultural issues, because we may know a little bit when it comes to environmental aspects, but we have trained doctors, nurses, and administrative staff members. So everybody, all our colleagues have participated. And I want to take this opportunity to send them a greeting. I know some of our colleagues are connected online, and our collaborators are actually watching and listening to this presentation. When we started the school, the midwifery school, after having meetings with our health coordinator, and how we were going to organize and set up the midwifery school. So with this cultural exchanges and knowledge exchanges, we started to promote prevention and healthcare related subjects. So it was a beautiful experience, and we were amazed how the perinatal or neonatal controls, and to know that there are illnesses that need to have prevention, syphilis, VIH, and others. So this has been very important, and we have discussed several subject matters. And on the other hand, I want to tell you the follow-up during the delivery and birth. During the pandemic, we had some restrictions, but thank God we were able to resume and continue, and for them to use their midwives close by when they were needed. Also, I want to tell you that despite that, since 2019 we have had this hospital orchard, but what about indicators? Do we have them? We've been talking about the importance of indicators. So one indicator that we thought at that time was important is how to know how the orchard itself helps us with savings, economy-wise. and to acknowledge the type of work that we do with our colleagues and indigenous communities. So also to know that in this orchard, not only are we planting plants, but we're also planting food. So our orchard has an 8-hectare dimension, and we've been very careful about our green zones. And if it's necessary, we also want to leverage forest type of availability. So we always try to make sure that those trees contribute to the food safety aspect. As you can see here, fruits and different components. Back in 2021, we saved about 1,926,000 plus pesos. And in 2022, even though we planted less, what happened was that that year was a high precipitation year. Those of us who live in Colombia and we experienced this situation, in Pitalito, it rained a lot last year, and there were times when we actually lost the harvest because of rainfall. So then we started precisely to expand the rows so that we could plant medicinal plants. So as you can see, there has been an increase in food prices and food costs. So all of this is helpful because it represents or means some savings. Here on this image, you can see one of our colleagues, a medical coordinator at the institution, with another quality control colleague who look very happy with the carrot harvest. So this has been very important, the fact that our colleagues actually get involved, because the ecological culture has been more natural with this direct contact with Mother Nature. Also, we have learned, based on our on the experiences that indigenous townships have had, there exist in this territory 350 species of medicinal plants. And within this group of 350 species at our entity, we have planted 33 of them. Those are the most meaningful, significant for them. And we will go over this list and listen to what they are going to share. We have definitely learned, for us in the pharma is the choice. For them, it's plants and medicinal plants. So this has been a learning process, learning that there are plant species for everything. And precisely, one of the main learning lessons within this subject matter has been the drafting and creation of a plant guide. Once we finish it, the goal is to have 350 plants. We only have documented 33 of them. With their help and assistance and their knowledge, we have also learned that there are plants that have adverse or secondary side effects that cannot be mixed with other plants, or not all of them are useful for delivery. Some of them are for breastfeeding. So this is a learning process and roadway. On the other hand, we have been learning that each plant has a specific function or role, and that in fact it can contribute to the reduction of some medications that induce birth or delivery, and to even minimize the pain. So these plants contain these benefits. So this guide will help us to get this knowledge, and from the gynecology department, we will be able to learn, acquire, and use this information in our plant guide. And in such way, to do a control of medications, a reconciliation, if you will, but in this case with plants, because this is something new for us. Within the next steps to make, one of them, to do follow-up to the waste behavior or harmful waste from drugs, because it has not when it comes to the residuals and the waste treatment process, where all the maternal related issues and birth delivery type of issues come about. So to do follow up to those drug waste processes and indigenous mothers who come into our entity. Not only do we wait for them to come into our institution, for those indigenous territories to have a safe delivery, and if there are any complications, no one is going to judge, but rather they will be able to have access to our health services without any inconvenience and full understanding of their ancestral knowledge. On the other hand, the idea is so that when we have this plant guide with all its information and adverse effects, we can promote it, socialize it to all the collaborators involved when it comes to the maternal service and healthcare to indigenous communities. And why not? For us to be able to share with those of you members of the global network. So not all indigenous communities are directly dealing or addressing these, but we can share some of this. Next, we want to share a brief video that our colleagues put together.
Cómo poder llegar a articular los dos sistemas de salud, tanto el sistema de salud indígena como el sistema de salud de la parte occidental. Hoy avanzamos con la adecuación de nuestra chagra, el sembrado de plantas para los diferentes procesos que se haya que hacer con el tema de partos y diferentes enfermedades, donde se busca la articulación de un médico tradicional y también la partera para los diferentes procedimientos en partería. Agradecerle al equipo médico, a los mayoras de los territorios que hoy nos acompañan con esta actividad, y creo que iniciamos por un buen propósito y el objetivo es llegar a hacer un buen trabajo articuladamente con el Hospital Departamental de Pitalito.
Sirva para nosotros todos los pacientes para ya ir saliéndonos de tanto químico. Por eso los medicamentos que traen ahora es mucho químico, que en vez de mejorarnos más nos enferma, y qué mejor que las plantas. Entonces lo que estamos haciendo como un trueque, lo que decimos las comunidades indígenas, ellos nos dan conocimiento, los profesionales del hospital, de lo que saben, y nosotros también les damos conocimiento de nuestras plantas medicinales.
Fortaleciendo la medicina propia, que día a día pues hemos querido avanzar y hemos querido caminar. Todas las enseñanzas que han dejado nuestros abuelos, pues venimos haciendo la práctica. No es únicamente la práctica, sino sembrando nuestras medicinas y seguir fortaleciendo a todos los enfermos que se encuentran en diferentes hospitales. Y a nivel nacional queremos acompañar y darles esa fuerza de nuestros conocimientos. Las plantas que se están sembrando aquí en los hospitales no es únicamente para los indígenas, es para la gente afro, no sea afro, es para a nivel nacional, para que también tengan su mejoría de salud, no únicamente lo occidental, sino que también puedan usar y utilizar también dentro de los hospitales por el bien de la salud de cada uno de ellos y de cada uno de nosotros.
Well, so that gives you a little view and look our strategy. Thank you for your attention. Also, I want to share with you that we brought a little treat from Huila, a achira sweet. It's a traditional type of food, and I was telling Claudia that I apologize for the plastic, but since achira does not have any preservatives or any colorings, you can reuse it. So we hope that you will enjoy it, and we hope that to have contributed with this experience. There's so much to learn from all of you. from the year 2019, we've been a member of the global network. And as I have said, it has been a continuous, ongoing learning process. Thank you very much.
Muchísimas gracias.
Thank you very much, Diana and Aura. We realize why you are so well liked and appreciated in your team. And of course, your team is actually watching you and listening to you. I think they sent you several messages online, very beautiful messages. They are thanking you, congratulations, super manager, super director, the best human team, they said. Great progress for our community, indigenous Colombian. Thank you for the state hospital. Much to highlight, but out of those two cases, for both Pitalito and this, there's also a human component. They have actually played a very important role. So I think it's very worth mentioning. And for those of you who are watching online, do take notes as to what you're able to do in your communities when it comes to, and we can learn so much about traditional knowledge. Now we would like to open up space for questions from our audience, either through the chat room. Obviously, there might be people who want to know more about these experiences. Any of you wants to raise his or her hand to ask a question? We will get you a microphone. Okay, so we will try to be specific about questions. And who is the question for? To address the Pitalito Hospital? Above all, to greet you, to say hello, and to acknowledge what you are doing. It's actually putting into practice 1281, attention care with a difference, patient care. If it's something I que se when it comes to, we would like to know how it was modified, the gynecological attention protocol, how to be able to have specific dietary feeding, how it has been established when it comes to the administrative, not only contractual wise, but also how the dynamics go about billing when it comes to the render service. And lastly, I think it's a very important experience for this global network to articulate ancestral communities, handle and manage different eco-visions, but it's very important to get close or closer to them. So perhaps there is a dynamic where you can unify criteria. And from the San Rafael Hospital, we will be very attentive and open as to how we can work together or jointly. Thank you. Yes, doctor, your question is very interesting. This has been a step-by-step process. It hasn't been an easy process. I am a doctor and a surgeon by profession, and we doctors, it's quite difficult for us to enter into that cultural aspect. But little by little, through the accreditation process that we have had in our hospital, there is a cultural transformation which has made possible for us to change our life philosophy or attitude toward the work that we conduct and carry out as medical personnel and professionals. And little by little, obstetricians, gynecologists, nurses, and all the medical personnel have been understanding or have understood that we have a population not so large as Caucas from the La Estancia hospital presentation, We should be at the service of our patients. We cannot push aside the mystical, religious, cultural aspects. It has been a challenging process. Little by little, we have achieved some results. When it comes to our healthcare system, it's very difficult in Colombia when it comes to the payment of these activities. We don't do it through a billing, invoicing. These are activities that the Colombian health system does not pay us for, but we do it because it's a social responsibility duty, not only towards people but towards the planet. There is no money exchange, but there is a lot of life. Thank you.
Muchísimas gracias, doctor.
Thank you very much, Doctor. Thank you. I love that last phrase. I think someone raised their hand back here. The microphone? Yes? We will get you the microphone. One moment.
Para acá.
We'll start over there and then we will go to the side. Let's see how many questions we have time for. We need to be very specific. Good afternoon. My question is for the John Freddy, engineer John Freddy, to congratulate you for that incredible work. All the presentations, today's presentations, congratulations. My question is about the physical environment and how they integrate or incorporated. In Colombia, we have a unique activation system, like the minimum requirements for the provision of health services. When we are visited and we are audited, they're very demanding. So to incorporate this, for you to have done it, that it's real, I got to know other processes in theory, in academia, but I had not seen it implemented as such. So I'd like to know how that implementation was when it comes to the components of infrastructure and the rest. Thank you. Well, thank you for the question. Precisely from our model stance and the acknowledgement of our cultural diversity in our communities and territories, along with the commercial model and quality model, we had a very special, specific approach to the national secretary so that we could be in compliance with those norms and regulations. So the idea is that with the guidelines and regulations, as we were implementing, that it would not affect the quality of the service for our communities. So in that regard, what we were aiming or seeking a harmony from the intercultural model stands with the rehabilitation or habilitation process. Thank you, John. Congratulations to both presenters and conference speech makers. I have one question for Dr. Munoz and for the engineer Aura. You have highlighted, and with applause, your commitment, your leadership. And much of what we have been trying to do here is very difficult to convince those who are in a leadership position at hospitals. From your position, is there a recommendation that you can give or share as to how to approach those people in upper management? But from your position, what suggestion could you give or make? And for Aura, how can you explain the commitment made by personnel, by staff members, and the passion that you convey? But we also see on the messages received in the chat group to be able to accomplish the type of work you're doing. Very interesting question. Actually, we do think that the best teaching is doing by example. We are leaders at a hospital, and we manage, which becomes a reference site for the entire southwestern, even though our healthcare system in Colombia is very complex. Systems, we think, should be based on the importance of people, not money. I would tell all people who have upper management or management post, the umbilical cord should be people, the human being. As long as we work toward and strive for the human being, money will come later, and God is always willing to help. God is always present. Well, first of all, as I was telling you, one of the very, very important things is the upper management commitment. When not only those of us in the environmental field, but also to get you involved in activities that have to do with social or environmental impact. So, definitely, and I am here confirming it, and you have confirmed it, if there's a commitment coming from upper management, from the top all the way bottom, all our colleagues, because it's not just one single guideline or regulation, it is an example, it's part of the activities, so it will definitely be easier. Two, something that has been very important is to articulate environmental management when it comes or to achieve accreditation. Within our accreditation process, we have participation. So the simple fact that
En liderazgos,
all our co-workers to do leadership or to be leaders, and the doctors, the nurses, and nursing coordinators are concerned because or for the environmental management process are very concerned. So it's not only their concern, but also it has been articulated towards the goal of getting accredited. So it's not only the environmental goals, but in terms of quality. And as a result, we create a culture that is very favorable, and sometimes they also generate. And thirdly, the commitment, as you have seen on in the chat comments, and I send them a greeting to all of them. Big hello, very passionate. Thank God we have a a great team in the Pitalito Hospital. So this has made it possible. Obviously, we have had some resistance to change, but with love and dedication, and by listening to different points of view, different stakeholders, and with active participation, not everybody can participate, but we find those common ground points where we can all collaborate. Thank you.
gracias Diana, gracias Aura. Tenemos dos preguntas más, pero
Two more questions. Let's start here. I think you have the microphone. My name is Marvi Torres. I am a specialist, internal medicine specialist. I work here in Méderi. I am finishing up my public health master's degree. I am very, very pleased to be here to have witnessed and listened to these proposals and presentations and what I have learned and to see in public health. I congratulate you from the bottom of my heart. When one is a specialist, internal medicine, it's very difficult to open up, to change the mindset when it comes to intercultural aspects. I was saying that, but in our own academic settings, we still do not have the sufficient, when it comes, sufficient knowledge and the forums for intercultural and to create academic spaces. So when we receive these concepts and learn about this, so congratulations. I am living happily that in Pitalite, the system and the lowers, and this is wonderful. Thank you very much. Small question. Traditional doctors that I saw in the video, do they have access to the clinical chart? Secondly, is there a board of a medical board or committee that can share this experience? Is the question for both or just for Pitalito? I invite John and I invite the lady doctor. 1 minute for each of you to give you answer. No, we do not yet do that. We do not have a medical meeting or committee meeting. They do not have access to our clinical chart. Not yet.
Doc, no, realmente.
The safety of patients' information is very important. So in this case, we don't have access to data. An exclusive committee does not exist, but perhaps there's interaction, or when a patient wants to have or wants to give access, but that articulation could and that exchange could. But in this case, with the consent of the user.
Gracias, John. Ese es el concepto, intercambio de saberes al mismo nivel.
That would be the concept, John. Thank you. Good afternoon, everybody. Welcome. I am Director of Human Talent at the Global Méderi Global Hospital Network. And it's a pleasure to participate and to listen, to learn from all of you. There are many things that I have overheard yesterday and in today's presentations, and wonderful what I have witnessed and listened to. But I think I got an answer from a previous question. It's an honor to have you. I am a native of Pitalito. That's why I kept the jar. No, it was gifted to me. And it has to do with the transformation, cultural transformation process, one of the axles that you spoke about, and that is one of the components of the most complex situations. So it has been addressed. Thank you for your experiences. Welcome.
Muchísimas gracias. De verdad que este es otro tema que da para mucho tiempo más de conversación. Muchas gracias por este.
Thank you very much for this very enthusiastic participation. And now I will yield work for Joana Agudelo. She is going to collaborate with an active pause for 5 minutes.
Veo que están muy entretenidos, ¿no?
Bueno, well, we will see how much we take care of these bodies in the way that allowed us to take care of our human body. How much do we take care of it? Do we take care of it much or less? In the afternoon, we had already said hello to the person who wants to speak in WhatsApp. Okay, so we're going to do a little WhatsApp exercise. Remember when you were a child and you used to play with your mother, when your mother used to leave and you used to play by yourself? What do you used to do? So let's do what we used to do when we didn't like it. Let's think what we used to do. Move our shoulders towards the back, remembering of the thing that we didn't like. Now let's do it 5 times forward. Can we remember our childhood? Some seem to have forgot it. Some of you have a tendency to take care of the environment while you are sitting. Let's stretch our arms. Let's try to do it as much as we can. And we move our hands 5 times. And the condition is that we cannot lower our arms. How many have you done? How are you doing? Good? Now we're going to twist our arm and start to squeeze and open. Okay, let's count them because maybe I will forget it and I stay with the same number. This is a fast counting. How many have we done? Oh, we are already in 15. Oh, remember that we couldn't lower our arm. Now again, with our hand extended, do it 5 times. Now let's move all of our fingers, even the thumb. I see some faces of suffering. Why do you have faces of suffering? Now let's move our arm forward, facing up, and move our fingers. Let's continue doing that. Let's twist our arm again with the palm down, and let's move the palm up and down, while we have our arm stretched. How many times have you done it? Now we lower our arms. But for Christ's sake, if somebody felt it's completely normal. If you felt a tingling, why do you feel tingling? I mean, because you cannot confuse it with pain. Or if you felt it as a pain, it's because you may not know. You may have not gone for a while to a medical examination. Really, I really recommend you to do this many times during the week. Okay, thank you very much. You're so kind.
Muchísimas gracias, Joana. Espero que todas las personas que están en línea también lo hayan hecho en sus casas. Esperamos que sí. Y bueno, ahora sí les vamos a invitar a pasar a tomar un refrigerio. Recordemos que en el salón 905 están colgadas en las paredes las cartulinas del taller que hicimos ayer. Si alguien no las ha visto, por favor pasen a verlas ahora. Y
for those, okay, we will see you too. Back. We will be back at 3:95. Okay, and I see you soon. Thanks.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare, of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I'm deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, and we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we're gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente 51.000 metros cuadrados. Así, el Hospital Universitario Mayor, con 40.000 metros cuadrados, y el Hospital Universitario Barrios Unidos, con 11.000 metros cuadrados. Ha sido reconocida por ser una de las mejores edificaciones hospitalarias en Latinoamérica, por reordenar, remodelar y ampliar sus espacios para el bienestar y confort de los usuarios. En ambas sedes se ha realizado el 100% del reforzamiento estructural y se ha incorporado un sistema de paneles solares para el calentamiento de agua. Por eso, el cambio no se detiene. El ambiente de confort y de arquitectura humanizada ha pasado por el Centro Integral de Servicios, planes especiales, urgencias, oficinas administrativas, imágenes diagnósticas, oncología, hall principal, pisos de hospitalización, laboratorio clínico y gestión pretransfusional, hemodinamia y ginecobstetricia. Hoy, todas las habitaciones cuentan con su baño, incluyendo ducha y teleducha, dotados de mobiliario especial que ofrece a los pacientes un espacio digno y tranquilo. Un buen resumen de los últimos 4 años sería 233 nuevas camas, 7.000 metros cuadrados de remodelación, 100% de reforzamiento del edificio e incorporación de nuevos equipos como resonador, angiografía y rayos X en imágenes diagnósticas. Hoy, Méderi es un veterano vital, al que no se le nota el paso de los años, porque detrás del cemento y el ladrillo hay un ser complejo que se proyecta hacia el futuro. Méderi, red hospitalaria.
Estamos acá en el segundo taller regional de compras sostenibles para el sector salud. Estamos en Medellín. En San Vicente Fundación, en su sede de Río Negro, que es el primer hospital latino por fuera de Estados Unidos, es el único edificio con estos estándares, digamos, de construcción y de operación en América Latina. Estamos muy contentos con la representación de los países y la participación súper activa de nuestros miembros, trabajando hoy en eficiencia energética, ayer con foco en químicos, pero también estamos trabajando otros enfoques, como por ejemplo de cómo incorporar perspectiva de género en las compras sostenibles, que ha tenido un muy buen resultado con nuestros miembros.
Para nosotros en Salud Sin Daño es muy importante poder generar estos espacios en donde las y los profesionales de salud que trabajan en las instituciones que forman parte de la red global se conocen, intercambian el trabajo y la experiencia del día a día, aprenden no solamente de las capacitaciones que brindamos, sino también del trabajo y de los resultados que están logrando en sus propias instituciones. Así que siempre es una prioridad para nosotros poder generar estos encuentros presenciales en donde aparece esta riqueza en el aprendizaje a través de las experiencias comunes.
Hoy las charlas de género, de energía, mostraron resultados que podemos llevar a nuestras comunidades y beneficiar así a las personas que trabajan en los hospitales y a las personas que estamos atendiendo en las comunidades.
Fue muy satisfactorio realmente esta cuestión de empezar como a darse cuenta las personas de este vínculo tan necesario, tan oportuno y de alguna manera esta herramienta tan efectiva que es la herramienta de compras públicas del Estado para trabajar en términos de equidad de género.
Este año se trataron temas importantes como sustancias químicas, energía y género. Esto es importante porque como establecimientos de salud tenemos que ser partícipes y pioneros.
Cuando uno viene acá se da cuenta que puede estar muy avanzado en algún tema, marcándolo en compra, ¿cierto? Puede estar más avanzado en algún criterio o forma de comprar en forma sostenible y más atrasado en otro. En particular nosotros tenemos bastante avances, por ejemplo, en residuos, en riles y en eficiencia energética, pero estamos un poquito más atrás que fijándonos ahora con la experiencia y lo que hemos visto en el taller en sustancias químicas. Entonces yo creo que ha sido lo más valioso, poder llevarnos criterios, ¿cierto?, abiertos, una planilla de trabajo, una nueva herramienta para poder en el fondo hacer un catastro de estas sustancias químicas y en el fondo poder buscar criterios de compras sostenibles que sean estándares a todos los establecimientos. Y eso es lo bueno de esta red, que en el fondo compartimos lo que ya está haciendo otro y no inventando algo nuevo.
It has been such a privilege and an honor to join together with Salud Sin Daño here in Medellin, in Colombia, for this workshop on sustainable procurement in health products and services. This has been an inspiring community with so many great examples implementing sustainability in energy, in less toxic chemicals, in management of resources, in energy efficiency, in water management. And these stories that I have heard and these examples can be shared all over the world and help other hospitals, health systems, and UN agencies to improve practices for the procurement of products and services.
I've been really impressed at the level of organization at Healthcare Without Harm South America. This is a really inspiring group of people. We've heard stories of change around anesthetic gases and different kinds of disinfectants. And you could tell how excited everybody is to be making these changes in their home institutions. You could tell that each change gives them the energy to go back and make the next change. And it's been really lovely to see the sense of solidarity between everybody and to meet in particular so many strong female leaders from South America. So I thank you for what I've learned. You've inspired me. I will take that home to Canada and we'll do what we can to also reduce our emissions from healthcare.
Nosotros en el Hospital de Niños ya hemos realizado algunas compras sostenibles con criterios de sustentabilidad y también estamos trabajando en poder capacitar mejor a los médicos y a los compradores para que a la hora que vayan a comprar no solamente ponderen aspectos económicos, sino también puedan interpretar y ver, digamos, el tema que en este momento está prevaleciendo, que es el tema del cuidado del planeta.
Creo que nos vamos con muchísimo aprendizaje, muchas experiencias. Vemos que el nivel en gestión ambiental hospitalaria va en alza, tiene un crecimiento exponencial Y no, nada, agradecerle a Salud Sin Daño y a todos los miembros de la Red Global por este espacio tan importante.
Estamos felices por el resultado de este encuentro. Los miembros están compartiendo generosamente sus aprendizajes, sus éxitos y también las cosas en las que todavía sienten que tienen que mejorar y en donde la red cumple ese rol fundamental de trabajo colaborativo en el que entre todos juntos van logrando soluciones a problemas que cada uno tiene cotidianamente en su hospital o en su sistema, y que en este tipo de encuentros en la red se generan soluciones colectivas, así que estamos muy contentos de que eso esté sucediendo y que estemos todos aprendiendo a implementar compras sostenibles de manera efectiva y contribuir a que el sector salud pueda reducir su impacto ambiental y también su carga sobre el cambio climático.
Regular cleaning and good hygiene is crucial in preventing infections and maintaining a healthy home. But the use of disinfectant products can be harmful, with medium and long-term health effects. By teaching patients about the risks of disinfectant products, we can support both good hygiene and safety. Disinfectants contain chemical agents that carry significant health risks. They can irritate the skin, eyes, and lungs. They can also cause breathing difficulties and respiratory illnesses, such as asthma. Many disinfectants also pollute the air, water, and soil, with long-lasting effects on aquatic systems, and they can even do more harm than good by destroying beneficial microorganisms and increasing the resistance of superbugs. Disinfectants have a role to play in healthcare, but how do we support hygiene and safety at home? Importantly, there is no need for healthy people to disinfect in private households. Disinfectants should only be used at home in justified cases, such as living with an infected person under quarantine. Cleaning instead of disinfecting is enough to maintain a clean and healthy home and does not present the risks posed by disinfectants. But what is the difference between a disinfectant and a cleaning product? Disinfectants contain biocidal agents to inactivate or destroy microorganisms. Cleaning products remove dirt, molds, and allergens and adequately protect against infections. It's not always easy to identify them, but most household disinfectants contain ammonia, chlorine, or alcohol. Eco-labeled cleaning products do not include disinfectants and also have a reduced environmental impact. Talk to your patients and let them know that disinfectant products are often unnecessary at home and could be doing more harm than good. Frequent and correct hand washing with soap and water and regular cleaning of surfaces provides sufficient protection against common infections, as well as COVID-19. When disinfecting is necessary, a few simple rules can help reduce health risks. Avoid chlorine and ammonium-based disinfectants, and consider alcohol or hydrogen peroxide products instead. Wash your hands before and after cleaning, and clean the surface first using detergent and water. Disinfect in a well-ventilated area, away from children, pets, or vulnerable members of your household. Carefully follow product instructions, dilute properly, and apply the product for the recommended duration. Do not mix or combine products, and reduce the risk of breathing in harmful substances by avoiding spray products. At a time when hygiene is high on the public agenda, healthcare professionals are uniquely placed to provide clear, reliable information to promote safe and effective hygiene and reduce health risks.
Que ya el liderazgo comunitario no quiere decir ser jefe o no quiere decir ser la persona más visible, quiere decir quién arrastra con el ejemplo, quiere decir quién inicia ese proceso, quién se vuelve un nodo de comunicación, quién se vuelve un gestor de la comunidad.
Industria, comercio, academia, hospital, ¿qué tienen en común? Ahí es el tema ambiental y es el resonar en la misma frecuencia, en el mismo objetivo, en el mismo fin de unirnos y generar un liderazgo comunitario al respecto.
Es muy importante que como personal de salud asuma siempre el liderazgo para luchar contra el cambio climático, buscando herramientas para crear conciencia entre mis colegas sobre el buen uso de la energía, sobre la reducción de las emisiones de gases, teniendo una buena gestión de los residuos. Ser líder significa ser consciente y actuar de manera oportuna contra el cambio climático. El clima está cambiando, nosotros también deberíamos. Somos la herramienta más eficiente para lograr el cambio.
Quienes trabajan en el sector salud han alzado la voz en diversas regiones para promover una transformación de la narrativa y para posicionar al cambio climático como un problema de salud pública.
A nivel de las audiencias, cuando empezamos a hablar de afectaciones a la salud, todos nos ponemos muy atentos a la información.
Como líderes de opinión, los profesionales de la salud tienen lo que se llama un capital neto de influencia entre los más altos a nivel de científicos.
Participé en el programa de formación en liderazgo de la salud por el clima de salud sin daño. Me quedé llena de aprendizajes, de desafíos, pero sobre todo muy inspirada por personas que muchas veces desde abajo lograron solo con su voz movilizarse, asociarse con otros y ejercer una influencia real y directa en la acción climática. Seguir levantando los brazos, levantando mi voz y ocupar el rol que tenemos para la lucha por el cambio climático, que sin duda es una problemática de salud pública y por ende tenemos mucho que hacer aún.
Cuando hablamos de las soluciones del cambio climático, no es solamente pensar en cuántas gigatoneladas hay que reducir, sino cómo y quiénes están beneficiando tanto con las acciones como cuáles son los impactos también de esas soluciones.
I think health professionals play a very important role. They are trusted communicators, they are credible sources of information, and they have a moral and ethical responsibility to care for people's health and well-being and advise for strategies that improves health.
El cambio climático es un problema de salud pública. Sus consecuencias están a la vista. Como médico y como joven, siento la enorme responsabilidad de hacerme cargo, de alzar la voz, de crear vínculos y relaciones estratégicas con mis pares, de abordar este problema global de forma interdisciplinaria. Porque no hay más tiempo, porque la respuesta tiene que ser ahora.
It is critically important for the health sector to lead by example, to increase our credibility, to say we need to have policies of non-proliferation of fossil fuels because of climate change and health.
Make sure that you use your influence as a health professional to lead by example, reduce our carbon footprint.
Tienen un sitio de respeto y de escucha en sus comunidades. Hay que usarlo.
When we started Healthcare Without Harm 20 years ago, we were a small group of outsiders to healthcare, bringing forward the issues of environmental pollution that the healthcare industry was responsible for. And we were able to show at scale how to transform healthcare to be more environmentally responsible. We were able to move mercury, which was the gold standard in healthcare, and eliminate its use around the world. We were able to show how to immunize millions of kids in the Philippines without using incineration. We've been able to build a movement inside of healthcare of health professionals who care about a larger healing mission that they have. It's not enough for us to be healing individual patients. We need to be healing communities and the planet that sustains all of us. And as we look forward to the next 20 years of our work, I am deeply hopeful that all the people that we have engaged and catalyzed and inspired in the healthcare sector will now take a broad sustainability agenda and spread it throughout the world. We've built a network in more than 50 countries now, And we want to extend that to every place on the planet so that the way that we rethink healthcare in the 21st century is about supporting healthy people in healthy communities on a healthy planet. So wherever you find yourself in the healthcare sector, architects, food service directors, purchasing people, environmental managers, nurses, doctors, CEOs, community health workers, there's a door for you to enter to bring about sustainable healthcare, and there are many, many allies that we're gathering around the world to help you and to be peers with you. And so we look forward to collaborating with you over the next 20 years in transforming healthcare in ways that will make them an anchor for resilient communities all over the world.
Detrás de esta inmensa mole de cemento y de ladrillo, hay mucha historia que contar. Décadas de años se dicen rápido, pero se construyen lento. Hoy, la historia de Méderi, red hospitalaria, se encuentra en constante evolución. De permanente mirada hacia el futuro, de indisoluble compromiso con el mejoramiento continuo para ofrecer el mejor servicio a todos nuestros pacientes. Desde mayo de 2008, cuando cambió a ser Méderi, empezó una nueva leyenda. Por fuera se han hecho algunos retoques, aunque en esencia sigue siendo la misma. Pero los verdaderos cambios se han hecho por dentro en hospitalización, tecnología e ingresos con arquitectura humanizada, promoviendo el trato digno a nuestros pacientes. Y es que poco queda de lo de ayer. Hoy, sus espacios son amplios, llenos de luz, dotados con la mejor tecnología, con sobresalientes prácticas médicas, más y mejores servicios, rampas de acceso, señalética moderna y clara, amigable con el medio ambiente y el cambio climático, y lo suficientemente flexible para adaptarnos a las circunstancias del momento. Méderi es un ente vivo que se deja querer, que se deja arreglar, que se deja mejorar, porque en él se resume bien la esencia de lo que es: hospitalidad y ciencia. Méderi, red hospitalaria, en sus 2 sedes suma un área de aproximadamente
perhaps it has not existed the opportunity to invest, knowing that on a long and a mid-term, on long-term basis. So also regulation. When it comes to regulations, the need to establish regulations that are clearly defined that can promote sustainability. The waste management treatment, the reduction of emissions, chemical products, pharmaceuticals, and other. I think there is a lot of work to do and to accomplish. We've been doing it for many years in so many countries, speaking about environmental management. But there is so much more ahead and more road to travel on when it comes to public policies based on economic needs, social, cultural, political needs that may have an impact. In our case, we know the benefits, but sometimes we need a little more of political will. Thank you, Adriana. Thank you from the financial point of view. Sometimes there is a shortage of or missing prioritization. Do you concur? Julio, thank you. I think that when it comes to challenges, there are many. The global context. We were looking at the risk management. If there are 10 risks, 5 of them are environmental. So this is complex. We cannot deny it. But in the midst of this complexity, there is a lot of opportunity. I think the game of roles and how government entities and local national entities has not been, that is, the government has always had the role of defining the policies, and we, public and private entities, that are the ones who have to comply. I think this is a great opportunity in the public as well as the private sector can contribute knowledge, experiences like we're doing today. We have public and private hospitals who have a lot of experience when it comes to the drafting and creation of policies. And perhaps in the past, they have not been taken into account. And I think that's an opportunity. The economic aspect, governments that provide support, financial aid always helps promote. But I think we should turn things around. If there are institutions who are doing things right, why not give them an incentive? Why not support them? And the learning process with the community, as we're doing today, I think hospitals who are present here, I think very different. Some of them are very specialized. Some are small, they're getting started. And we have seen this along the way, or I can say it based on my membership to the global network. And I have been able to develop, to participate and experience these type of meetings and encounters. So I think the playing of roles of learning, of participation from the public sector point of view, we can leverage and take advantage. Let's talk a little bit about this interaction between regulator and regulated, and the sharing of experiences and the ability to express needs and to be able to explain challenges that there exist to be able to implement policies. And I think all of you were able to take the microphone. I'd like to ask you, who of you who would like to take on the Darío's intervention as to the complexity? Diego? If you agree, I'd like to continue with what Darío said. Something very important, the experience that some hospitals have, how it can be reflected upon, I call it like a training of trainers. We have specific concrete cases like Santa Fe Hospital concrete specific cases like John Uribe, Valle de Lili, who, or they, we all know it, more resources perhaps, but they become, at the end of the day, a model for others or for the rest, for other hospitals to follow. Why not support, as far as the transfer of knowledge, why not support those that are emerging and leading? And of course, from the public stance, following up on what you are saying, the regulating entity and the regulated ones, I think this has to be a joint type of work or collaboration. Probably that's what we're missing, and perhaps a mea culpa from the government's role. Perhaps we need to sit down and spend more time together, and this is one of the proposals that come about with climate change, to sit down with you. I am not an expert on environmental management. I know about climate change, but I'm not an expert on environmental management. So this makes it even more indispensable for you to be part of it. And I'm sure that in Chile and Argentina, it happens, or something similar happens like this. So we need to jointly work. So to open up this dialogue spaces, those of you who know that key, Adriana, you were saying about the regulation aspect, because it's important. The policies need to exist and mandates, they need to exist. Thank you very much. I do believe that regulation, and it has to come from the government. There should be an active participation from local levels where they can actually contribute with their knowledge, their experience, and their specific situations. But the policy that will actually has to be clear, has to be very specific. It also has to have within a scope, which year are we going to start? Will this be our baseline? Who are the responsible parties to implement this policy and to take it to the practice level with different actors? So it's a comprehensive design we have to draft and put together with the different entities, with the different parties. Since we are subject, in this case, to the Ministry of Health in Costa Rica, it is the Ministry of Health that issues and decrees that type of policy. So it has to be a very effective policy that will be efficient enough, that will include the environmental subject matter, which is very large and ample. We have to include economic, environmental, and social factors so that we can make it very comprehensive. Thank you, Adriana. To go to the other side of the coin, in Chile, Juan Pablo, you were the first public health system to do the calculation or estimation of the carbon footprint with the tool provided and created by Health Without Harm. So tell us a little bit about how you were able to achieve and what are the challenges that you are now facing when it comes to the complexity of the health sector. I coincide with all the panel members that resources are definitely much needed. In Chile, we are a very regulated country. Thanks to the support from Health Without Harm, we were able to calculate, I think in 2018 and in 2021, thanks to the form, the footprint form or format, we started to reach some benchmarking, and we realized we have a very big and significant climate problem. So what's our reality existentially? We need to measure our carbon footprint and be able to determine our energy matrix and find out about those gaps so that we can address them. I insist the economical financial aspect has always been a problem. In healthcare, the resources typically go all the way to the users and to the attention and healthcare of those users. So when it comes to quality, we need to start opening up the gap to communicate our results to different ministries, to create working tables and to allocate funds that would allow us to get to a carbon neutrality level. That's mainly what I would say. Thank you, Juan Pablo. Dario, would you like to respond to any of these points or observations? I do share what my colleagues have mentioned. The economic angle or aspect will always be present, very important. But I also think that when we build and put together this change and what the Minister of Health said, the calculation estimation of the carbon footprint with the support by Health Without Harm, it breaks down or breaks through that scheme and that paradigm. We can learn much from everybody, and between all of us we can learn so much and optimize, define, and be in alignment, which allow us to be more objective, get greater results with much more value. I think that this is opportunity, and this type of exercise that we are now part of is very valuable. And it could be a starting point so that we can get feedback. And I insist, and I apologize for insisting on public policies. One thing could be the way that things look like from Bogota. And also another thing is, I think it happens in the rest of the country. So the building and construction of this analysis can be actually much better. The economic aspect, I think we will see how things go. But the starting point is to get started. Juan Pablo, how do we get it done to get better knowledge about what happens on the field and to design public policies? Who wants to take on that? Diego, I am fully in agreement, completely agreeable. It's a necessity. The one example we must get to know. I apologize that I will mention, I don't have in my head all the names of the hospitals, but for example, we know that what Culp Subsidios does and has many hospital centers, or what Santa Fe does, what Méderi does, but we also need to get to know and what San Antonio of Pitalito does, right? Because it's a different focus, but it's the reality of the country. And the reality of the country has to do with a focal differential, with ethnic groups, with other and many realities that from the city's point of view we do not take into account. So I don't know, I cannot say that it has to do with this government, but we've been talking about going to the territories. We hope, at least, that in Colombia, this will yield or make a difference when facing what has been happening before. I am sure that for a technician person to draft or put together a policy, let's not be so idealistic about it. But what could actually happen is that little by little, for us to leverage those supplies and exercises like this, the estimation of the carbon footprint through the Ministry of Health could become a reference point or framework so that we could reach out to the territory, whether it's empirical, professional, or from different hospitals that will accomplish that. What about the consultation mechanisms? I know that here in Colombia, recently there was the new regulations for waste management. I know that some of the entities now present are dealing with that. Juan Pablo, can you share with us a little bit about the mechanisms that you have at the Ministry of Health in Chile to get to know the field-based experience and what you have developed? I will give you some history background. Back in 2008 through 2017, we spent much time and did a lot of work when it comes to mercury, and also through the Green and Healthy Hospitals Network. In 2018, this would allow us to put together a tool, a environmental management tool and plan. Chile is a country and we spent and invested a lot of time and energy to create this environmental plan and to deliver this plan to hospitals so that they could start fill out some formats or forms so that they could be part of the network. This allows us at the Ministry of Health to have an X-ray on a nationwide level as to how many harmful waste or pathological type of waste are generated when it comes to water consumption, energy consumption, and mainly to get to know environmental issues or penalties that some of our entities are experiencing. We have provided this to regulating entities, and we have created work tables or business tables so that we can bring about this regulation subject matter and regulations that can be actually applied, and gradually we can start implementing them. Today, we're working from the Ministry of Health to do a sectorial or sector-based type of committees or working tables to deal with climate change effects, and we're working with the Ministry of the Environment, and through this we're trying to provide the estimation of the carbon footprint so that we're able to diagnose and be more detailed and go into institutes and talk to officers. And what you said in the first intervention, the most important in environmental management comes from people. And this is very important because it is there where this comes about, where it stems from. We are estimating and calculating the carbon footprint without a budget. We're working with a Ministry of the Environment area. It's called Viva Chile, and we're trying to calculate the consumption. And a very important area as a Minister of Health, we also create nationwide and regional campaigns. Twice a year, we bring together the network of different environmental reference point actors, and we exchange experiences, and we exchange our doings, our going abouts, and our different knowledge base so that we can feedback and start an environmental discussion and be able to implement in a very equal and leveled way, taking into account their culture, their formats, and to create initiatives and strategies on a national level. Very important, this regional and macro regional type of campaigns. We can then train or go back to training, and this allows us to approach and get closer to regional institutions and entities and to improve on those levels per country. Thank you, Juan Carlos, for that gradual focus, but let's go back to the financial aspect. Allow me to give you a dimension. For those of you in government, and I think Juan Pablo mentioned it, their big challenge is about coordinating inter-ministries. Some of you have to convince the upper management officer so that you can conduct and get your projects done, also to convince this or that. So I'm leaving this information for Diego and Juan Pablo to think about. Let's go back to the field. Darío and Adriana, what is it like when you have a limited budget and sometimes it's zero? Sometimes one has to decide and make, when it comes to decide between a environmental management and some other type for the expansion of access, health service, some social program. How do you do when it comes to submitting or presenting the case that the climate change action needs priority, or the environmental action, not just climate related? I'm not sure if one of you, Adriana. It's very important to highlight, since we have had over the past 12 years, as my colleagues are saying, it has been incredible support for the development of these programs at the National Children Hospital. This is a public hospital. Since we have a limited budget, sometimes when it comes to decision making and from the environmental management point of view, I believe that we're all lovers and passionate about environmental management, and we believe and we run, or we always find justifications and important reasons to be able to carry on and develop projects. And sometimes projects, as my colleague said, do not require much investment. We need people to proceed and do training, and education is a very basic, essential aspect. These programs, during 25 years that we have been dealing and addressing environmental management, we have seen how environmental management has taken up more and more space when it comes to waste management. And this has been an essential part of the green and healthy hospitals. Not only is it about waste management, pharmaceutical products, sustainable purchasing, sustainable structures, buildings. So we need to find the financing, backing, and also deal with public policies, because through a policy that is from the public policy standpoint, then so much is determined to go about these programs. We've been working since 2019 with a public policy project based on the green and healthy hospitals with the help of the Ministry of Health in Costa Rica. And this has helped us to evolve and develop. We're also including the financial aspect of it and the funding of it. And we're also addressing people. In Costa Rica, we have 29 new hospitals. In Costa Rica, its health care system, and we have over 300 medical centers. And this has to do with people who can actually develop and carry on the health-related campaigns. And also we're fully defining the human resource aspect, which is very important to be able to move forward with these programs. So to me, it has been, without being able to find or allocate the resources. Thank you, Adriana. Surely, governments do not have all the resources to finance some actions, but they can actually provide and make information available. Development Bank, the Multinational Development Bank, international programs, so that these entities and institutions do not feel alone and where to get funding from. Darío, to be more specific. It's always a challenge when it comes to resources. A hospital with a healthcare, in Colombia's case, it's very, and they have to be prioritized. let's say that in that chain of events, the environmental aspect takes a back burner position. In our hospital, when it comes to, we did not know, it wasn't so available. We didn't have so many contacts as we do now. The improvement had a different rhythm. With the passage of time, we've been able to build upon. We have had access to tools that allow us to determine in a quantifiable way. And with that type of results, we go to upper management. Look, this is the impact that is being generated. And we're also mindful of the value. This is what cost us not to do environmental action. This is what's cost and this is our benefit. Not so much that is for both upper management, for dividends, and also for us involved in the environmental field so that we can mitigate the impact. When it comes to environmental cost, within the accounting regulation in Colombia, it does not exist, we could say, but we could determine how do I look at this. If we were to develop, if we had access to the environmental cost, the decision-making process would be easier, and perhaps resources on a government level, public or private sector, would be much more dynamic and it would be more helpful. But more or less, this is how we deal with it. Of course, lack of action is more costly. As you may not believe it, we're about to get to the end of this table. I will give 1 minute to Diego so that we can round up, and then we will listen to the closing comments.
Let's start with you, Diego. Just 1 minute. Okay, so in concrete, I agree that there will always be missing some resources. But precisely because of the tool we have been using, is that we are able from the ministry to make, and the documents I have shown, you can see that they're part of cooperation or international cooperation. There's many options, like for example, the different funds that we can find in the different departments and in different regions. Some regions, like for example the PEDET regions, they have specific funds that can be presented for a project. And well, we can also talk about intersectorial system, like for example the support of the Ministry of Environment and other ministries. In that way we can support the same power, the same thing that we're looking for. In this sense, the impact may be very small from health. Just the fact that I'm joining and that I'm becoming part of it, it gives me an advantage to work for the future. Bueno, well, it's very important to work with the ministries and the importance of the ecological management. And this has happened in Chile. It has happened in a national level. And in our ministry, we gave them many charges, to different systems in the country. And we were able to implement this normative. Of course, obviously, you have to address these subjects and recognize that we have fallacies, Well, this happened in 2013. In 2014, we gave more jobs, more charges to different personnel for technicians in environment, so they can take on this subject. It's also important to signal the importance of capacitating the the people that work with us in, so we can take this task forward, and also create tables that are interministerial and work with our establishments and shows the necessities and find the resources that we have as a country. Thank you very much, Juan Pablo. There's so much to say about this subject. So now we can see some points about opportunities and regulations and learning from each other. Well, Juan Pablo was mentioning the importance of having some successes, and this way we can motivate others to become part of it and integrate from the public policy. Now, again, I will give 1 minute for each of you so we can close this table. Okay, let's begin with Adriana. Well, in effect, we need this coordinated effect with coordinated spaces for this subject of every year. And we're having now a conference in which many cultural and ecological management subjects have been working together with different countries. Something that is crucial in this improvement is the management of ecological problems, the technologies of plasma. We have been working with this subject from almost 10 years ago with the Nicaraguan Technological Institute, and seeing how we can innovate in terms of sustainability, a very, very important subject, this one. How to achieve new technologies, how to create new and more improved equipment, and how to fix infections in the hospitals and fix the infections of plasma in the medical area. And also how to use data and information that helps us to develop ways to work with it. Like if we don't know the necessities of the field, like our friend from Chile just said, it will be very difficult as a country to formulate the necessity and the policies so the different actors that participate in the process become effective and create a real promotion of health. The sustainability has to have implicit this. We have to work with the social area, the part economic, in order to achieve all this. Thank you very much, Adriana. There is a company from Costa Rica. Thank you so much for being with us. And again, let's go with Juan Paulo in Chile. Hi, how are you? Do you listen to me? Well, I believe that it's also very important to work with the ministry. In the Health Ministry of Chile, we have a part that we work with inversion and the economic area of the environment. We try to calculate the carbon footprint and thermal and the consume of electric energy, the avoiding, for example, heat pumps, the use of heat pumps. So it's also very important to have a transversal use with the ministry, so we can all use the same language and speak the same language and make forward the possibility to finance all these areas of expertise. Thank you very much. Muchas gracias. Un gusto hablar. Thank you very much for thinking with you. Okay, now we will talk with you, Dario. Well, I think the working with as a team, we can create better policies. Well, if you see the policies of 2018, we can find two public and one private, and we can take into account that we can all participate. And also, if there's already a guide, why don't we put it on the ground, and habilitate it as a form of functional health? Let's try to invest in a norm of habilitation. Sometimes we are very reactive and very little productive, and we have to start getting involved from the normativity. In that way we can change the institution. I love it. The hospital saying that we should be obligated to. Oh, that was recorded, right? Okay, so opening opportunities. Sometimes we are optimistic. Once we start with this question of changing the whole context, we can see more and more opportunities. And I completely agree with Dario. We have to work as a team, not only with the ministries and the same government, but also in a subnational level, with the public and private hospitals, between private and public hospitals, work 1 to 0. Also, this is also that comes from the monastery. We have something that is very clear. We have to the influence that it has from a terms of giving services and giving medicines. And it's not just a plan of environmental health. Even if it's hard to believe, we need that it's hard to explain to others that this is not just us. It's a process that everybody is working, and whether we need all the areas to be working together. And it's an area that is very sensibilized, and we need to make it more sensible in terms of infrastructure. So we are already talking of things that Dario is talking. We cannot make them do it yet, but at least we can make them talk about it, think about it. And this, at the end, is a form of growth. This is something that is contributing. And in this sense, we are applying criteria of sustainability. In that way, even it's not force, it's a recommendation. Thank you very much to you too, to Diego Moreno from Colombia. Thank you to all of you. There's so many more things that we could say. Just one last commentary to close. And I want to speak a little bit about the model of Salud Sin Daño. Like Jacqueline said at the beginning of this conference, from the expertise of people with of Salud Sin Daño, and we throw it to you. We process it, we create it, and we throw it to you. And it's only when you use it in reality and apply it and co-create it, we really never see it actually become a reality. And this is the model of learning that we have in this space. And I want to thank you for you, all of you, being here. Thank you very much.
Well, with this, we now move to the official closing of the fifth Latin American Conference, and I will yield the microphone to Jacqueline, my colleague, and also to Doctor. We will start with Jacqueline. Very well, thank you. Teamwork. I will follow up on what Diego said. I wrote down a few things to our gratitude to our strategic allied partners, to obviously to Méderi Hospital Network for their strategic contribution and collaboration, and to our institutional allies in Colombia, Clínica Méderi, Valle del Lile Foundation, and to Risaralda League Costa Rica, Hospital Clínica Biblia, and Austral Cruz Celestre in Argentina. On the other hand, I think it's important to highlight, to thank the officers, managers, authorities, and all the workers who took the time, health professionals who invested their time and energy to participate on site and also virtually online, and to share many of the experiences that you have had, and also for your dedication, not only for the actual commuting, traveling, and making the effort in taking the time to listen and sharing. And I wrote down a few things. I will do a little bit of a tour of these 2 days. We had different presentations. I want to highlight some of you who know me. I'm passionate about sustainable purchasing and procurement. I think the advance and progress when it comes to procurement, even though it's a small sample, very valuable. And from health without harm, we typically and usually speak about preventive medicine. We try to avoid generating waste, energy consumption, and the waste of resources. So to take into account the progress we have had with suppliers and the use of tools and resources that we have developed, that Andre was mentioning, of the project and work we have been doing in health without harm. Also technologies that you have mentioned, and the knowledge that in this instance is available to everyone. I also highlight the work done on safety, popular type of markets or marketplaces. I think integrating, incorporating the community is wonderful. I think it's within the plastic substitution panel, single-use plastics, and the concern about health and the importance as to knowing what we are using, why are we using it for, to question what is being offered to us in the healthcare system, and not to allow ourselves to be deceived or to be fooled as to using our own experience. And we are facing a climate change, environmental crisis, ecological crisis. Obviously, not only do I say it, but many scientists say it. So without precedence. So to share these experiences, and also we are still in time to continue growing as a health sector and to continue providing a quality service, adapted, resilient, and well implemented. I think that no one has any doubts. The Dr. Hardinger said in her presentation, trust science. Now that we know it, let's act. Now that we know about the climate change impacts and how it affects them and how our countries are impacted, here we have examples. Can you hear me well? Here we have examples that the healthcare sector is working, is acting. And evidence is the Minister of Health in Colombia and HMOs with regard to the carbon footprint. And I will follow up as to what Andres said, not with the same words, but with the facts. The measuring to understand and to understand to act. As you mentioned it yesterday, it is a global program. The solutions are global, multilateral. It reaches and touches and affects all countries. So we're being urged to act locally as to what we can do and how we're doing it. Our panel members and guests have told us how we can recycle, we can adjust and make therapeutic changes, and the leveraging of textile waste and using a circular economy. Alexandra told us about the experiences in progress in Brazil when it comes to the global agenda for healthy hospitals, energy objectives, working with suppliers, and specifically the work that the Lebanese hospital in the redesign of packaging for cleaning products. Also to be able to calculate the emissions when it comes to patient care, and what was mentioned today, one of the big topics that comes about and that we often see it in training and the use of tools of the impact of the climate change, and also about initiatives that the cardio infant clinic Copsana, and I highlight the work articulated that La Alianza Clinic or hospital has with their workers, collaborators, officers, who are the example to yield and cause a change, cultural change. The world is moved through or by energy, and our health entities use energy 24/7, multiplied 365. And the clinic hospital in Brazil, the type of work they have faced when it comes to improving energy consumption. And after that, this is a big task. The biblical clinic, thinking about what's coming, to be able to influence habits and the work that collaborators do. So the work they have done related to the anesthesiology context, they give us a real concrete specific fact. The same service can be provided with products of low heating levels with low environmental impact. If we increase the number of surgeries, is it possible to increase the amount of services and to reduce the emissions that are generated? I congratulate Andres for that work and the questions that come about after listening to these talks, in particular for us next year to design webinars or meetings. But I celebrate this because these are the discussions and the debates we have to bring about to evolve, as Martha said at one point. What are the questions that we need to evolve and not to fall into a pitfall or myths? And during the afternoon, we addressed objectives about leadership, to go back to the origin, to the simplicity. I celebrate the experience of La Instancia Clinic and the State Department San Antonio de Pitalito Hospital. I think we got contagious when this was addressed. And also the healthcare service with an intercultural approach, the respect that we must show to indigenous communities, and that healthcare service and attention can be provided and given with different dimensions, different approaches, taking into account the culture and the context of the community and the reality that we all are living and experiencing, especially in Latin America. But all these experiences to understand the reality in which we have immersed ourselves. So like the type of services toward the community and towards the territories or regions. And we close with this panel about challenges and opportunities when it comes to public policies in sustainability in the healthcare system. I had to write all this down because I was not going to remember it. Those of you who are part of the development process and public policies and regulations have seen during these 2 days. Along these 2 days, the work that has been done on a local territorial level by our leaders, our general managers, our coordinators who are united. They have a common goal, and I think we have opened up a door so that they can use this information as reference and be able to articulate so that these policies and this type of empirical, practical, and knowledge type of experiences can be used effectively and with different methodologies, consultation mechanisms, either to users or professionals. In conclusion, and to close, this is very important. We do not have to invent powder. There's much work already done. You are the stars and protagonists, and we, Health Without Harm, all of us, we have this wonderful task to open up and create spaces for you to share something as significant, valuable, very significant, valuable to be able to share. I think last night you hear me or heard me, and for these 2 days to have the opportunity, surely there are many other members of the network, the global network, who have joined us virtually, and they are also working on the global agenda. We invite them all to join us so that we can improve the report that we do annually, so that they can contact each other and contact us through our networks, emails, website, so that we can socialize your experience, so that we can also share those synergies to link, articulate, and relate to each other, to make sure that we know change is possible. And from the healthcare system, from Health Without Harm, we have the pleasure and the honor to be here to support you and be agents of change. So, for all of you, an applause that you so well deserve.
Bueno, ahora le damos la...
Well, now Rodolfo will speak, the director, hospitality director. Good afternoon, everybody. It's a pleasure to have you here for us in Méderi. Well, I have come to speak to you a little bit. Distinguished friends, in the name of our directive group, our director, Mr. Enrique Rubio, we thank you for being part of this 5th conference. It has been an honor and a privilege to count with your presence. During this conference, we have been witness to the work you have put, the effort towards achieving this. Everything has been inspired, and in this cause that we are facing, we need significant changes. And in the field of health and the collaboration between countries, they can make a real change. We are completely convinced that we can really make a change for our communities and patients. As far as we know, in this, we have established new alliances and work as a group to find new ways to face the challenges and find the best practices and find a way to improve our system. We will work with our view that our compromise with sustainability and with health take us forward to keeping it up with the passion. And you are truly the people who are creating a new future, and I encourage you to be part of this team and be real examples of sustainability. From Méderi, I want to share with you these bags. I thank you again for participating in this South American encounter, and I desire you all a safe trip to your homes, and I hope that we can go beyond the efforts of the future. Let's create a healthier and greener future. Thank you very much.
Muchísimas gracias.
Thank you very much, Rodolfo, and to all of the team in Méderi. I think we all join with this. We are so grateful with everything that happened here. Let's thank also to all the team that are translating right now, so from English, and also the streaming partners. And we were able to make this conference a hybrid conference.
Bien, pues con eso concluyó formalmente la quinta conferencia.
With this, we are concluding and closing officially our fifth Latin American conference of the Global Network of Green and Healthy Hospitals. You will get on the screen a QR code so that you can then give us feedback. And also, we will spend about 10 minutes reflecting as to what you have learned. And also, we are inviting those of you who are following up and are still connected. We already have some comments and feedback in our chat room. Congratulations to all the organizers, visitors, to all healthcare professionals on a short and long-term basis. Thank you very much, Francis, also for Chile. Thank you, Francisca. Lorangel Villegas Verdú, thank you very much for this space. Each one of us actually doing incidents from a social, environmental success and blessings. Ernesto Perez Valladares, thank you for the information that you shared. Congratulations to Health Without Harm from Peru, Maria Fernanda Sanchez. Congratulations for the quality of the content in your presentations. Greetings from Costa Rica. We want to now find out if someone here in the room wants to share. What was your experience? What have you learned? And don't go, don't leave. Give us a few minutes so that you can listen to us. If someone else wants to make a closing comment, you are welcomed. Let's start up front with Ms. Torres from Austral, Argentina.
Quiero agradecer realmente estos espacios a lo largo de los años, siempre fueron enriquecedores.
These spaces were always spaces of cooperation and happiness. This is one of the great problematics that I have in terms of the environment. I would like to bring and to think about the subject, also the relationship with animals and other broader subject. And we should think about which one are the principal contaminants in the hospitals. I am very happy to see you all, you guys. You know, you are my friends. Thank you very much. Thank you very much, Vero. We will take note and we should address the theme of latex in future conferences. Good afternoon. I want to thank you all for Salud Sin Daño for having created this conference in this event. It's my first year here in the whole net of green hospitals. And I was commenting with some partners that this conference really changes. Many think that it's impossible, that nobody listens to us. But we, the ecological engineers, we are in charge of everything. And to see that others also do the same, we still look for innovation. And this makes me feel more rich. And I'm living this activity with a lot of energy.
¿Alguien más? Sí, Lina. Lina de Secretaría de Salud.
Lina, the Secretary of Health from Cali.
Hola, Lina de Secretaría de Salud.
Lina, Secretary of Health from Cali. I'm living very happy. A year ago, I had the possibility to meet you, and I have seen the evolution and the impact that is every time greater. And I'm very happy that I am seeing faces that I haven't seen in a long time. And that this labor of sharing our experience and seeing how they open our vision and they inspire us to join us and to others to join in this effort. And every time, I hope this conference is bigger and bigger, gets bigger and bigger. And also, I'm very happy to see so many professions that are taking part of the subject of the environment. Well, many new faces and very old faces. It's very great. Maria Villagra calls and says, thank you very much. Thank you, Magra. Will Aguilar, excellent event. The hybrid was a great methodology.
Gracias. Andrea Villalba.
It's very important to thanks everybody to share their practice. Maria Virginia Yanis, thank you very much. It was very motivating. Thank you. And Alexander Quiroga, thank you, and many thank you for this great event. In the room, is there anybody who wants to speak?
Buenas tardes.
Good afternoon. From Panama, Dr. Yarelis. Well, I'm definitely living very happy, and I want to talk with my chief, and I want to show him everything that I discover here. And he told me to take note of everything because we have to implement all of this. I am really living very emotionated because I got new tools and I found new knowledge that I can turn into action. And I am so happy to hear people talking how to make this estimation. And I can use this in Panama. And we can influence the ministry and and take this step forward. We are we have a great compromise with the environment. Thank you so much. Okay, let's take two more, and I will read from the chat. Guillermo Reyes, thank you so much from Cubio. Jose Ivan, a great event. Thank you so much for sharing with us. Well, okay, good afternoon. My name is Silvia Trujillo. I come from Pitalito. This is a great learning. experience of learning. I am living very happy. There's so many ideas and so much information, but it shows me that I'm not alone, that there's so many that are in this process, and I want to make a point in the point that I am part of the academia. I'm a ecological engineer and I work with university. So for me, the ideas here are very important in this case. And I'm fascinated with all the investigations and processes, all those prints that we leave. And and I feel very close to you guys, even though I am with the academy. From my heart, thank you very much.
Pero de látex tomamos nota de adentrarnos un poco más de cómo
Let's take note on how can we include these subjects from an academic education. Okay, let me just a second. Hello. Well, first, thank you very much. These encounters are really, really constructive. I feel like we created value in this co-creation. Where I come from, we don't have, so many experts in the field. So when we come here, we learn from all of you. We are just medics and pharmaceutics making a footprint. And I feel like this great generosity that comes from so many countries. And I am so thankful for these encounters because I grow in my learning. Jose Ivan says, thank you for this experience of knowledge. Juan Gallardo, thank you very much. It was so great to participate. Now let's see the facts. Let's see how you do it. I am at your service to see. I am from the hospital in Chile. Magnificent event. Thank you, doctor, from CBC Mexico. Excellent work. All of your experience makes us very inspired from Ecuador. Okay, Monica, you are the last one. I am very happy. It really transcended the expectative that I had. I believe that these spaces are really enriching and we really many times we are not aware of how great this is. Sharing all this knowledge and these physical hugs that we give each other. Thank you so much for existing. I am so amazed. Well, with jeringas sin aguja, many people have been asking me, and I have been telling them that the syringe without the needle is something much cheaper. So literally, I am making a card so my colleagues can read it and we can all sign it and send it to the factory so they sell it to us, that is 20% cheaper, and we can solicit that they give it to us and they sell it to us without the needle. For those who are interested, we already wrote the letter in Méderi, and we are going to rotate it to see how we do. Remember that avoids guardians, avoids the needing, and it's 20% cheaper. So the letter is out there. Please sign it. Have a
Muchísimas gracias a Mónica de Fundación.
Thank you, Monica, from Foundation Valley of Lily.
Carolina Gil Pose, quien es nuestra directora de...
Carolina is our director for programs for American Latinx without health, without harm. When we finish, please don't leave. We need just a minute. Don't leave just yet. Thank you very much, Andrea. Before closing, I want to acknowledge and thank to the Health Without Harm team in South America, Andrea Hurtado Epstein, Jacqueline Tapia, Claudia Paz, Diego Pelufo, our communications consultant, who was heavily, actively working, coordinating with the streaming, to Paulina Escobar, who also supported us. For us, really, it's an honor, and it has been a huge satisfaction. After so much time, after the pandemic, everything we have been through, after listening to everything that you went through during those complicated years, which have consequences, to be able to meet again. During these 2 days, we have spoken and talked about technical aspects, technical vocabulary. We have discussed and talked to you, engineers, nurses, medics, doctors. For these closings, I want to talk to people, to persons, for you to take a moment and to look around you, to breathe in and to feel and sense the energy that we have put together, people who are online as well, and that during those difficult hardship moments, to resort to this, to what you're building, contact each other, write to each other, ask for help, think about collective actions, like the ones that Monica, this is what it's going to transform the world. I simply invite you, capture this energy, take this very positive energy, and fully enjoy everything that you're building. Thank you very much.
Well, this is it. I'm just going to add myself to the feeling of gratefulness. Thank you for all the people that were with us, both in line and in presence. Thank you so much.
Si nos esperan un minuto quienes están en sala, necesitamos que cierre el streaming, por favor. ¿Podemos esperar un minutito, por favor? Perdonen, estas son cosas nuevas de esto de hacer un evento híbrido.